Good evening. My name is Doug Hanto, and I am the chair of the Surgical Ethics Working Group in the Center for Bioethics at Harvard Medical School. On behalf of the Surgical Ethics Working Group, I would like to welcome everyone to our third Harvard Surgical Ethics Conference, Ethical Considerations in Surgical Innovation. Over 1,000 individuals have registered for the conference from around the world, and we would like to thank you for getting up early, staying up late, and taking time off from work or leisure to join us this evening. I believe we have an exciting hour and a half ahead of us. I would like to review a few housekeeping items before introducing our moderator, Dr. Louise King, who will introduce our topic for this evening and our speakers. First, we would ask that you submit any questions that you have during the conference using the Q&A feature found in the meeting controls at the bottom of your screen. We would ask that you not use the chat room for asking questions. Selected questions will be discussed after all the presentations have been completed, or you may continue the conversation on Twitter using hashtag HMSBioethics. If you have any technical issues, please use the chat feature to send a message to all panelists, and a staff member will be available to help you. If you are interested in upcoming events, news, or education programs, you may subscribe to the Center for Bioethics email at bioethics.hms.harvard.edu/subscribe. And finally, just a reminder that following tonight's conference, the talks as well as the panel discussion will be available on the Center for Bioethics YouTube channel. Without any further ado, I'd like to get us started this evening. First, I would like to introduce Dr. Louise King, who has JD and MD degrees. She is currently an assistant professor of obstetrics, gynecology, and reproductive biology at Harvard Medical School. She is Director of Research, Minimally Invasive Gynecologic Surgery, Associate Program Director for the Fellowship in Minimally Invasive Gynecologic Surgery at the Brigham and Women's Hospital in Boston. She is also Director of Reproductive Bioethics in the Center for Bioethics and co-director of the Medical Ethics and Essentials of the Profession course for first-year Harvard Medical and Harvard Dental students. Her areas of interest in medical ethics are broad, but focus on questions of informed decision-making and assisted reproduction, as well as equitable access to advanced gynecologic surgery. We're honored to have Dr. King with us tonight to moderate this evening's session. Dr. King?
Thank you so much. That was such a kind introduction. I'm so grateful, and I'm so happy tonight to be here to talk about this topic. It's one that I'm deeply passionate about in my own area of gynecologic surgery, and I've been lucky enough to have sort of a preview of these talks as we've met to prepare for tonight. I think you're going to find them very, very interesting. I'll be moderating the chat as best I can. I have my own questions for the speakers, and I will weave in as many questions as I can from the questions that you submit. So it's my honor right now to introduce Richard White, who is the Vice Chair of Surgery at Beth Israel Deaconess Medical Center, Professor of Surgery at Harvard Medical School. He received his MD from the University of Pittsburgh and MBA from Wharton. He's interested in bioethical issues pertaining to the field of surgery, particularly cardiothoracics. He is on the ethics committee of two national surgical organizations, the Society for Thoracic Surgeons, and where he is the chair, and the American College of Surgeons. I'm also lucky enough to say that he was a mentor to me in my years at BIDMC. I was so grateful, and remains one today, but so grateful for the time he spent with me, inviting me to his office, talking about surgical ethics, providing me support and encouragement. He's an incredible person, and I'm looking forward to his talk.
Louise, thank you very much for the kind introduction. Let me just share my screen, just get this set up fairly quickly. There we go. Well, welcome everybody to the session this evening. I hope you find it interesting. As Dr. King mentioned, I'm a thoracic surgeon and vice chair of surgery at Beth Israel Deaconess, and have had a long interest in the ethics of surgical innovation. I will start out by saying that I have no disclosures. And I'll point out that this session on surgical innovation has three components. I'll be presenting a fairly high-level look at the ethics of surgical innovation, focusing on the ethical principles and more generalized areas of ethical debate. My colleagues, Dr. Teresa Williamson, Dr. John Meyer, and Dr. Martin McNeely will then focus on some specific examples. While the word cloud shown here presents a number of concepts associated with innovation, both the Oxford English Dictionary and the Merriam-Webster Dictionary define innovation as the introduction of new things, ideas, or ways of doing things. And in this spirit, I'd like to posit that as a surgeon, some level of innovation is commonplace and arguably essential. While I was tempted to start the presentation with a case, the introduction of minimally invasive surgery or robotic surgery as a replacement for open chest or abdominal surgery, or the use of extracorporeal membrane oxygenation as a bridge to lung transplant, or the introduction of aortic valve replacement by transcatheter devices rather than traditional open surgery using cardiopulmonary bypass. You're going to hear some of these things in the second and third portions of the talk. Furthermore, I think that you can use your own experiences in surgery to look at current surgical techniques, and I think you'd be hard-pressed to come up with many examples of things that were done exactly the same way that they were done 20 or 30 years ago. Now, while this shows the results of innovation on a macroscopic level, at the level of the individual surgeon, each of us have adapted our surgical techniques and decided what level of evidence is sufficient for us to make that change. While you may take the statement that innovation in surgery is essential as a postulate, there are a number of ethical frameworks that we can use to examine the statement. For example, if one chooses a consequentialist approach to ethics, meaning that what is right or wrong depends on the outcome or intended outcome of an action, the desired outcome of a surgical procedure is an improved state of health. Given that current surgical techniques are not perfect, nor are all surgical outcomes perfect, it would be a good thing to do to devise new and better ways of doing things. As the primary focus, if the primary focus is on the individual, the surgeon's obligation is to provide an optimal outcome for that patient. If one takes a more communitarian view, the obligation of the surgeon is to provide optimal surgical care to the community as a whole. Again, our current techniques are great for some conditions, but clearly wanting for others. In other words, there's clearly room for improvement, and it would be our obligation to pursue those opportunities, but more with the best interests of the community in mind, rather than those of a specific individual patient. If one chooses a deontological or duty-based approach to the analysis of ethical issues, we have obligations to provide our patients the best care possible. Our duties are codified in descriptions of the physician-patient relationship, which involves fidelity or loyalty, among other things, meaning that we have a fiduciary duty to put the patient's interests above our own. Again, since we know that surgical outcomes are currently not ideal, one could conclude that it's in the patient's best interest to improve upon our current armamentarium of techniques and devices. Interestingly, while a specific patient or clinical problem may stimulate the idea for a clinical innovation, the pursuit of that innovation is probably made more with the interests of future patients in mind. Also, while many of our obligations as physicians and surgeons are to our patients, we are all members of a profession, and professionals have certain obligations. While the obvious one is that which I've alluded to above, a fiduciary duty to our patients, it's been argued that these obligations include not only having and practicing a specialized body of knowledge and skill, but to apply that skill and knowledge to the betterment of society and to the advancement of the professional field. Finally, from a virtues ethics perspective, or what would a truly virtuous surgeon do, there would be an obligation to recognize the limitations of what we can currently offer our patients and to pursue better approaches to the diseases that we treat. Who would argue that the truly virtuous physician would be satisfied with the status quo? So whether one takes a consequentialist approach, a deontological approach, or a virtues ethics approach, as they say, all roads lead to Rome, and it's our obligation to improve upon the current state of the art of surgery. But we've omitted one of the common approaches, and that's the principalist view. And I think many students in the US are quite familiar with this text, Principles of Biomedical Ethics. I think that perhaps in other countries, it's not so widely used. But it uses the familiar Beecham and Childress quartet of autonomy, beneficence, non-maleficence or minimization of harm, and justice. The principle of beneficence obligates us to improve upon the current conditions. That said, as we cannot predict the future regarding new devices, techniques, or ideas, the potential for harm or that which we are trying to avoid through non-maleficence is lurking behind the veil of good intentions. Now, while I will come back to the principles of autonomy and justice, both of which are important in the discussion of innovation in surgery, I'll first focus on the balance of the goal to be beneficent with the risk of doing harm. Can the individual surgeon be trusted to balance opposing forces for the potential for good versus the potential for harm? Perhaps a truly virtuous surgeon could, but most of us are mere mortals and we have our own biases, agendas, and perspectives. If one has developed a new surgical device, for example, is it not natural to want it to work? Does that introduce bias in its assessment, particularly if the initial assessment is non-quantitative? While most of us get excited about doing new things, it's possible that such excitement can lead to looking at the innovative thing through rose-colored glasses, and either in foresight or retrospectively focus on the upsides rather than the downsides. Now, digressing slightly from the issue of the potential for benefit from the potential for harm is the issue of patient autonomy. While the concept of autonomy is multifaceted, one of the issues is that of informed consent, meaning that the patient has some understanding of the issue at hand, as well as the options for treatment and the relative risks and benefits of those options. In the context of standard operations, the risks and benefits of the procedures are well known, as are the rationale and intricacies, which are well characterized and can be presented to the patient at whatever level he or she desires. But in the context of innovative surgical care, the relative risks and benefits may be less well characterized. How would we pose the risks of the innovation to the patient, particularly since at the outset, these risks may be largely unknown? And for a new technique involving innovative and complex new technology, how do we even know what the patient wants or needs to know? Is it sufficient to simply ask the patient to trust the surgeon and to make the right decision? And while this may be applicable in the emergency situation, for instance, the case is going poorly and all normal avenues for salvaging things are exhausted and the patient may die, an innovative approach may be completely appropriate. But really, how often does this really happen? And aren't most opportunities for innovation known well in advance? Finally, there is the issue that if the surgeon has a vested interest in a new device or technique, might this cause him or her to downplay the potential for harm? So this leads to the discussion of the oversight of innovation. And some of the questions I've posed, the answers to them lie in the area of incremental innovation and with some level of oversight. Now, while none of us enjoy being under the microscope, I would say that some level of oversight of innovative surgical techniques is probably necessary. While some innovations are done really without patient consent, particularly those that are urgent in nature, or to the surgeon's perspective, rather minimal, I choose to use a new stapler or suture, for example, or I do my anastomosis a little bit differently. For many of these changes or innovations, there's been a body of predicate investigative work that makes my modification reasonable. In other words, I have expert knowledge that the patient doesn't have. But while expert knowledge is an essential characteristic of being a professional, along with it goes the responsibility to use the knowledge wisely, reasonably, and in the patient's best interests. While I probably shouldn't bring in a new instrument from my garage to try on a patient, it's probably completely reasonable to use a commercially available device, particularly if there is literature support in its use in a similar situation. But again, what about the first time it's used? Again, for commercially available devices, there's usually a regulatory process that justifies change. But again, it generally boils down to the potential for benefit versus the potential for harm. So I think that we see a distinction between trivial innovation and non-trivial and trivial innovation, as well as a distinction between planned innovation and an essential or urgent one. So if the innovation is both planned and not trivial, some element of oversight is arguably essential. An unbiased assessment done through the lens of peers or others with expert knowledge can be protective of both the surgeon and the patient. Who else besides the patient and the surgeon has a vested interest in the act of innovation? Well, at some level, the general public does have an interest, thus leading to a regulatory process. On the other hand, I don't think that we generally allow the general public to micromanage physician-patient interactions. The hospital where we practice also has a vested interest, as it is responsible for what occurs within its wall, and it has an interest in preventing unreasonable and perhaps even dangerous practices. Now, further along the lines of oversight of innovation, I'd like to point out what some institutions have done, and I have a picture here of Dr. Shav Kasavji from the Toronto General Hospital, who's made some remarkable innovations in the field of lung transplantation. Dr. Kasavji, a number of years ago, introduced a surgical innovations committee at Toronto General, whereby new procedures are vetted for appropriateness. The approach has the obvious attractive feature that proposed innovations are scrutinized by a body of peers, primarily surgeons, but also others in the operating room environment, those who are likely to share a common body of expert knowledge and to have a similar appreciation for the needs of innovation. On the other hand, a group of similarly minded individuals may be more prone to groupthink, and a lack of diverse input may lead to conclusions that, while they may seem right to a group of surgeons, may not be so well received by other physicians or the lay public. The concept of the Surgical Innovation Committee has apparently been adopted successfully by other institutions, some of which have come up with centers of innovation. Some of these are focused on peer review and support of innovation, and others seem more focused on research around innovative approaches to surgical technology and are designed to foster improved interactions with industry. In other institutions, including my own, new procedures need to be approved by the Medical Executive Committee, which is the medical staff committee spanning the breadth of the hospital's specialties. While this encompasses a broad-based or diverse set of perspectives, a shortcoming is that the actual surgical component may be quite small. Furthermore, as many people will either know or will experience, hospital committees can be rather inefficient. And at least in my institution, the line between a new procedure and a modification to an existing one can get quite unclear. While it might be reasonable to have every surgeon who wants to use a surgical robot trained in and credentialed in the use of the robot, does it really make sense to make a, quote, robotic lobectomy a new procedure when a thoracoscopic lobectomy has been done for 25 years? This being roughly the same operation, but with hand-operated instruments rather than robotically or remotely controlled instruments. Or what about when a new robot becomes available? If every time we change robots, we have to call it a new procedure, we'll spend our lives dealing with the Medical Executive Committee and not actually getting anything done. If one of our colorectal surgeons does a procedure with a new single port robot, when he normally does it with several ports and an older device, is this a new procedure? Some would have argued yes, others no. While these may seem like fairly straightforward questions with straightforward answers to surgeons, they are not so straightforward to non-surgeons, let alone lay people who often provide oversight to medical leadership. Finally, I'd like to point out that the National Academy of Science, what was the Institute of Medicine, has recently established a task force to examine how medical and surgical innovation is conducted in the US and how to define best practices. So while we have considered surgical innovation committees, medical executive committee, and hospital board committees, is there a role for human subjects research committees or IRBs to weigh in on surgical innovation? In the context of IRBs, we generally consider research to involve the generation of generalizable knowledge and to involve fairly rigid protocols. Not everything to do with human subjects is research, and not all research deals with human subjects, but the IRB typically deals with the interaction of research and human subjects. Now, while some surgeons at some institutions may want to study a new technique, i.e. research, others simply want to do what others have done and have been found to be beneficial. Now, certainly a systematic analysis of an innovative technique would require IRB approval, but innovation, like quality improvement, is often continuous and not taken in large steps. So one can easily argue that IRBs are probably not well suited to the processes involving continuous change. Finally, in terms of regulatory oversight, I would bring this example to the front. The recent transplant of a genetically modified pig heart to a human. This was done at the University of Maryland roughly 3 months ago. Now, this wasn't considered research. This was certainly innovative, and its approval involved the Food and Drug Administration, presumably in addition to some institutional approval. Now, why the FDA? Well, this is because by statute, the FDA has oversight of the administration of biological products, and certainly a genetically modified pig heart would be considered biological. In the case in question, the FDA provided emergency authorization under compassionate use criteria for the use of the pig heart. Now, the FDA also provides oversight for some other innovative devices, such as certain types of endografts, under their investigational device exemption pathway, or IDE pathway. And it's interesting to note that while early trials of many new devices are conducted in countries other than the US, one has to ask if this is solely because the regulatory burden is lower in other countries, and they're not all third world countries, I might add. It could also be that the risk-benefit ratio or availability of what we call standard treatment is different in other countries. Finally, I'd like to invoke the concept of justice. We've talked about autonomy, we talked about beneficence and non-maleficence. In terms of justice, who gets access to innovative approaches to surgical disease? And this is another fertile area for ethical discussion. While we have heard of and read about racial and socioeconomic healthcare disparities in this country, how does one ensure that the benefits of an innovative approaches to surgical care are distributed in an equitable and just fashion? Unfortunately, allocating the benefits equitably probably also means allocating the risks similarly, as it's obviously patently unfair to assign the benefits to one group and the risk to another. Given the uneven access to healthcare, unequal levels of trust in the medical establishment, differential reimbursement mechanisms often based on insurance, and the obvious fact that innovative techniques by their very nature are that they are new, low in volume, and geographically limited, makes it difficult to distribute, at least initially, an innovative technique on a wide level playing field. Yet these issues must clearly be considered by both the surgeon and the institution involved. So with that, and while there are many other questions, such as when is an innovative approach justified, there's just not enough time to do this now. I'll conclude my broad strokes and high-level discussion, and will now turn the podium over to my colleagues. And I thank you all for your attention.
Thank you so much for that excellent overview. And we're going to have questions at the end. I haven't seen any in the Q&A function of Zoom. Remember, that's where to put your questions. And it's labeled Q&A, I believe, at the very bottom of your screen. It's my honor right now to introduce Teresa Williamson. She is a neurosurgeon and surgical ethics researcher who cares for people with all types of spine disorders, as well as brain and spinal trauma. Dr. Williamson is a graduate of Yale College, where she played varsity soccer, I learned as I prepared this, and Yale Medical School. She came to MGH, one of our affiliate hospitals, from Duke University, where she completed her neurosurgery residency and then her orthopedic surgery complex spine fellowship. She also completed the University of Chicago McLean and American College of Surgeons Surgical Ethical Fellowship in 2021. Her research focus is neurosurgical decision-making and patient-doctor communication, and she also focuses on healthcare disparities. She's a member of the Center for Outcomes and Patient Safety in Surgery, which is abbreviated COMPASS, at MGH. And I'm just getting to know Dr. Williamson. It's such a pleasure to get to know her in some of our working groups, and I'm very much looking forward to her talk.
Thank you so much, Dr. King. I'm going to go ahead and share my screen. Okay, so thank you so much for that introduction. I'm Teresa Williamson. As Dr. King mentioned, I'm a neurosurgeon at Mass General and work at the Harvard Center for Bioethics. I'm going to talk a little bit today about implementation of new devices in the operating room, and I'm going to give you my perspective as a relatively new spine attending surgeon. So I'll start off with my disclosures because we're talking about new device implementation and what's appropriate and what's conflict. And so I do have a disclosure, and that's that I'm a consultant with DePuy Synthes, which is a spine technology company. And I think that's important for you to know because, in spine surgery, we have really close relationships with industry. We have, tables and tables of instrumentation every time we do a surgery, from screws to rods to, different devices to put in cages. And it's important for us from an educational standpoint, from an innovation standpoint, from a patient care standpoint, to have some type of a relationship with industry. The question is, when does that relationship go too far, and how do we best manage it in an ethically appropriate manner? So this is me in the OR, and I'll show where those relationships can be a bit challenging. So while I'm in the OR, I'm working here with a resident. We're actually working on a new technology, taking care of a patient using augmented reality to put in pedicle screws. And this is my email inbox that I'm going to come to when I get out of the operating room. And so I'll just read you a couple of the examples of things that, might be said from an industry representative about a surgery that, they may want me to do, or, a technique that they may want me to use. So your business is extremely important to me, and I want to build a relationship where you can trust us for all your needs from an instrumentation standpoint and technology front. I was curious if you had thought about our MIS screw system and if there's anything in particular holding you back from giving it a try. And then this is in reference to a new technology that they were interested in me trying. Here is the fill in the blank new technology surgery training certification quiz. Just start the exam. So there's a lot of reasons why, my inbox is flooded with new technologies and new ideas, and some of them are related to patient care and really innovating in the space of improving our care for spine patients. And then some are frankly financial. So spine surgery, a single spine surgery costs on average $75,000 to complete in the United States. And overall, it's a $90 billion industry and expenditures yearly in the US. So when we're thinking about balancing such a large financial gain field with a critical need to take care of patients with back pain being sort of the largest disabler worldwide for patients, we have to think of some really critical ethical questions. The first is, should there be a relationship with industry? If there is, which devices should I try? How much training as a surgeon am I obligated to pursue prior to implementing a new device? And then how do we go about monitoring that device for safety and ensuring that we're doing the right thing as we use it? So when I think about the relationships that I'm forming in the operating room with industry representatives, I put them into sort of categories, and I make sure to think about commercial relationships and what's appropriate there, as well as what is conflict of interest. And so I like this definition that comes from the ophthalmologist that talks about commercial relationships and basically the principle of beneficence and non-maleficence, that patient care must not be affected by economic interest in, commitment to, or benefit from professionally related commercial enterprises. And then further, a conflict of interest being where your professional judgment should not be influenced by other interests of the provider, whether that those be financial, publications, participation in trials, etc. And that's, can be challenging, because I'd like to point out that in a typical spine surgery, we use a lot of technology. And so how to manage those relationships is really important, rather than just sort of separating yourself from those relationships. And I'll show you on this picture why I can't separate myself. So this is a patient that had a large spine surgery. This patient in particular had prior surgery, had serious pain, weakness, and needed an extension of their fusion, meaning putting screws and rods in their back, as well as decompression to free up the nerves. So in order to set up this whole space, we have a CT scanner in the operating room that's operated by one company. We have augmented reality to navigate the screws. That's another company. We have a table or two of instrumentation of screws and rods, et cetera, and that's a third company. So those representatives are often present in the operating room, and we have to be forthcoming with our patients about that. And so knowing that we have a lot of technology to use, and that, in order to use it safely and efficiently, it's constantly changing. Not everyone is trained or familiar, particularly nursing staff, with all the different types of instrumentation. So we know that we have to have some type of relationship. The question is how. And so the things that I think are important are to be forthcoming with the patient. So, they're vulnerable, they're under anesthesia, and you want to make sure that you're not doing any harm to them. And so we actually put on our consent form that there's going to be industry representatives in the room with them. And I actually, beyond just reading letting them read the consent form, I will actually mention that fact to them and tell them which companies are going to be there, so that that's fully disclosed. I mentioned not being able to really rush that separation between industry and medicine, but that it's important to discuss the benefits of having an industry representative there with your patient. And then there's the other side of things, which is not letting things get too far. And so we don't want to rush to replace clinical judgment with industry judgment, particularly given the possibility for financial conflicts of interest. So this is an interesting article out of the Hastings Center that I would recommend to you, that talks about industry technicians being embedded in clinical teams, and times at which device salespeople are sort of taking over the case, in the sense that the surgeon is unclear on how to proceed without their help. And then we have to think about how actually that device got into our hands, and how it got into our operating room, and should it be there? Because when you're evaluating a new device, you want to make sure that it truly is doing something better for the patient. It's innovative in some way, that's adding something, and that it's sort of free from bias in how that process has been evaluated. And so this is an article from the Boston Globe that talked about how many Boston hospital CEOs sit on healthcare company boards. And there's nothing, special about Boston. There's certainly a role for surgeons and doctors to be part of companies, because without us, it's really hard to inform change in clinical care and to figure out what the needs are for new things and new devices. But it's important to remember, what type of bias may or may not be playing a role in the decision to, as Dr. White mentioned, use that new robot. That was a big capital expenditure, and there's a motivation for it to be used. Or as a junior surgeon, I often will have people come to me and say, try this device, and they may or may not be financially sort of have stockholders in that company or consultants for that company. And it's just something to keep in mind. It can be a place where getting multiple opinions, where hearing from your colleagues about a new technology can be really helpful to sort of mitigate that bias coming from one view to use a certain device. So in summary, as I think about using new techniques post-training, now that I'm a new attending, these are sort of some rules that I've thought of in my head. And thinking about them through an ethically guided framework. So a new technology should have a benefit. It should be better, or at least thought to be better than what you were using before. If you're getting ready to use something, you should be competent at using that, meaning you should be agile at troubleshooting and figuring out, exactly how things work. You shouldn't be fully dependent on a salesperson. And that a competence is actually comes from commitment to formal study of that device, not just from certification. So if you remember that email that I got about, just a 10-question quiz, that's not sufficient if you want to use a new device. And then it's really important as you go to use that device, and I'll use an example in a second, to think about patient selection and, thinking about the process of how you're going to select a patient who can be well informed and can understand what they're taking on in terms of a novel innovation, but also doing that in a way that you're making sure is equitable and you're getting good resources to all patients. When you're thinking about the process of informed consent with a new technology, especially we have lots of patients that come to us as surgeons, as spine surgeons, that are very vulnerable. They're in a lot of pain. They're really, really eager to get better. And so that vulnerability can beget eagerness to participate with a new device. And so you need to be cautious of that and also make sure that we're giving enough sort of informed information about the risks of a procedure. And then this concept that research is research. And so when you're bringing in a new device, really need to be sure that you're not doing research. And if you are, that it's gone through the appropriate IRB processes. Just to talk a little bit about that new device process. So currently in the US, we use the 510(k) pathway for devices with moderate risk that are considered to be just a small change from a prior device. But that process has come under a lot of scrutiny because it's a way that a significant, at least a third of the devices come into the US ORs. But it's not totally clear that that process does a good job of evaluating new technologies. And so the Institute of Medicine was actually tasked in 2010 and 2011 to look at our current process and look at what I've highlighted in red are some of the, what I think are really ethically from a individual patient and also public health ethics standpoint, very important. So how do we optimally protect patients, promote innovation, and support public health, doing the best for the common good? And if we're not doing that, what are the processes to do so? So they wrote a report on it and really said that this is not a new device process that we should be using, but rather we really have to be careful that this is just looking at devices that are very, very similar to those that were used before. And I think they overall called for some changes to that process. And there's a lot of people, probably a lot on this call even, that would be critical of this process and want us to make sure that we're thinking through guidelines as to how we're using new devices. And so I'll give you an example of a case that I had earlier in my practice that, where I used a new device and where it can go well and where it can not go well and how I mitigated that process. And so this was a patient with a degenerative spine disease who had 2 levels that needed to be treated, meaning 2 lumbar vertebrae were degenerated and causing his symptoms. Typically, when I do this surgery, you have to go through the front of the belly and sometimes the side and the back as well. And so there's a new procedure from a certain company that allows you to just go through sort of anterolaterally and potentially saves the patient positioning, operating room time, a smaller incision, a smaller surgical corridor. So there's some early evidence that this would be beneficial. I talked to the patient about, very frankly, in the consent conversation about the fact that I had never done one of these procedures before, that I had been trained and had done cadaver labs and was working with a surgeon who had done the exposures before, but that this would be my first case of this type of surgery. And even in this case, they had a video, the company had a video that I think was really helpful to share with the patient, and he watched it and he actually had some really great questions about anatomy and possible complications after that to make me feel very comfortable that he had a good idea of what was going on. Unfortunately, during his surgery, we got into a small bleeder, but it was really difficult to contain in a small sort of surgical corridor, and we ended up converting the surgery to open. So I think the question there, and I think that if we were open from the beginning, I think it's important to note that if, using this new technology probably made it more difficult to correct that problem. And made his surgery longer, his blood loss higher, certainly a surgical complication that we discussed with him afterwards. So I think the question is, should I do that surgery again? Does that mean that this new technology is not worthwhile? Does it need to be reported? And I'll be frank, as a new surgeon, I didn't really know. We obviously presented it in our internal conferences of morbidity and mortality, but who do you report it to, or where do you go? And so it was actually a process to learn, how to report a complication with a new device, and obviously reporting it to the company. They may or may not have the incentive to move forward with that information. And then I discussed it with my senior colleagues and those that I knew had done the case before, just to make sure that we were sharing our experiences and making sure that if there was a trend, we weren't, proceeding to just do this case if it potentially caused more harm than good. So learning from that experience and from the literature on implementation of new devices, these are some things that I think are really important. When you draft guidelines or when you propose a new device, it should be free of bias. And so including folks that are, not necessarily financially tied to the particular device in decision-making, seeking multiple opinions, as I mentioned in the last case, making sure there's adequate data prior to transitioning that into a full clinical practice or standard, and then making sure there is long-term oversight, both institutionally and on the sort of national or international level, to think about how we're going to log data to say, if there are sort of poor outcomes or complications from this particular intervention. There's several groups that have thought about this and published on it. So this is the Responsible Development and Application of Surgical Innovations position statement that talks about how to define a new innovation, which I think is part of that challenge when you think about like the 510(k) pathway, and then talks about setting up institutional committees and registries in order to track information when you bring in a new device. The IDEAL framework was recently published in JAMA, which similarly talks about how to look at the quality of evidence before using a new device, and how to implement a new device if you feel like it's appropriately innovative and safe. So in summary, as I look, as a surgeon who works in an industry that is very financially beneficial, but also really beneficial to patients in terms of the ability to treat and improve people's quality of life, there's a balance between the role of relationships with industry. And so that relationship, I believe, should be an ethically guided one with the patient first, thinking about how we can do the best for our patients. When we think about implementing new devices, which devices do I try? The answer is the better ones. So devices that have a potential for improved outcome or shorter lengths of stay, better patient experience. How much training is enough training? I think that's defined by competence. So making sure that you actually have the ability to understand how to use and how to navigate a device. And then how do we monitor device safety? We have data and registries and guidelines that involve multiple opinions and multiple sources without bias. So thanks so much, and I look forward to taking questions after all the talks.
Thank you so much. I just want to say, Dr. Williamson, thank you for sharing your experience in such an open and honest way. We all know that that's very hard to do. But it's exceptionally helpful for the people listening in and trying to learn about these topics to be able to hear your personal perspective of this in such a way. So I'm really grateful to you for sharing that. We have a few questions coming in that I'm going to be working to collate together for everyone towards the end. I'm about to introduce two people at once, just to give you context as I do these introductions, and then we'll have our final speakers together. John Meyer is a graduate of Yale Medical School, and he trained in general and cardiothoracic surgery at the University of Minnesota. He's a professor of surgery at Harvard Medical School and the first Tommy Kaplan Chair in Cardiovascular Studies at Boston Children's Hospital. He's interested in health policy and has served as a Society of Thoracic Surgeons representative to the AMA Relative Value Update Committee. And by the way, there was some questions in the chat about how these things get paid and how we determine how they get paid. And that's the committee the relative value update, or RVU committee that does make those types of determinations, as well as other very important committee work that guides our practice. He's the past president of the Society of Thoracic Surgeons and past chair of the finance committee of the same group, and does a lot of work with that group to help guide us again in policy decision-making. Has been such an important member of our working group, contributing wonderful comments about all of our work as we share together and move some of these projects that we're all working on forward. And I'd also like to introduce Martin McNeely. He served as the professor of, well, I have to preface, first of all, I don't think I can do justice to this introduction because the list of accolades is quite long. And Dr. McNeely has served as our leader of this group until very recently. And he's been an incredible mentor to me as I've explored areas of ethics and surgery. But I'll give you a snippet of some of his accomplishments. He served as professor of surgery and chief of the Division of Cardiothoracic Surgery at Albany Medical Center, and later as chair of the Division of Thoracic Surgery at University of Toronto and Toronto General Hospital, co-chair of the American College of Surgeons Committee on Emerging Surgical Technology, director of the American Board of Thoracic Surgery, president of the Thoracic Surgery Foundation for Research and Education, chairman of the Ethics Committee of the American Association for Thoracic Surgery, and ethics editor of the Journal of the same. He's working with colleagues from our Bioethics Center and the University of Global Health Equity in Butaro, Rwanda, to establish an intensive course in global ethics for the students at this new medical school, which was established by the late Paul Farmer and his colleagues at Partners in Health. That's only one of the many things that he contributes to our community here at the center. And I'm so grateful to him for all his guidance and mentorship. So without further ado, I'll turn it over to our speakers.
Can everyone see my slides, I hope? I'm John Meyer, and we're going to take a slightly different perspective, and that is the perspective of almost, if you will, an organizational ethics perspective, trying to understand the role of professional medical societies in the implementation and dissemination of innovative devices. And we'll use a case of the introduction of transcatheter aortic valve replacement, so-called TAVR, as a new way of replacing one of the heart's valves, the aortic valve, as sort of a case example. So I have no disclosures. And I'd like to start by just reminding everyone about what the roles and responsibilities are for a profession. So the professions are charged with maintaining, advancing, and disseminating a body of knowledge, and to advance that knowledge that is innovate. And in so doing, analyze critically and report the results. Professional societies are required to self-regulate, to place patients' interests above their own, and to place performance above personal reward. And finally, a responsibility to fairly distribute finite medical resources. So the case, as we are describing, is this introduction of transcatheter valves into the US market. And the promise of this technology was that a heart valve could be replaced with a much less invasive method and could actually be done during a heart catheterization rather than an open heart operation, which would mean the patients did not need to have an incision in their chest. There was no need for using a heart-lung machine and stopping the heart to carry out this procedure, and offered, because of the less invasive aspect of this to have a shorter hospital stay and be less morbid for the patients. The uncertainties at the outset, though, was how well these new devices were going to work. And this slide will just demonstrate to you what some of these devices look like. So this is a typical surgically implanted aortic valve over here in the upper left corner, which would require an open heart operation, as I said. This in the upper right-hand corner is the transcatheter valve, which can be sort of compressed down, as demonstrated in the illustration in the left lower quarter of your screen. And so it can be compressed down around a balloon catheter, and then passed through an artery, typically in the groin, up into the position in the aortic valve. The balloon expanded, as is shown both in this X-ray picture here in the middle, as well as this cartoon here in the lower right part of your screen. But basically to expand this valve into the aortic position, and then would be deployed without a problem. So our case involves what happened at the beginning, if you will, of the introduction of this device into the US market. There were actually at least two devices that were being pursued and marketed by two different US companies. The background is that these devices had already been approved in Europe. They've been given the CE mark, which is the equivalent of FDA approval. And although initially they had been treated as somewhat experimental and were placed initially in high-risk patients, but very quickly, when it appeared that they seemed to work at least reasonably well, they were disseminated throughout all patients needing this type of valve replacement, including much lower risk and much healthier patients at the start. And the early results actually indicated that the complication rates were higher for those patients than they were in a comparable surgical patient population. So applications had been placed by both of these companies for the FDA to approve and for Medicare to pay for this because this disease process, aortic valve disease, is more common in the Medicare age population in the United States, that is over 65. So there were a number of obvious potential conflicts. On the one hand, this would be a new procedure for the cardiologist, so there would be an opportunity to effectively increase one's practice and generate more revenue. And the cardiologists were frequently the ones who were identifying the disease to start with, and there's the whole issue of self-referral for monetary gain. At least that argument could be made. Conversely, for the surgeons who traditionally had owned this area, that is, it required an operation to replace a heart valve, this was a big threat because if all the patients were having procedures done by somebody else, that would mean there would be a loss of revenue. Both situations representing significant conflicts of interest between what was potentially good for the patient, although that was still in doubt, and versus what was good for the individual surgeon or cardiologist. The regulatory issues were a little bit muddy in the sense that multiple US entities, regulatory entities, are involved. So the FDA assesses devices for safety and efficacy, whereas Medicare has to make payment decisions, particularly for this patient population in this age group. And then the issue ultimately was this device was not inexpensive. In fact, was just for the device, forget the hospitalization and the professional fees and everything else. The device alone was at least $30,000 in costs. So there clearly were an abundance of potential conflicts of interest, as I've already outlined. There was the potential for adverse effects on patients. And as profession, the members of that profession have duties to patients, as you've already heard Dr. White talk about. There was a significant question about patient selection and how much the patients should be allowed to choose what form of treatment they got. There were clearly the obvious potential for turf wars between a medical specialty and a surgical specialty. And from a professional society perspective, there was a significant potential for legal liability in the sense that if this was not an entirely free trade, if you will, sort of process, then there was the potential for antitrust issues to be raised, as well as the obvious and ongoing issue about medical malpractice, particularly when you're doing something new. So given that I was in the leadership of the thoracic surgical group, so-called STS, when these issues were coming up, we were faced with several choices. We could do nothing and leave this decision up to the government agencies who, without being too pejorative, frequently don't have a lot of experience with clinical medical issues. We could leave it up to the payers, and that is both Medicare as well as private payers. There was obvious potential for turf protection by writing guidelines that would favor one or the other approach. Or the third option was whether or not these two potentially competitive societies, one representing the cardiologists, the ACC, and one representing cardiothoracic surgery, the STS, could actually collaborate and try to make sure that this technology was introduced in a rational fashion. But the professional societies have their own internal conflicts and ethical obligations, which included not only duties to their members, but also duties to patients and duties to society. And of course, most ethical controversies arise when the pursuit of one or the other of a duty actually puts an organization in internal conflict with itself. So what happened and what we did was we actually recognized, based on that European experience, the potential for significant adverse patient outcomes. And following my time in the leadership of the STS, Dr. Michael Mack became the president a year or two later. And he has an interesting background as both a cardiac surgeon, but also as a trained internal medicine physician prior to his surgical career. And his counterpart at the American College of Cardiology is Dr. David Holmes, who is an interventional cardiologist. So clearly, the leadership of these two professional groups were on opposite sides, if you will, of the procedure. And importantly, one of our surgeon members had actually taken a position for a year at Medicare, where he was actually had a major decision-making role in how the payment decisions in particular would be made by the agency. And his background you can see there, but he and I both had been through the Kennedy School course on government relations, executive course at the same time, sat next to each other. And so we had a close working relationship. So what emerged through this collaboration across potentially conflicting or competing societies was the following. There was an agreement to begin with a randomized trial, which would be the only way that any patients would get access to the new device here in the United States. And this was actually a comparison of surgical valve replacement versus the transcatheter valve replacement, appropriately named the PARTNER trial, which included informed consent that was uniform, required local IRB approval, but also the collaboration between the two professional societies established several requirements that the regulatory agencies, particularly the FDA as well as Medicare, actually bought into. And one of them was that there would be heart teams established, which would give equal footing to both the cardiologist and the surgeon in evaluating patients and also in actually carrying out these procedures. The number of sites where these procedures could be done were limited. And there were some criteria agreed on in order to qualify a given center for being able to participate in this trial. And an existing database that has been maintained by the Society of Thoracic Surgeons for quality improvement purposes was used to generate the risk model that would allow us to classify patients in particular for the initial phase, which was the high risk phase, so-called PARTNER 1, where patients who were thought to be at high surgical risk would then qualify for this trial. And then based on those initial results in that higher risk group, then subsequent trials involved gradually loosening the patient eligibility criteria. And as part of trying to generate new knowledge, a collaborative registry was established that followed all patients, was committed to publishing the results as they emerged from the trials. And remarkably enough, this registry actually was supported by the device manufacturers. So this example, which I think is probably somewhat unique, at least in American medicine, did achieve several of the professional societies' responsibilities. It certainly helped to maintain and advance knowledge, to introduce and evaluate innovation. It represented clear-cut self-regulation such that not every cardiologist or surgeon in the country could qualify as a participant. There were standards that were set. Ultimately, the collective belief was that we actually were serving the patient's interests because of the lack of certainty about many aspects of this device. We certainly were interested in performance above personal reward because not every one could go out and do these procedures and enhance their remuneration. And in a sense, this provided the basis for fairly distributing our finite medical resources, because the door was not thrown open wide with the rapid dissemination of this technology as had occurred in Europe. with potentially at least some compromise of the patient's best interests. So I would argue that we have demonstrated through this case that new technology can be rationally and ethically introduced at a nationwide level, accomplishing the goals of advancing knowledge and minimizing patient risk. And as evidence for that, the results from the transcatheter valve now are equivalent to those of the surgical valve, at least in the United States. There was an ability to demonstrate cost effectiveness, and I would argue this provides a template potentially for future innovations to be introduced. Professional society collaboration and leadership were essential. And I think it's actually, in retrospect, it was a remarkable public-private partnership between the potentially competing professional medical societies, federal government agencies, and even the device manufacturers. Now, there are a number of questions that we could always put on our rose-colored glasses and say, of course, this is exactly the way we should do things going forward. But I think I would pose the questions: was this an ethically appropriate role for the professional societies to take? Was the way that this was rolled out in the United States, particularly beginning with high-risk patients and a randomized controlled trial, actually equitable? Lower risk patients were initially denied access to the new technology. And conversely, one might argue that the high-risk patients were in some ways unfairly exploited. And finally, I leave you with this question about whether or not the audience feels that this represents a reproducible template that should be the basis for the introduction of other new technologies, particularly in this country. Thank you.
I'm Martin McNeely, John's partner on this short trip. I have no financial conflicts to disclose, but I must disclose that I've operated on uncountable numbers of patients using innovative technologies and procedures, often with fully informed consent, though many patients don't want to know the amount of detail that was disclosed in most of the talks that you've heard earlier. Next slide. Over 60 years ago, I chose the University of Minnesota for surgical training because of its reputation for innovation in surgical treatment. 68 years ago, Walt Lillehei and Richard Varco performed an innovative open heart operation to close a ventricular septal defect in a 1-year-old boy, Gregory Glidden. Gregory's father, Lyman, was connected to perfuse Gregory's body with oxygenated blood while his heart was repaired. You can see the two operating tables side by side. The heart-lung machine was not yet sufficiently developed. In the past 7 decades, we have advanced to the point where a minimal incision over an artery and a catheter enclosed valve can be placed in the beating heart without a chest incision or heart-lung bypass, as John Meyer has described. I've taken us back to Gregory's operation to remind us of the courage and persistence of the heroes of surgical innovation, particularly the patients and their parents, and the pioneering surgical teams Also, their overseers, all are part of a moral community. The issue of oversight of innovation is evolving, as outlined by Dr. White. Who should review and approve the interventions that depart from conventional standards of practice? For Dr. Lillehei in the 1950s, the chief of surgery, Dr. Owen Wangenstein, gave his permission with a note on Dr. Lillehei's door that said, "By all means, go ahead. Good luck." It's become more complicated since then. Approval of a surgical innovation committee, such as the one based on the Toronto model, provides the oversight in many departments. As Dr. White mentioned, the Surgical Executive Committee at our hospital, the Beth Israel Deaconess, serves this function. The Toronto Surgical Innovation Committee has been active for many years. It is described in the reference at the foot of this slide and will be available in the course materials. Many centers have asked their institutional ethics review boards to serve as surgical oversight. As surgical treatment becomes more complex, specialized committees working in concert with the IRB are evolving. In the United States, the Federal Food and Drug Administration and recently the National Academy of Medicine are providing oversight. Two closing thoughts about innovation. We're currently celebrating the development of an mRNA vaccine against a lethal pandemic disease, a seemingly near miraculous innovation. While we celebrate this accomplishment, we need to improve it beyond disposable sterile needles distributed throughout the world and sterile syringes and an electrically powered cold chain. It is a communitarian, we celebrate this accomplishment, but we realize that we must improve it to the level of applying a stable oral vaccine, which would overcome the geographic and socioeconomic hurdles still before us. The COVID vaccine, the TAVR that Dr. Meyer described, and open heart surgery in general are examples of collaboration of the government, industry, and clinical care. It is a communitarian, not an individualistic approach to innovation for the common good that provides a framework for the heroes of innovation to succeed. In this menacing time in our history, it has been inspiring for us preparing this course, and for you participants. It is hopeful for all of us to gather together in the Surgical Innovation Conference and celebrate these accomplishments. Thank you for your attention.
Thank you so much for all these wonderful presentations. As I've been monitoring the Q&A and thinking through what you've presented, you've given us an overview of the ethical constructs and frameworks that we should consider as we think about surgical innovation. And you've identified the stakeholders, patients, ourselves as surgeons, and industry who may be pushing forward for these innovative techniques. And within those stakeholders and probably others we can all identify, there will be certain conflicts. So you can imagine that our questions are all centering around these conflicts of interest that arise and how each of you might resolve those conflicts. And the questions are nuanced and try to come at various ways in which these conflicts do arise. So let's lead off with a question for Dr. Williamson. As you're talking about the new technology that you'll be incorporating into your work, two questions come up. How do you decide, and you addressed this briefly, you said you try to pick things that have good outcomes, but then how do you decide if something is, and I'll quote the question, a new innovation, truly with promise, and not a fad? And then building upon that, as you're bringing that forward, how do you decide when you're competent enough to undertake your first non-mentored procedure? You talked about the consent process, but how do you personally figure that out? And those are the different conflicts that can arise in this area.
Yeah, thanks for those questions. They're really tough ones that I think, especially as a new surgeon, I think really have been relevant. I think when I was in training, I didn't really have to make those decisions. I got to do the cool stuff, but I didn't have to make those decisions. And so that's something that's very new. I think in terms of the question of whether or not it's a fad, I think this is really a critical question. So, because there are a lot of fads. There's like, a new device for everything. Why don't you try this screw? Of course, when you're in an industry that's making this much money, a lot of people are going to want to develop something there. I look for things that actually there's a need. So the example that I use of the lateral surgery, we spend 45 minutes in the operating room flipping the patient from one position to another position. So that's something that slows down the operating room. It makes the patient have more anesthesia time. It's, positioning, there are positioning injuries. So when I see that there's a need and then there's an actual solution to a need, I think that that's where I feel like it's not a fad and it's more of an innovation. That doesn't mean it's always going to work or be better. And I think you do have to be willing to accept that you picked something that may have been a fad, even though you thought it was an innovation, and get rid of it. Don't stick with that technology. I remember doing some cases in training where we had, multiple x-ray machines coming in, all to use this like one piece of new technology. And it turned out that it actually wasn't helpful. And so I think if you're not conflicted, it makes it a lot easier to just move forward. That didn't really work. And then I think my other way to tell the difference is I ask a ton of questions of the reps, and they probably get a little bit annoyed by me. But I think if you're an annoying surgeon to a rep, it's probably a good thing, because you're asking so many questions to really interrogate whether or not it's helpful. Similarly, with being competent, I actually like to know how to use it myself. I like to know how to load a pedicle screw, how to, when I started using the O-arm, they were just like, oh, it's just a CT scanner. It works like all the other CT scanners. And I was like, no. If I'm there at 3 o'clock in the morning, so I have like physically drove the machine myself, figured out like, okay, if this gets stuck, how are we going to get the patient out? And so I think that at the end of the day, you're responsible for everything that happens in the OR. And so you have to feel comfortable that you can take accountability and have the skills to deal with that technology. It doesn't mean that you can't have help to make things more efficient, but you certainly are the last line of defense. And so I use that sort of as my marker as to whether or not I would feel comfortable doing a procedure.
Thank you so much. So building upon that, we've had a series of 4 questions that sort of build on the conflicts as they arise, both in the OR with industry reps present in the room, and then further forward into the fact that we're essentially working with, or maybe even for companies, these industry companies that are deriving significant financial benefit. And sometimes we're as consultants, but sometimes just purely in terms of the surgeries that we perform. And then another layer on top of that, raised by one other commenter, was how do you keep balance in corporate hospitals and the sustainability of hospitals, the pressure to use certain technology from the hospital itself. So I would love to hear anybody. I'm summarizing questions that were put into the chat just in the interest of time, but thinking about those different layers of interpersonal relationships or relationships with industry or relationships with corporate hospitals, and how do we navigate all those conflicts as they arise? And that's for anybody who would like to join
in. I'll give a quick general answer. John illustrated a collaborative approach that was very attractive to me. And I'll take the somewhat controversial position that we need more industry working with us as surgery is getting more complex, care is getting more complex, and we shouldn't be worrying about industry as some kind of alien presence that's dangerous for patients. The more we work with them and teach them how to deal with the fiduciary issues, the better off everybody will be.
And
I think
just-
I'd,
No, go ahead,
sorry,
Dr.
I totally agree. And those relationships can be really complex. And that's why I brought up like the emails in the beginning, because it is pressure, right? To have that relationship with industry. And I think, someone asked about that, how do you balance that being in the OR? And I think that there is a real role, and I hope that I, kind of said that in my talk, to have people there. And so I do feel like in the ideal world, it's a pretty professional relationship. I think often reps will try to make it a little bit more of a personal relationship so that you do feel a little bit more guilt when you are or are not using something that they want you to use. And I feel like in my short time as an attending, I've learned to not let those relationships be anything more than professional, so that, you don't feel guilty when you're thinking like, oh my goodness, I know they're have a new kid on the way, maybe I should use their company, or I don't want them to go out of business. Maybe I should, and so that you can really evaluate things. But I think they should absolutely be there.
Dr. Meyer.
Yeah, I would just add that although it may not be quite as apparent, but clearly there are even industry relationships at the professional society level. There are initiatives at the sort of professional society wide level that are supported by industry. There has been a role for professional societies to conduct educational sessions that primarily are, directed at maybe learning how to use new techniques and new technologies, such as the ones that we described. I can tell you that the device makers for that transcatheter aortic valve were not very happy with the professional societies when it was to be not a free open market rollout, but rather it would be done in a controlled fashion. And yet ultimately they came around and actually, as I indicated, helped support the registry because they actually needed the data as well to demonstrate safety and efficacy for further FDA level approvals. So it became a nice confluence of interests and a great partnership, which, beginning at the, when it was first, these discussions were first being held, it was not so apparent that the interests would actually all be aligned. And ultimately, at the end of the day, I think what sort of carried the day was, we're all obligated to do what's best for the patients. And that really became the sort of unifying theme for guiding how it was that we would go forward.
Thank you, Dr. Meyer. I think you've answered a pretty direct question in the chat, which was, essentially, is industry ever truly patient first aligned, in the sense that they have such a strong financial incentive to proceed forward with continually moving more and more technology forward and more expensive options. But as you noted in your case presentation and in your discussion just now, at the end of the day, with the type of collaboration that you've described, you were able to ensure at least that industry that may already have had good intentions for the patient population was truly patient aligned and ethically focused on the patient first. Is that correct?
I would say that's a good summary. Yes, thank you.
And so someone had proposed that perhaps, so thinking again about this relationship with industry, these are multi-billion-dollar companies. Is there a role, though, in these relationships that we have with industry to not engage with them in any financial way whatsoever? So there's been some people who've proposed, one person proposed in the chat, that we just certainly can't have any financial relationship with industry whatsoever. And at first blush, I'm thinking of consultation fees, but of course we're paid to do the surgeries. We have incentives to do these surgeries that are financial as well. You could get quite into the weeds trying to define where that relationship could even end. Does anybody have a comment about that? Perhaps Dr. McNeely, because I know that you're very much in favor of having continued relationships with industry, and I do see the benefit from that.
Well, I was inspired from those early closure of ventricular septal defects, which when patched, occasionally the conduction system was injured, requiring the invention of the pacemaker. And so the whole pacemaker industry grew out of collaboration between the Medtronic company and the surgeons at the University of Minnesota. That kind of collaboration was inspiring to me to watch, and it can go on, as I'm sure Teresa experiences with the spine companies. If it's a thoroughly patient-oriented, patient-motivated collaboration, then it's a winner for all of us.
Any other comments on that point?
So I think, Louise, it's important to realize that the companies are there to make a profit, to make money for their shareholders. If they didn't do that, they would go out of business. So their business is to generate, in some cases, new and innovative surgical products. And if they fail at that, they'll go out of business and there won't be any new innovative surgical products. So I think that they may have a bias to the success of their various products, but in no way are they interested in just pushing failing devices on people, because in the long run, it's going to come back to bite them. So I don't think that they're sort of the evil empire. And I think that many of these innovative technologies would not exist were it not for industry, which supports them, which funds them, that pays the bills for these long regulatory processes. And obviously they need to get something back in the end. They're not charities. But I think along a similar line, one of the questions here had to do with corporate hospitals. And I think it's important to realize that corporate hospitals are there that have to make money, but not-for-profit hospitals are definitely not there to make a loss. Because if they make a loss year after year, they go out of business too. So everybody has to do things that to some extent are in the patient's interest and some extent are in their own best interest in terms simply of existence. That's where some of the controversies, but from the individual physician standpoint, it's probably important to keep your eye on the ball and put your effort toward your patients. And if you think that something innovative is going to help them, then it's fine to do.
I think that's a great summary. Dr. Meyer?
Yeah, I would just point out the other role that industry has served, certainly in the cardiovascular realm, and I think in a lot of other realms, and that is, one of us might get a good idea or think of a new way to do things, but to actually carry that forward through the regulatory processes that Dr. White was describing and through actually making sure that the device is reliably manufactured and comes out sterile and comes, for insertion and all of those sorts of things that, us physician surgeon types don't have any experience or expertise with. It does require a real collaborative relationship and a real partnership, if you will, almost in order to bring some of these good ideas to clinical application widely.
Yeah, that's an excellent point. The complexities are not things that we can address easily outside of this current system and relationship with industry that we have, both from a regulatory standpoint and passing those hurdles, but just in designing things that are so complex as well. We've come up against the time. I'm a little bit over, and I apologize for that. I guess there was one question we didn't address that it naturally flows from our conversation, so I'll send you off with it to ponder. which was how can we find a balance between continuously advancing surgical technologies, which we've all said we really want to do, while also improving the availability of more basic surgical resources to areas in need. And so, building upon our commitment to understanding disparities in access, we've talked about all these high cost and pushing the boundaries there, but also we always need to keep our eye on the prize, or eye on the ball, as Dr. White was saying, and be sure that we are putting our patients first. And that means ensuring access to surgery in the first instance, even the less technologically advanced. I would just want to thank all of our presenters tonight, and I'll turn it over to Dr. Hanto. I'm so grateful to have been part of this conversation with each of you.
Thank you very much, Dr. King. I would like to reiterate and thank our presenters tonight, Drs. White, Williamson, Meyer, and McNeely, for their outstanding and provocative discussion of the ethical considerations in surgical innovation. I would also like to thank all of you who listened tonight and asked questions of our expert panel. I would also like to thank Dr. King for moderating an excellent discussion with our panelists and covering the questions from the Q&A. I would also like to take an opportunity to thank Christine Mitchell, who's the Executive Director of the Center for Bioethics, for her involvement and support of this Harvard Surgical Ethics Conference, and also Dr. Robert Trug, who is the Director of the Center for Bioethics, for his support. Finally, I'd like to thank Ms. Troutman, Ms. Stefanides, and Mr. Amato for their technical, graphic, and organizational support of this conference. We couldn't have done it without their help. On behalf of the Surgical Ethics Working Group, we thank you for attending and hope you will join us next week on Monday, June 27th, for our final installment, Disparities in Surgery. And
we will also have you on video, and so we will be spotlighting you all as you all speak. And we begin. All right, welcome everyone to our Mental Health Matters, the era of empathetic entrepreneurship. I'm really looking forward to hosting you with my co-facilitators today, Salima and Dylan, who you'll learn more about very soon. But we have an hour together, feel comfortable. This is about well-being, so we want to make sure that you feel able to be yourselves in today's meeting. And if there's anything, please feel free to reach out to us through the chat. But I'll get right into it. If I could have the first slide go up, or second slide, as I speak through, firstly, an introduction, and then take you through what the agenda will look like for today. All right, so my name is Safia Abji. I am a trauma-informed coach and a well-being consultant based in Nairobi, Kenya. And my organization focuses on a human-centered approach to creating systems of work and how our values align with the work that we do. I founded my business almost 3 years ago, but have been based in Kenya for about 8 years. And although I was trained as a coach almost a decade ago, most of my coaching work was pro bono until I started my full-time practice. So during my time in Kenya, I worked for international NGOs and after many years within the management consulting industry in Canada. While in the development sector, and some of you may resonate with this, I worked with many youth in the economic inclusion space, and I'm actually a longtime friend and advocate for the Sandkelp Summit, as I've worked very closely with a number of entrepreneurs across East Africa. What I recognized during this time was that there's a gap between creating jobs and opportunities for young people and their diverse realities at home. In development work, there's often little consideration of the impacts of cultural and personal challenges that can create barriers to employment. From gender inequities to financial challenges, to access to technology and mentorship opportunities, to stigma towards the geography that they live in, and little understanding or investment on issues of mental health and needs in general, I was often getting asked for support as a coach first by my beneficiaries rather than for vocational training and employment support. The truth is that no matter where you come from, when you don't have the appropriate systems to support you as a whole human being, you only bring part of you to the job. This is an unsustainable and potentially destructive approach to economic inclusion interventions, as we are often supporting those who are looking for work to strengthen their sense of confidence and see it as a pathway to meaningful work. Sorry, guys. And so to meaningful work and growth. So as a result, I started my coaching practice and consulting business to focus on the systems we have in place already and how to be more inclusive in the solutions we create, not only focus on the bottom line, but actually those who contribute to it. I wanted to facilitate this session to put a spotlight on the topic of well-being in the workplace, because as much as this is being spoken about on the outside, especially since the impact of the pandemic, we are still not having important conversations within the spaces where transformation is possible and very required. Today, we'll provide a small taste of why we need to start scaling these conversations and create cultural shifts rather than a bandaged solution to rising issues of mental and emotional well-being. Now, thank you so much for listening to that. Before I move forward, I wanted to take you through slide 2, which is the agenda, so you know kind of what the flow of today will look like. Now, our flow will be very fluid. We have opportunities for Q&A at the end. So if you are, if we have a lot of questions and we're having a great conversation, we are happy to continue that moving forward. But also to let you know, we have a bit of a brainstorming exercise at the end to start thinking about workplace well-being. So once we're done with introductions today, we'll go into an icebreaker. We'll talk more about why well-being is becoming a priority in the workplace. We'll talk a little bit about your own personal well-being and assess that. And then we'll hear from Salima and Dylan on their own entrepreneurial journeys and why well-being has become important for them, as well as do some speaker Q&A. And at which point we'll do a bit of brainstorming around how to improve the culture of well-being in your workplace. All right, let me hand it over to Salima for introductions, and thank you all so much.
Hi, everyone. Nice to see everyone here. Thank you so much for having me. It's an honor. Thanks, Safia, for the lovely introduction. My name is Salima Villani, and I'm a 9-time founder. Some failed, some exited. Lots in my story we're going to share soon. A TEDx speaker and the best-selling award-winning author of this book, Innovation Starts with I, recently launched in November 2021. I'm also the founder and CEO of Ripple Impact, which is a business accelerator that helps entrepreneurs grow their businesses and scale their platforms. So essentially, we're the team behind the scenes to many entrepreneurs, helping them grow and scale their businesses. I also teach design thinking and entrepreneurship at Johns Hopkins University at the Graduate School for International Studies, and I often guest lecture at business schools. I'm also currently a student myself in the lead executive education program at Stanford University's Graduate School of Business. I contribute to Forbes. I talk a lot about innovation, entrepreneurship, remote team building, and I've been published in 15 different research publications between the World Bank and the Inter-American Development Bank. I have a previous career in international development, which is very much aligned with what I'm doing today, since we do work with entrepreneurs all over the world, especially in emerging markets. And I've done a lot of work on how to promote a circular economy and improve refugee livelihoods using hydroponics and water-saving climate-smart technologies. And I've done a lot with that in the MENA region, including insect farming, which is a new thing I've been up to. And why this session is important to me. So mental health has been a really important part of my own entrepreneurship journey. And it actually helped with the unleashing process, since a lot of us have to go through some sort of unleashing and coming out of the closet when it comes to, you know, finding ourselves or becoming ourselves as entrepreneurs, these new versions of ourselves. And I really resonate with the James Clear quote, which is, entrepreneurship is a personal growth engine disguised as a business pursuit. There's a lot there. And I love the title of the session with empathetic entrepreneurship, since I have a quote in my book, and it says that empathy is the undervalued stock that enables those who have it to be more successful in many areas than those who lack it. So very relevant in today's times, especially as we're coming out of the pandemic, and very excited to be here. Thank you.
All right, Dylan, over to you.
Fantastic. Thank you very much for having me here today. My name is Dylan Jerry. I'm from Cape Town, South Africa, and I founded a business in 2007 that does work in the live event space, predominantly with working with a lot of technicians, high staff turnover, and since then have evolved myself into furthering my studies in strategy, coaching, and really helping people understand emotional intelligence better. I am what I call a distracted entrepreneur, which means I like to get things going and then move on to the next thing. I felt that I needed to become an entrepreneur because school was challenging for me. I got 5% for maths in my final year and wasn't able to go to university. But in 2018, I was fortunate enough to finally make it to Harvard Business School, where I studied entrepreneurial strategy, and the following year became an accredited strategy summit facilitator. And I've been working with people all around the world since then, helping them set strategy in their business and helping them become leaders who empower the people in their business to become the best versions of themselves, which then allows business owners to step out of their businesses and work on it from a top-down approach rather than getting stuck in the operational side of business. So I'm very happy to be with you guys here today. Why am I here? And why is this session important to me? Well, I myself have struggled with many mental health challenges. And I think that sounds so shocking, you know, but mental health is very broad. I particularly struggled a lot with anxiety. I had my DNA sequenced in 2019, and I have the IL-1RN gene, which makes you more susceptible to depression. And through a lot of self-work, I have learned to realize that being positive and having an upbeat mindset takes a lot of daily work and daily habits. And although my friends are always shocked when I tell them that, you know, I have to do all this work to sort of make sure that I'm mentally in the right gear to face the world, they're like, that's so strange because you're always so positive and you always have such an upbeat mindset. And so I'm really hoping to share some of that and why it's important to you. I also am on a mission to live a life without fear. And that has really changed my life considerably, knowing that everything is going to be okay, no matter which direction it goes. So thank you for having me today. I look forward to engaging with all of you.
Thank you so much, Salima and Dylan. So many questions I already have for you and your friends of mine. So thanks for that great intro. Dylan, I thought we could get started with the icebreaker. Are we ready to go?
Absolutely. Yeah, absolutely. Thanks very much for allowing me this opportunity to do an icebreaker. For me, there's a couple of reasons to do this. I think we should all continue to develop our virtual event or virtual capabilities, everyone, it's become part of our daily lives. And even though in-person events are back in place, I think that virtual is here to stay. I think also that with a topic as deep as empathetic entrepreneurship, it's important for us to also get to know everyone in the room. So I want us to do an exercise together. And I really want to invite everyone to turn their cameras on right now. So don't worry, no one's going to have to say anything. No one's going to have to speak, but I really want to invite everyone to turn their cameras on. we can have everyone turn their cameras on. Hopefully we have some people turning their cameras on. There we go. Thank you, Elsie. And what we're going to do is I really just want us, we're a group of people that have never met each other. And I really want us to see if we can, in 2 or 3 minutes, get to have a more empathetic understanding and get to know people a little bit better through just a series of questions that I'm going to ask and we're going to answer via our cameras. So I want you guys to pick up a piece of paper. It's always better if it's a colored piece of paper because it makes the screen look really beautiful. And again, if you've just joined, I'm going to invite everyone to turn their cameras on and then block your camera with a piece of paper that is that you have on your desk. All right. If you want to leave your video off, that's fine. There is another option. You can use the raise hand functionality if it applies to you. I always like to do this seeing people's faces because it gets us to have a better connection. So what I'm going to do is I'm going to ask a couple of questions and I want you to, if that question is relevant to you, so if I ask you, do you prefer cats over dogs? If it's a yes for you, all I want you to do is click the raise hand button or remove the colored piece of paper. And over a series of questions, we will all get to know each other a little bit better. So for those people that don't want to turn on their cameras, if you can all just click your raise hand emoji or any of the emojis, you can click the heart emoji, any of those, just so that I know that you can hear us and that you can see us. Otherwise, we can start now. So let's cover up our screens. All right, everyone, cover up your screen with a colored piece of paper. And we're going to start with really a couple of really easy questions. So the first one is, do you have a tattoo? Do you have a tattoo? If you have any tattoos, click the raise your hand functionality or take away the piece of paper. All right, thank you very much. All right, let's reset and go to the next question. Were you born before the 1980s? Were you born before the 1980s? Okay. Thank you. Let's reset again. Were you born after the 1980s? Born after the 1980s. Okay. Lots more action there. All right, let's reset again. Another easy one, and then we'll take it one level deeper. Have you traveled or visited more than 4 continents? Have you traveled or visited more than 4 continents? Okay, we're seeing our travelers here. Thank you very much for sharing so far. Let's take it one level deeper. Have you ever been, so everyone just cover up again. Those that have raised their hands, drop your hands, cover up. Have you ever been arrested? Have you ever been arrested? All right. Thank you very much for sharing. All right, next one. Are you COVID vaccinated? Are you COVID vaccinated? All right. Thank you for the participation. I really appreciate everyone sharing. We're slowly starting to build a safe space and we're slowly starting to get to know each other a little bit better. Okay, here comes the next one. Let's reset, cover up our cameras again. Have you ever fallen in love at first sight? Have you ever fallen in love at first sight? All right, some smiles there. And I hope some great memories coming back there. All right, fantastic. All right, we're almost halfway through. I want to ask a couple more questions. Let's reset and cover up our cameras again. Do you get irritated when helping old people with technology? Do you get irritated when helping old people with technology? Okay, thank you. Thank you. All right, let's reset again and go one level deeper. This is the last round of questions. Are you currently experiencing grief? Are you currently experiencing grief? All right. Thank you very much for sharing that. All right, let's reset and lower our hands. Have you ever been a victim of abuse? Have you ever been a victim of abuse? Thank you so much for sharing. All right, let's lower our hands again. Have you ever felt guilt as a spouse? Have you ever felt guilt as a spouse? Thank you. All right. And last question, thank you so much for sharing. Let's reset. Are you curious to become a more aware person? Are you curious to become a more aware person? All right, well, that's fantastic. Thank you so much for sharing. And I hope that you've gotten to meet a couple of people, even though we haven't seen everyone's faces. I definitely have a better idea and I feel slightly more connected with everyone on this call. Safia, back to you.
Wow. I need a second to inhale and exhale. So if everybody wants to just take in what we experienced and just kind of enjoy what a beautiful intimacy that created in such a short time frame. And just exhale out so that you can come back present to the room. Thank you so much, Dylan. That was very powerful. Okay.
My pleasure.
Getting back into statistics and information to support the self-awareness piece, which it sounds like everybody wants to be a part of. If I could ask Parita to please put up slide 3 for us. We're moving on to why well-being is becoming a priority in the workplace. So here we go. Let me just minimize my screen. So the Great Resignation, quiet quitting, anti-hustle, what do they all have in common? A recognition that behind the work that we do, there is still a person who requires more than just treating their work as a reward. When your work feels like a transaction that doesn't connect to your deeper sense of self, so this would be your freedom of curiosity, exploration, connection, values, and purpose, employees will burn out from being treated like a means to an end. I'm sure you felt this way in your own career. And so this is a reminder in this session that we are all human first, and that is the thesis actually of empathetic leadership. So the slide on here is for you to take a snapshot of. You can read it while I'm going through it. I will touch upon this, but you'll see why they become relevant. And I really highlighted for you there, though, what the kind of key message is from each of them. We have issues of climate change, issues of war, oppression, the global pandemic. So beyond their obvious effects, these situations have taken a brutal toll on well-being. And for the younger generation, the impact is particularly stark. And that's something that we should all care about because we are living in a majority youthful world at this point in time. A recent survey reported that 52%, that's the majority of young adults, are experiencing feelings of depression or hopelessness. How do we achieve well-being in a world so overrun with crisis? One of the answers across generation has been quit your day job. Over the past 2 years, almost every industry has been impacted by the Great Resignation. Younger workers in lower paying industries such as retail, food services, and healthcare started the trend, and they were eventually joined by long tenured, higher paid employees from industries such as finance and technology. This phenomenon has prompted many companies to take a second look at burnout and well-being. According to the University of California, Berkeley, a psychologist there who did some of the earliest research on the topic, burnout occurs when emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment are all present simultaneously. In the words of your average worker, it's the result of being overworked and undervalued, as well as disconnected from a feeling that your job is actually important. While companies have turned to mindfulness rooms and unlimited time off as a way to combat the issue, which in my point of view, are just tactics to calm employees instead of addressing the key issues that are actually require the calming in the first place, neither is shaping up to be a long-term solution. The Great Place to Work Institute recently partnered with Johns Hopkins to study the well-being of more than 14,000 employees from 37 countries. What they found is that across people, places, and cultures, factors like personal support, a sense of purpose, and meaningful connections made the biggest difference to employees' health and happiness. If we could move to slide 4, I just wanted you to take a look at this because there's actually 5 dimensions. I'll just wait for that slide to shift, but there's actually 5 dimensions of employee well-being. And what the findings found is that personal support, a sense of purpose, and meaningful connection made a bigger difference. Parita, are we able to move to the next slide by any chance? Thank you so much. And so what's interesting about this, if you actually look at the slide, we spend a lot more time often on the mental and emotional support piece and financial health. So a lot of bandage solutions. And what we're hearing now is that if we actually deal with the root issues that create a sense of connection in the workplace, we may not actually have to spend so much other time on the other 2 dimensions. So that might be one of the biggest gifts of the Great Resignation. The conversation it has sparked around purpose, engagement, and organizational values. Surprised that so many workers were willing to sacrifice financial stability for more fulfilling work, many firms have been forced to ask, what can I do better? This is especially true as we learn that the majority of those who left their jobs don't regret doing so. A Harris Poll survey from March indicated that only 1 in 5 workers who quit a job in the past 2 years would make a different choice today. A better quality of life has left most with absolutely no desire to turn back the clock on their decision. The Washington Post followed up by interviewing some resignees late last year. While they were concerned with the current state of the economy, the vast majority are thrilled, quote, with the changes they've made to their work lives. The testimonials speak volumes to the importance of well-being. Quote, I may make half as much, but I feel like twice the person, said a former New York City chef who went on to get certified as a substance abuse counselor. Another quote, sorry, my screen keeps getting bigger. So in another quote, the stock market wiped out the equivalent of 1 year of my pension and I still have no regrets. The improvement in my personal happiness is priceless. This is from a former teacher in Florida who lost 10% of her pension by not waiting longer to retire. These testimonials illustrate something very important. Money doesn't drive retention. So according to the Great Place to Work, employees who experience high levels of well-being in the workplace are 3 times more likely to stick around. Being happy and healthy matters immensely. And for companies that understand this, purpose remains the vital lever. After all, people who say they are living their purpose report levels of well-being 5 times higher. That's huge, 5 times higher than those who say that they aren't. Connect employees to the value of their work and the challenges they face might not seem so daunting. So personally, being a coach who supports emotional freedom and purpose in my own practice over the past 10 years, whether I am coaching a C-level executive or someone climbing in the professional chain, 100% of the time, and that is no joke or exaggeration, there is a recognition that when your work is not connected to a deeper sense of self, the rewards of superficial success create more temporary feelings of fulfillment and begin encouraging questions of whether we are living in ways that make us truly alive. And when we start thinking about whether we're truly alive and awake in what we're doing, that starts to create a transition and transformation most of the time. Often, our work is actually a coping mechanism to hide from hard emotions we haven't fully recognized and dealt with. So from a trauma-informed approach, and if anybody has any questions on what trauma-informed work means, it will become much more popular, I think, in our daily jargon as we move forward. But a little bit of insight into some of the things that I deal with. So we have something we call high-level and low-level coping mechanisms. Your low-level coping mechanisms look like your traditional struggles, not that they should be traditional, but struggles like escaping from our realities through addiction to alcohol, to drugs. But high-level coping can look like addiction to work. It can look like addiction to accolades, to getting degrees, to going to the gym. These are things that our society still rewards, but they're still coping. So the pandemic has forced us to take a deeper look at our lives and how we are living them in ways that weren't sustainable to our long-term fulfillment, and with more recognition of how current employment systems aren't set up to address the emotional and personal freedoms we desire. The systems are now being forced to change. We need to start approaching ourselves, our teams, and our clients from a perspective of how they best contribute to the systems of our organization and reward them in ways that are meaningful. This includes viewing whole organizations built by whole humans and not just the roles that they play, especially when they spend the majority of their time thinking about completing and being at work. Okay, There was a lot in there. And there is a slide up right now. Those are the 3 dimensions that were the most significant to employee well-being. But what we're going to do now is move on to prioritizing our personal well-being. And we will be using the slide to help us with one of the polling questions. So hopefully we can keep it up there. But Parita, I would like us to launch our first polling question. So I hope everybody knows firstly that this is an anonymous, the answers are anonymous. But they are about you. So get comfortable. And your first question is, on a scale of 1 to 5, how would you rate your overall satisfaction with your mental and emotional health? So your personal well-being. 1 equals extremely unsatisfied and 5 equals extremely satisfied. Please answer now. Really interesting. So there's 22 of us in the room. If hopefully all 22 of us can vote, we can get a real good feel of who's in the room and how everyone's feeling. How do you feel about your mental and emotional health at this moment in time? Okay, we've got about half the room who's answered. Give it another 30 seconds. All right. Should we end the poll? We'll give it one more, maybe wait about 10 more seconds if anybody else wants to vote. Otherwise, we'll end the poll. Get your answers in there. Remember, they're anonymous. Okay, let's end it. So if we can see the findings, all right. So the majority was at 4, interesting. And then the next was at 3. This is very, very parallel to what I usually see in most rooms. So it just goes to show you that we're never quite at a 5 and quite at a 1, but we're usually somewhere in between. And there are various factors that will fluctuate this depending on what's happening on a daily basis. And so actually, it's a perfect segue to our next polling question. But if anybody wants to take a snapshot of this, by the way, this is not proprietary. Feel free to use this. You can take a snapshot. Otherwise, we can stop sharing that one and move on to the second polling question. All right, polling question number 2. On a scale of 1 to 5, how much of an impact does your work have on your personal well-being? So now this is, how does your work impact your personal well-being? If there's no impact, use a 1. If there's high impact, vote 5. Okay, I'm seeing these results coming in a lot faster. Feels like it might be really relevant to our audience. We have about 60% have voted. All right, so how is your work taking a toll on your personal well-being? High impact is a 5. About 10 more seconds to get the rest of the votes in. If we can have those remaining 7 people, please vote and get a good view of how we're feeling. Okay, let's end the poll there. All right, and the results are in. The majority are on the higher end of the spectrum, which is interesting. So we have many people who are feeling like their work life is contributing to how they're feeling on a daily basis. And one of the parallels that I wanted to draw here is that often, and this is what we were talking about through just why mental health is becoming more of a priority, or your well-being is, because quite literally, you know, we're hearing about burnout, we're hearing about resignation, we're hearing about quitting, but people aren't having these conversations. And a lot of the ways that we're now addressing these issues in the workplace are very much bandage solutions, right? We have, you know, mental health awareness weeks, we have events, we have, you know, a day off to be able to deal with the things that matter to you. But, you know, if we can actually shift the way that the environment is supporting your mental health, and that means any environment, not just your workplace, but any environment, we can actually start mitigating the risk to actually feeling some of the ways that we are. And so this just goes to show that for many of you, whether you're entrepreneurs, whether you're investors, whether you're accelerators, you still work within an organization and your work still impacts how you're feeling on a daily basis. And if this is relevant to you, it's definitely relevant to the many communities that you are connected to. All right. Our last polling question. So this is associated to the slide that is up, and it's based on the 3 dimensions that were mentioned in the research around the top 3 that contribute to employee well-being. So of the top 3 dimensions contributing to employee well-being, which factor makes the biggest difference to your health and happiness at work? So is it personal support? Is it a sense of purpose? Or is it meaningful connection? Personal support, a sense of purpose, or meaningful connections. Which one is the most relevant to your health and happiness at work? And think about your most recent experience. You know, what's really been weighing on you. It can be parallel to the last question. We're always moving in time. So how you're feeling at the moment, what's relevant to you at the moment. Okay. We have about 50 votes in. We can get a couple of more. We can get a really great view of how everyone is feeling. So what's relevant to you? Meaningful connection, personal support, sense of purpose. I'll give about 10 more seconds. Might be thinking through. Okay, we can end the poll there. All right, and so not surprising, I assumed this is what the answers would look like, a sense of purpose. We are in an entrepreneurship forum. Most of you are likely doing something you truly care about or are passionate about. So sense of purpose definitely aligns with that. Feeling every day that your work is meaningful and fulfilling because it actually aligns with your values. And so great to hear that many of you care about that and want to continue to support that factor of well-being in your workplace. All right, we can stop sharing the polls. Thank you for sharing the results and so much for your help, Parita. I so appreciate it. And now, without further ado, my favorite part of today is we are going to move on to our speaker stories. And this is what I call well-being wisdom, because for me, knowledge and wisdom, different things. We can learn things in school, we can hear about how experiences have affected people, but when we truly have experienced it and have had to learn how to deal with something, that is where all the wisdom comes in. So what greater way than to share from a personal perspective from 2 of my friends, but also really accomplished entrepreneurs, both Salima and Dylan. And so I'm going to hand it over to Salima to share. And our speakers are really going to go in today to talk about, the topic of well-being from their personal perspective as entrepreneurs and share their journey and lessons. And for those of you who have questions, feel free to put them in the chat box. We will address them. There'll be an opportunity for Q&A. And I'm looking forward to hearing that. All right, over to you, Salima.
Awesome. Thank you so much, Safia. So my story actually goes back to, let's say 2009, when I graduated from college and from McGill University, and I couldn't find a job in the economic crisis. I stayed in an attic in the Bronx and New York City. I tried looking everywhere and couldn't find a job. And so I ended up deciding to figure out how can I provide more value? How can I do something good for the world if I couldn't find a job? So I decided to volunteer, and that took me to Brazil to volunteer at an orphanage. However, I didn't end up at the orphanage immediately. What happened was the nonprofit director was like, well, Salima, I want you to be in Rio de Janeiro and start a language school to help support the orphanage because we're struggling here. Our infrastructure is falling apart. We don't have long-term volunteers. We need more money. If you can start this language school, we'll give you the resources, have a donor, and just get it up and running. And so that way the proceeds from the school can support the orphanage. And so in Rio de Janeiro, I didn't speak much Portuguese. I was speaking Portuñol, and got the school started, got a bunch of volunteers from around the world together. didn't know what I was doing at age 21, but managed to make it happen. And we were teaching all these different languages, as volunteers, and realized that our business model was failing because that wasn't the best strategy. We would have classes that sometimes only had one person or people weren't showing up. Then we pivoted, which is such an important process, and mental health is really, really key in that pivoting process as an entrepreneur. It's tough to accept that we were failing, but that also means that that challenge is an opportunity for reinvention. We ended up focusing on what we were good at, where we did have traction was, Portuguese for foreigners. We had the foreign students that were really, really interested in learning Portuguese and also supporting the orphanage. And that's when our business model shifted and took off. And we were able to start academic credit programs, homestays, extracurricular activities, all kinds of partnerships with Lonely Planet, et cetera. And the school became the top rated school in Rio de Janeiro, still exists today, became a for-profit actually from a nonprofit, and has a whole community. And that was a defining experience that really set the foundation for entrepreneurship in the very early stages of my career. I then ended up moving to Italy from Brazil. Love story there, it's in my book, but I ended up living in the south of Italy in a town called Reggio di Calabria, which is right across from Sicily. There was the mafia, there were bombs. It was a kind of crazy place to live, but no jobs. Again, 2009, I was now, turning 22 and just couldn't find a job. I tried cooking Italian food, but they didn't eat Caesar salad and fettuccine Alfredo there. I tried teaching English, but I didn't have a British accent. And after tons of rejection, I ended up fueling that into what can I do? And I went to the internet. My brother gave me some advice. Why don't you set up a profile on elance.com and start using your skills like languages, since I spoke some languages and could do translation work. I couldn't use my degree in international development. And I ended up starting it, turned into from a freelance translation, small gigs here and there, turned into a six-figure translation business within just a few months to help businesses go global and help them translate their websites. We could work in HTML. We couldn't even afford translation software. So what we did instead was, and this was my partner and I were doing this together, we actually had human translators because the gig economy was just starting up. And so there were a lot of people that were sitting around the world also without a job and available to do translation work. And so that business really took off and did well, and was able to exit and sell the business a few years later. I wanted to it wasn't trying to be an entrepreneur. My dream was to work at the World Bank or the Inter-American Development Bank and pursue a career in international development. So I went to grad school at Johns Hopkins in Bologna, Italy, moved back to Brazil to do some work at the China-Brazil Business Council, ended up in Washington, D.C. to finish graduate school here at Johns Hopkins. And after graduating, I had gotten this dream job, or what I thought was a dream job, at the Inter-American Development Bank, working in economic development. It studied economics and was traveling around Latin America, advising governments and monitoring and evaluating projects and visiting different sites and fields. And it was a whole different experience. And I learned a lot and it was exciting, but I also didn't feel that I was able to have the flexibility and creativity. I felt I was put into a box and often said no to, and I couldn't really be my true self, and I missed that life as an entrepreneur, which I didn't have the perspective prior, but after having those different experiences, I really started to appreciate the entrepreneurial lifestyle and being able to wake up excited and do something I love. I ended up exiting that job 3 years later and going back into entrepreneurship, and through actually storytelling and telling, I was very embarrassed about my translation business because it wasn't really anything that my colleagues or my classmates really understood or did, and I was embarrassed. It was really just myself telling a story in my head, which I also learned about through my therapist, that sometimes we tell stories in our heads that aren't really true. And as an entrepreneur, it's so important to be vulnerable and share. And it was actually when I started sharing my story that a lot of opportunities started coming to me. And that's when I landed a job, a side hustle with Elance after telling my story and success with the translation business. They hired me. Now they're called Upwork, if many of you probably know this freelancing platform. And they were like, we want you to tell your story to entrepreneurs and go around and launch different WeWorks, WeWork, the co-working space, and teach entrepreneurs how to hire remote teams. Of course, in 2013, 2014, and even 2015, remote teams wasn't a huge thing. And so our startup education program failed. It was also a time when, after making that exit, I had co-founded a marketing agency. And that was also a failed experience when I got laid off from both those jobs. And so I now had made this big career transition out of international development into entrepreneurship, but I couldn't figure out, how do I unleash that entrepreneur within myself? How do I actually do that and be successful again? I no longer was in the crisis I was in back in 2009, but I was struggling to figure out, how do I start again? And if I'm so good at helping other entrepreneurs get started, how come I can't do that to myself? And it was interesting. A lot of other things happened that year. This very home that I'd recently got at the time had a bad fire. The building burnt down and I was displaced for almost 9 months. Got laid off from those 2 jobs. I had gotten divorced. There were so many traumatic experiences that happened to me within that period of time. I ended up booking a one-way trip to India. I spent a month there doing a lot of meditation, yoga, Ayurveda. Ended up later in Thailand and Bali, trying to really heal myself and understand, what is my purpose? Who am I going to become? It's not Salima in international development, but Salima as an entrepreneur is failing. What am I going to do? Came back to Washington, D.C. Actually got rejected at Toronto Pearson Airport. I couldn't get back into the States. I'm actually Canadian, and had struggles trying to get the visa to come back here. They let me in for 2 weeks as a tourist. And this is, I had my home here, couldn't access it. But I ended up, going on this, what I call 100 coffee challenge, and literally had 2 weeks to find a job with a visa. And so I was strategic and had coffee all over Washington, D.C., asking people for help. And it was really hard being vulnerable and asking people for help. But I realized that people were actually willing to help. And I landed 2 opportunities. One, which I ended up taking, was to help, figure out how to solve this food insecurity problem in Africa and the Middle East using hydroponics and different ways of growing food without using soil and very little water, which I ended up taking, which led to so many other opportunities. But yeah, that was a really, really hard time of my life when I realized the importance of mental health and being able to take care of ourselves, but also having the right support system, or what I call solidarity squad, in place. Having therapy, having a coach, having a circle of friends, having support groups where I could share, even before that LifeQuake happened, was so important, because I never really had that mental health support throughout my life. My family never really I'd experienced trauma earlier in my life. When my mother passed away at the age of 16, I never had a therapist until the age of 28 or 29. And so all of that healing that had to happen actually led me to unleash so much. When I came back and was able to do that work in hydroponics, I ended up, going into design thinking and innovation and starting another company. And a few years later was able to really identify, well, my dream is to help entrepreneurs. I want to help 10 million entrepreneurs succeed and grow their businesses. For a while, I was in that healing journey of 3 to 4 years, and personal development it takes a while. It's not something you can just hire a coach, a therapist, and then get healed within a couple months. It really takes a lot of self-awareness and deep work and a lot of really deep healing. And it's not just fixing or patching. It's a lot of rewiring or revisiting our lives and telling our stories in a different way. And I ended up, realizing during the pandemic, another crisis happened. I was able to navigate this one a lot better, and went back to, well, if I did this in 2009, I can also do this in 2020, and accepted that my previous business was failing, which can be really hard, knowing when to let go. Seth Godin has a great book on that called The Dip. And I realized it was time to let go of my previous business and start my current business, Ripple Impact, where I was like, well, there must be a way to help entrepreneurs and monetize it and be successful. And it was really through helping entrepreneurs, not just with coaching and advising them, but realizing that they don't need to necessarily hire their own teams, and they might not have all the strategy to do that. But also just helping them with coaching wasn't enough. They needed designers, they needed marketing, they needed a lot of talent, and they didn't know where to start. And it was the chicken and egg problem most of us entrepreneurs deal with at the early stages. And it was then that I started Ripple Impact, where we were able to bring together designers, marketers, strategists, and a really awesome team. We were very small. We were 2 people 2 years ago, and we're now a team of almost 50 people, which is, it's great to see some of our team members here in the audience as well. And yeah, that's what happened. It blew up, and now we're supporting several entrepreneurs, and we're the team behind the scenes supporting them and helping them grow their businesses. And in that process, I also launched my book, as I mentioned earlier, Innovation Starts with I, which has the story, has a lot of great tools and frameworks on really how to reinvent not just your business, but starting with yourself, because business reinvention is really all about personal reinvention. And that's my story.
All right, Safia, you happy for me to go? Fantastic. So I think, just thinking back on my life now, I think there were 2 main inflection points that I think really started the process to me becoming and falling in love with empathy and emotional intelligence. And the one was very young, at age 4, where I got a very rare skin disease called impetigo. And it would start on my skin like a mosquito bite, and it would open and open and open till it was like a festering welt. And some nights my mom would have to change my sheets because it was just so bad, and there was so much fluid coming from these welts. And that caused, because no one knew a lot about the illness, mothers wouldn't want their kids to play with me. So I started feeling this loneliness, and I started to feel like there was maybe something wrong with me. And then later on in life, I decided to make a decision to go from a Afrikaans primary school to an English high school. And I think as a teenager, that was quite a big decision, because all my friends carried on to another school and I went to this new school. And again, I felt this loneliness, having to reflect a lot inwardly, not knowing my space in the world. And I was very lucky to have an extremely supportive family, but I constantly wanted to understand more about these feelings. And I then moved, like, fast forward many experiences, but ultimately in 2007, I started a business with very little cash flow and very big ambitions, and also a high court lawsuit from my previous employer. And it was at this point where I was working 100-hour weeks. I already had some staff, so I felt responsible for them. In our country, there are up to 6 dependents of each salary. And so this started building more and more anxiety. And I really was reflecting again, but trying to understand, where was all this going? Because the only thing I could do to solve the court case was make more sales and work harder. And so that led to a lot of anxiety. It led to definitely pre-burnout scenarios. And then I joined the Entrepreneurs Organization in 2012, and that really changed my life, because for the first time, it brought together the sense that you are not a work person, you are not a social person, you are not a family person, you're all of these people in one. And how do you take care of this person as one? And how do you also see how you impact others through what you do? And sort of through this process of sharing experiences with other entrepreneurs, I started to realize that people are not inherently bad. People are inherently looking after themselves first, and sometimes we become collateral damage because of that. And so my curiosity around understanding people more and more became bigger and bigger and bigger. And I then started to realize in my business, if I really wanted to make it work, I really needed to empower people. And I needed to empower them not just to realize their growth potential in the business, but to realize their growth potential in their entire life. And in an industry where we have massively high staff turnover, we were able to build a culture that really sort of cared for each other and cared for the person within the company, and try to understand how that person thinks, feels, and acts and shows up in the world, and what is their route to success. You know, we were all bound by a great vision and mission and values, but each of us, I started realizing, had a different way to getting there. And so my studies continued as well. I started studying the Enneagram. I became a team dynamics expert through my own healing process. I started to learn a lot about breath work, about mindfulness, about journaling, and I started passing that on to my staff and seeing how much growth they would get from that. And that really helped define my purpose in many of the other businesses that I've since started up, to live my purpose, which is I'm the breath that connects humans to leap into their highest self. And when I get that right in the companies that I create or that I work with, then operationally the business starts operating on such a high level that I can then focus on culture and strategy, which have become my passions. And so it's just, Sadhguru has this amazing bit of wisdom where he says, you've got two choices in life. You can either be wounded or you can learn from those wounds and become wise. And so my number one value in life is curiosity, and just to keep meeting people and keep impacting people's lives in a way where I can help them transition from their wounds to wisdom and then unlocking their potential in life. That's a quick summary of my story.
Wow. I feel like in 1 hour we've covered so much, but it's just such valuable information. Firstly, Salima, thank you so much for taking me on a journey of your exploration into where you started to where you are now. I haven't gone on the journey with you before, so that was really insightful. And Dylan, firstly, I love Sadhguru, so I love that we definitely resonate on the same philosophies. But also, the both of you were you were so vulnerable. And what I really heard come out of your stories is the fact that so much of your personal experience as a human being, the things that you go through, the things that you don't have control over, are also the parts that made you the successful entrepreneurs that you are today. If it wasn't without those trials and tribulations as a being, not just an entrepreneur, you actually wouldn't be the successful, like the high impact entrepreneurs that you are. So, thank you for bringing all of yourself to the conversation today. Now, we have about 7 minutes left, and I think the best use of our time would really be get to the Q&A. So, Purita, how would you best like to support?
I can read out the questions for you. Extremely sorry for that. I can read out the questions for y'all, and I think we have questions I slightly directed to a few of y'all, so we can also get through that. I think very firstly, we had something for Salima coming in. Salima, how have you brought empathy into your company and made it a foundational value, considering it's both global and remote? And you have to deal with so many different cultures. But you've still managed to support every individual in a unique way. And Cheyenne speaks from personal experience, so would love some anecdotes here.
Thank you so much for that question. So I actually have a whole chapter on empathy in my book, and there's lots of tools on like what empathy is, what it's not, and there's a lot of great stuff in there. But what I can say from our experience is that really trying to connect with our team members on a human level. At the end of the day, we're humans. And when I interviewed Arianna Huffington for my book, we talked a lot about work-life integration. I think work-life balance is a thing of the past, but she really emphasized the importance of work-life integration. Since as entrepreneurs, it's hard to have boundaries because we really love what we do. For me, my mission is to help entrepreneurs as a personal mission, and that comes out in my work, that's executed through my work. And so when our life purpose is integrated into our business, it can be really tough to set those boundaries. And so I think that in the past, we said we had to have these really strict boundaries, but today that everything is sort of melded, we're working from home. Sure, it is important to have certain boundaries, but I also think that we can really learn how to invite our team members to bring their whole selves to work, because at the end of the day, you want people to feel that they're connected to the mission, that they're co-creating the vision with you. And it's not just the founder with the vision and people just below them executing, but rather we're all together very horizontally, very flat. I like to say our team's very, very very flat, and we generally are working together towards the same mission. And there's a way to really connect your team members to feel intrinsically motivated by helping them, kind of like we kind of run like a bunch of small startups within Ripple Impact, since we're now a medium-sized business almost. And we're no longer a startup, but we do have different departments, which we give them the autonomy and the creativity and flexibility to create their own mini culture and their own, have their budget, have the ability to organize their own events and things. And we're also trying to move from an entirely remote team to a hybrid team. We've done some trips, we've done some retreats and regional retreats. We're hopefully going to have a global retreat very soon to bring everyone together. We've had, book tours. I've had even Cheyenne here has come, and I've met her in Dubai on a book tour. And it's been amazing to meet people in person, but I think we want to figure out how can we make that more of a practice where we can bring people together. We may not have physical offices, but how can we use that extra budget towards bringing everyone together, even if it's just once or twice a year? And I think that goes a very long way. It changes the connection we have with each other when we get to know each other in person. And if that's not possible, there's ways to do team building virtually. Just having some people dedicate time towards, whether it's fun Fridays, doing things as a team, exercising, yoga, meditation, cooking workshops, whatever it is, but really trying to connect with people on a human level is so key, so that they all feel included and that we're part of something bigger.
Yeah, Salima, thank you so much. I just wanted to really bring home the idea of work-life integration and what that means. We all belong to various communities in our lives. And I think that when we take the approach with our organizations and we treat people as if we're doing events or we're putting things in place to create a work-life balance, or making people feel like they're included, when it comes from a feeling of I have to do this, it doesn't really work. The community that you build at work is the community. It's like a community of friends. Even with my clients, as much as I'm a coach, there's certain, I call them, the community I'm meant to serve. They become a part of my community. And so if I don't treat them with the approach of like, you matter, and what matters to you matters to me as well, and how do we create a system where all of us feel like we are a part of something that matters, then all we're really doing is kind of creating these systems to try to check something off a box, and that never really works. So I love this idea of integration as opposed to balance, because your work is pretty much so much of your life now. We don't have boundaries at work after the pandemic. People have really not thought about that. So we have to integrate. So thanks for sharing that.
That's great to hear. I think Salima and Safia, and we have a lot of more questions coming in, but in the interest of time, I'm going to take one more, and we'll redirect these questions that you weren't able to answer later. We have a question from Julius. He says that I work with an organization in Uganda called Nakida Network Foundation with teenage mothers. Some of these teenage mothers have mental health problems. How can they get help?
I think let's take that one offline. That would require a little bit more digging. But I think you had one more question, Parita, at the beginning around anxiety, right?
Yes.
Could we direct that to Dylan?
Sure. Dylan, we have a question of how, from Kevin, of how can he overcome anxiety as a young entrepreneur who runs a startup company?
Fantastic. Thank you very much for asking the question. And I think that it's important to understand that anxiety is in all of us, and it's not necessarily always a bad thing. I think back to being a kid and the night before Christmas, and you have that anxiety of tomorrow's Christmas. I wonder what presents I'm going to get. And our bodies struggle to differentiate between good anxiety and bad anxiety. And it took me many years to learn actually about polarity and how polarity is a universal law of nature. And, if I constantly am building something with loads and loads of excitement, then I fail to see what the cost is of that. And so let me explain that a little bit better. So let's say I just landed a massive contract and I'm an exuberant person. I'm super excited. I'm happy. I'm got all this good energy in me. What I try to do now, and what I didn't do in the past, is I try and balance it out by saying, what is the cost of this? Okay, so I've got this great contract. It's amazing for all the reasons that a good contract could be amazing. But now I'm going to have to work more hours. I'm going to have to travel more. I'm not going to see my family as much. I'm not going to see my friends as much. And so slowly that starts bringing everything back into perspective. And that's really helped me to deal with anxiety. The other thing that's also helped me is Alan Watts has a philosophy that says, as humans, we have no real understanding that whether a decision we make today is going to be good or bad for us in the future, and whether a result is going to be good or bad for us in the future. So once I started learning that, and I learned to remove fear from decisions, you can really actually almost roll a dice. And if you are open enough to learning and open enough to healing, you can, off every decision, have the opportunity to learn and grow, whether that outcome is perceived by you to be good or bad, or it's perceived by the world to be good or bad. And along with that, I think in the early days, the things that really helped me was breath work. I struggled to do meditations. It was really hard for me to do meditations. Breath work really helped me a lot. I learned that as humans, we breathe way too shallow nowadays. So working on my breath work helped a lot. Journaling helped me a lot. And doing positive journaling every day. Gratitude journaling. What are 3 things that I'm grateful for? What is one big thing that I'm going to set out to achieve today? And getting all of that stuff on paper declutters your mind. And that also helped me to deal with anxiety.
Thank you so much, Dylan. Farita, if I can have 2 minutes, I just wanted to close off, but also respond to what Dylan said. You know, it's funny, when I was looking at that question, the first thing I said is attachment to expectations, right? If we're always thinking about the future and trying, and as an entrepreneur, and I work with many, you know, of course, you know, there's fears about, will I make payroll this month, right? Are we going to make our growth objectives? Like, you know, you have so many stresses on you, but if you're so focused and attached to the outcome in the future and you can't be present, you're not even able to take the next possible step that could get you towards that future goal. And so often what I say to clients is the only thing you have control over is the next step that you take in the direction of that. And if you can find a way to be present in that, and you will always flow forward in the way that you're meant to. And honestly, every single entrepreneur you ever speak to, there is always going to be a story where things felt like they were falling apart. But often it's in things falling apart that we actually rebuilt and actually found a way that was better than we even thought. We think we're geniuses sometimes and we have all the solutions, and often solutions find us in the hardest of times. So thank you for sharing that. I also want people to be aware there's a lot of science around how your emotions are stuck in your body. And so the idea behind breath work, right? We are constantly moving energy, and either that energy gets released or it gets stored in you. And so if you are feeling, issues in your gut, right? If you're noticing you're breathing heavily, if your heart's beating very fast, if your palms are getting sweaty, these are all emotions that are not getting expressed. So whether it's journaling, whether it's having a mentor at work, whether it's doing breath work, make sure that you have an outlet to literally the sponge of who you are, whether it's what you're taking in, experiences, you're taking in what the food you're ingesting, whatever it is, your body must release that. So find avenues to do that. And so thank you both so much. I can't wait to hear the feedback from today's session. I'm so grateful for all of you who attended and spent the time with us. We didn't get to the brainstorm, but I wanted you to walk away with one exercise. In the polling, we identified a sense of purpose as being the most important dimension to this group who attended today. I would love for all of you to be able to take home with you just thinking about that dimension, why it's important to you. The why is really important. And what is one thing that you think you could start implementing today within your organization that could start really shifting the culture to really be more of a place of meaning, progress, and fulfillment for not only you, but the community you belong to. Remember, when we're thinking about cultural shifts, we support quality of life. It's not just about a bandaged solution. It's about actually walking the way that we're talking. All right, everybody. Thank you so much. Thank you, Salima. Thank you, Dylan. Thank you to the whole SAMCALP team. This has been such a pleasure. And I look forward to meeting you all again. Thank you. Bye.
Thank you so much, Safia, Dylan, and Salima. It was lovely listening to all of y'all, and I'm sure the audiences that had the chance to listen to some lovely personal stories, and we'll give them the opportunity to reflect and think about the ways that they'd like to create mental well-being for themselves. Really, Sankalp is happy to have all of y'all onboarded and would love for all of y'all to join the next sessions and keep sharing the impact that we
Welcome, everyone. I'm Ashish Kaushal, CEO of diversity staffing firm Higher Talent and the founder of Consciously Unbiased, a movement to build belonging in the workplace. Consciously Unbiased is all about amplifying the voices of impact makers and tapping into the power of the community to make real change happen. Today's topic is very special to me. Today's topic is about men as allies. We have a majority of a male panel today because I believe we have to stop talking about how to fix women. They don't need to be fixed. The systems do, and we have to talk about how many men show up in the workplace. After all, the majority of leadership positions are still held by men, so engaging more men is essential for advancing equality. We have some amazing leaders here to share the topics, to share what they've learned and how they can support women in the workplace. We have special guest Henry Rowling. He's the founder of Flying Cars Innovation. Welcome, Henry.
Hi there, welcome.
Brad Johnson, professor of psychology for the U.S. Naval Academy and co-author of Good Guys: How Men Can Be Better Allies for Women in the Workplace. Welcome.
Yeah, thank you.
And then we have David Smith, associate professor of Carey Business School at Johns Hopkins University, and also co-author of Good Guys: How Men Can Be Better Allies for Women in the Workplace.
Thanks for including me.
Absolutely. And then Purvis Taylor, mental health advocate, life coach, wellness practitioner, author, and also a previous host in our Breaking the Bias podcast, if you guys are interested in checking that out later. Welcome.
Thank you so much for having me.
And then Hira Ali, CEO of Advancing Your Potential and author of Her Allies, a practical toolkit to help men lead through advocacy, as well as author of Her Way to the Top, a guide to smashing the glass ceiling. Welcome.
Thank you.
So I'd love to start off with asking each of you how to tell us who you are in more detail and what you do and why the issue of men as allies is personally important to you. Hira, do you want to start?
Right, yes. Right, so first of all, thank you for inviting me. I'm privileged to be the only woman on the table, and this table right now, but I think it's a welcoming change to have more men talk about gender equality than women. So as already introduced, I'm the Chief Executive Officer at Advancing Your Potential. I'm also author of 2 books, Her Way to the Top and Her Allies. And I'm very passionate about gender equality, racial equality, and all forms of equality. And I talk a lot about and write a lot about allyship and women in leadership and racially diverse leadership. And I'm also recently started proudly owning the title of an activist because I talk and speak about things that I care about.
I love that. Me. And we'll go back to that later because I want to know the difference between an ally and an advocate or an activist. And so we'll definitely talk about that later on. Purvis, you're next.
Well, I think to add on to what you already shared, I am the co-founder of Alchemic Solutions, which is a program that's based here in New York City that teaches young men of color how to develop and cultivate emotional intelligence. And I think as it relates to gender equality, I think awareness is the beginning of everything. If we can teach ourselves to be aware of ourselves, then we can progress to being aware of other issues that are plaguing others. So I think that's my contribution.
Absolutely. Welcome. And Henry?
Hi, everyone. Thank you so much for having me on. I'm co-founder of Flying Cars Innovation. So we develop new marketing campaigns for startups and NGOs and brands that do good in the world. I'm someone, essentially, the reason I'm interested in this as a topic is I'm someone that's come from a privileged background. So I'm a white man from a middle-class family, and I see lots of other people who are facing kind of far greater barriers than I've had to face in my life, and just want to use my platform to do something about that. So in my sort of career, I've worked at charities that support disabled people, homeless people, refugees, and in general, I don't see men doing enough to further the cause of women's equality. So I want to use the platform that I've built from the privilege I've had to do something about that.
I love it. And David, welcome as well.
Hello, thanks, and it's great to be here with everybody. So I guess in addition, it would be helpful. I'm a sociologist, and I do all of my research in the area of gender, work, and family. So thinking about gender perspectives on careers in the workplace and how family intersects with that. And, you know, I think one of the things that, as Brad and I started collaborating together and doing this work, we noticed very early on were that these are often framed, these gender inequities are framed as women's issues, and women, the solutions are often, from organizational perspectives, are often focused on women and fixing women, and not about the broader culture, the broader structure, and men, and how we can be part of the solution. So we love to reframe this as a leadership issue where we as men and women have a role and a function, a responsibility to be engaged in creating the kind of workplaces where we all want to work and thrive there. But I think also the personal connection, I think, is really important too. And hopefully we'll get a chance to talk about some, maybe why these are things that are personally important to us as well.
Absolutely. And Brad, I'd love to hear your perspective as well.
Yeah, my why. You know, I am somebody, I'm a clinical psychologist who has spent his entire career researching mentoring relationships. And I, in all of that time, have seen the data. So part of it is scientific for me. I've seen the data showing that women just don't get the same level of mentoring. And even when they do, they often don't get sponsored. They don't get advocacy as part of their relationship the way that majority men do very naturally. So there's that kind of nerdly scientific part of me that got me into this work. But then there's the personal, like Dave, you know, there are women that I care about, maybe most notably my sister, who's a Navy captain, very senior officer in the Navy. I talk to her frequently about things that happened to her in the workplace because she's a woman that have never happened to me, even though we're very similar in our leadership style. And so I attribute some of my awareness and empathy, honestly, to my sister's willingness to share some of her experience.
Yeah, and I think that's important. It's a lot of times change happens because you connect the mind and the heart, and it affects you or somebody you love. And if you focus on that, then you really make it resonate, you know, make it personal. What does allyship mean to you? So can we start off with you, Brad?
Yeah. So, you know, I'm going to just put it in three big buckets, maybe in 1 minute here. And you know, this just comes from all the research Dave and I have done that, you know, for me, it is the interpersonal. It's how I show up in my relationships and hold myself accountable, you know. And if we're talking about gender, how about just starting with learning how to listen more effectively? Apparently we men struggle with that. Then there's the public side, right? Really putting myself out there, more skin in the game now. It's not just holding myself accountable. I have to hold others accountable, and especially other men. Got to be willing to call things out. How about loudly advocating, you know, for women? So there's that public piece. And the last bucket is really the systemic. This is harder even yet. Now I get to hold my own organization accountable and society accountable. I need to advocate. Someone mentioned advocacy here already. And boy, I got to become an advocate and ask questions about how my organization is missing it or getting it wrong, and how we need to improve so that this is a workplace that everyone can really show up and be authentic. So those are, for me, those are kind of the big three areas I like to focus on.
I love that. And those are manageable. Like if you break it into that, then it's more manageable than vague. So I love that. And David?
Yeah, just to build on, I think what Brad brought us there is, I think the language is important too, and remembering that allyship is not about rescuing. This is not doing things for somebody. This is doing things with, right? So we need to learn to come alongside and think about, how do we do this collaboratively? How do we show up as partners in the workplace and do this together? And again, because I think we have as much to gain and to learn as men as do women in the workplace, and we can do that for all of us together. The other thing, I think the really important aspect to remember just from a societal perspective is that if we're ever going to get to gender equity in the workplace, and being a great ally in the workplace is one place to start, but we also have to remember we have to do this at home. And that, again, for those of us who are partnered with women, we know that women have historically done, up to 2 to 3 times as much of the domestic labor or unpaid labor in the work at home. The pandemic has certainly exacerbated that. And if, most of us tend to be in dual earner, dual career couples. And if we're going to survive, we've got to be supportive of our partner's career and do our fair share as allies at home and doing the caregiving and all of that. So I think, again, showing up as allies means being good collaborators, good partners, and that partnership can start at home.
I love that. And, one of the things that really resonated there was allyship isn't a favor, it's a strategic advantage, right?
Correct.
Henry?
So some really good points already made. I think for me, allyship is around using the kind of power and network, using your brain, your influence, essentially to advance women's equality in practical ways whenever you can. So for me, the practicality of what you do is really, really important. So theory is very important as well. But for me, it's kind of how you show up when you're caught off guard or there's a situation that arises really quickly. So thinking about my own personal experiences of working in offices, from time to time, people say things and I haven't always been able to react in that moment in the way that I would have liked to, looking back retrospectively. So for me, what's really important is, as being an ally, is to think about when you haven't done as you would have liked to have done and try to do better each time. So when you've fallen down or not kind of represented yourself as well as you can do, then trying to sort of be better each time. But I'm all about those kind of practical ways that you can sort of, support.
Yeah. And then you brought up a really good point about self-reflection, because a lot of times we'll be embarrassed that we did something that wasn't kosher and then kind of sweep it under the rug rather than actually reflecting and fixing it in the future, Purvis?
Wow, you guys have provided some great answers. I don't know what to say. No, but you guys have really provided some great insightful answers. I think if I can add anything, I would say, allyship for me is being intentional and active. Being an ally on purpose, right? And really utilizing my voice. So like in those instances, those moments where, say, for instance, a women counterpart of mine, organization wanted to hire me, but I wasn't available. And I recommended my friend. And I said, pay her what you're going to pay me, or if her quote is higher than mine, pay her that. So like being active and utilizing my voice when necessary, and doing it on purpose because she deserves that. And so like it's for me, it's just the intentionality behind it all.
I love that. And it has results as well, right? So you have to make sure that it's having an impact. It's not just spoken about.
Yes.
Yeah.
Right. So I realized I didn't add my personal whys. The reason why I'm going to begin with that, the reason why I decided to write this book was because having worked in different countries and with different people in different cultures, I'd seen a specific trend holding women back, and not just in women, also in men. I would see that many of them were well-intentioned and they wanted to do something good in this space, but they often didn't know what to do or how to do it. And I decided that, this is it. I'm going to write a toolkit for men. I don't know what I was thinking, telling men what to do. But yeah, that's what I decided to do. And that's the reason why I wanted to write a book in which men, despite whatever level they're at, they can actually take small steps, small actions. They don't have to be major influencers. They can just take, tiny steps in order to support women in their circle. And for me, allyship is people who can choose to challenge themselves first, because it all begins with them, with you, right? Change begins with you. And then they can move on to challenge others, because that's really, really important, specifically when we're talking about male allies. Calling out others is, I think, the most important part for me. And then challenging the organization culture, and finally challenging the organization institution. So I think these were the 4 parts which I see. That's how my book is also being divided into 4 parts. Allies who can challenge themselves, challenge others, challenge organization culture, and then finally challenge the institution. But yes, as David said, they're not to be saviors. We don't want to be saved. We don't want to be rescued. We need people who are, working collaboratively with us, alongside us, who are mentors, sponsors, advocates, but not saviors.
I love that you wrote a book on it, because I do think change can be overwhelming, and by breaking it down to small steps, sometimes that really helps us. Right, the intention might be there, but then we're not sure where to start, and so I think that's amazing. I'm going to give you another question. So, achieving gender equality will only be successful when we all realize it's all of our fight. It's not just a women's issue. How can we bring more men together to tap into the power of the collective? So, what's one step from your book, basically?
Having these conversations, inviting men to take part in these conversations, and I think also making them comfortable, telling them that it's all right to make mistakes. It's not all right to not acknowledge responsibility. Of course, you will make mistakes. I think you can't really escape that. But if you do make mistakes, know when to acknowledge your responsibility, apologize, and show genuine intention. And then I think that is my whole focus, is to get people and find out what is it that's holding them back, because I usually start my talks by asking men what is holding them back. So finding their viewpoint and then trying to address it. As a woman, I think we both need to come halfway in order to achieve gender equality. So I think that's important, having more and more conversations.
Love it. Anyone else like to add to that?
I would add that I think one big hurdle sometimes for men, us men, it can be zero-sum thinking too, especially if this is new for me, that, hey, if we men lose or include more women, somehow we're losing opportunity that belong to us, or we're losing positions that belong to us, so there can be this kind of erroneous thinking that for women to share more equally in the workplace, men have got to sacrifice and lose. And I think what those men miss is all of the research data showing that actually when you include more women, and especially include more women in genuine leadership positions, your company does better, your organization thrives, and actually there's more opportunity for everybody, right? The bottom line increases, there are more positions, more opportunity. So the growth mindset versus the zero-sum thinking, I think we can lose sight of that, and we can feel defensive in a way that can undermine the ally behavior.
Absolutely. I was actually going to say that. I was going to say more akin to dominance is akin to lack as opposed to abundance. And I think for a lot of men in those positions, they think that there's not enough room for everyone. And so that scarcity mindset,
Yes.
as he so eloquently stated, that has contributed to why we can't expand beyond that. And so when she really, it's really a mindset. It's really teaching them that dominance is not the way. And so it's really about mindset.
Absolutely. And diversity of thought, honestly, is a strategic advantage, and groupthink is a way to sort of make your business less relevant. So I think that's something that we always have to keep in mind as well.
Yeah, I think one of the other aspects, Purvis, you were touching on this, that we don't always understand, to shift that mindset, understand the benefits, right? That there's actually something in this for everybody. Everybody wins when we do this really well. And so we see, one of the ways to overcome some of the reluctance to engage or to be the kind of allies that we're looking for, active and really in doing the work, is we don't have the kinds of relationships with people who are different from us, right? So that we become better allies through understanding people's experiences. We develop empathy and really have our eyes open to what's going on around us. And often that's part of what gets in touch with that, back to that sense of personal motivation to do the work, right? To be a better ally is understanding, again, people who have been around you that are important to you, how they've experienced things in a way that is not just, it's not fair. And then again, most of us have that sense of fairness or justice to get involved and to do the work. And, but I think there's also as we begin to understand the benefits for not only our organization, but for ourselves as men, that we become better leaders. And it's through the kinds of relationships that we're having and the work that we're doing there that begins to expand this pie. And that's how we get past that zero-sum thinking.
Absolutely. Henry, you wrote an article or post on LinkedIn on how to be a better ally to women, and it got thousands of reactions. Any advice on how male leaders can find their real voice around allyship and social media and inspire other men to do the same thing?
Yeah, it was a really interesting process to go through. So I just wrote the LinkedIn post and wasn't really expecting it. I own a business, so I write content quite regularly, and it normally just does okay, but it doesn't go sort of viral. And this really did kind of go viral. It seemed to really resonate with people, and I think one of the reasons for that was the sort of scarcity of men talking about this kind of stuff online and social media. So I think kind of in the digital space, there's a kind of blurring between work, politics, personal brand building. It all gets quite messy for people, and they don't really kind of know how to react to that, other than sometimes hiding behind sort of corporate statements around diversity. And if people actually use their authentic voice to talk about these issues, it really resonates and cuts through. So I think thinking about the sort of digital space and finding your authentic voice and what you can say about a particular issue, there is a kind of fear that men have around saying the wrong thing and kind of getting a pile on, and people kind of, cancelling them and feeling really kind of scared about saying what they really feel around this. So I think the way that, I don't see a lot of CEOs making particularly interesting statements around racial issues or disability issues or women's issues. They're very much kind of hiding behind a corporate cloak, and I feel like that's kind of one of the problems that stops an honest conversation about lots of things. So I think thinking about what your authentic voice is that you can add to a conversation is you really kind of need to think about when you learn the most about a particular issue. So you might revert to when something went well, but actually I think the best time to reflect on when you learn the most is when something's failed or when you've fallen down in a particular scenario, and being honest with yourself. So I think for digital spaces, if you've got something to say, you need to say it with that authenticity. So in the US, the gender pay gap is like 80%. So I think women get paid 80% of what men get paid, and it's something pretty similar for the UK. And if that angers you, which it should do, and I think most people, it would anger most people, then you really need to say that. Don't hide behind sort of corporate statements that you wheel out once a year for International Women's Day, which I think a lot of CEOs do. You need to say practically what you're going to do to fight against that 20% of free work, essentially, that you're expecting all of your female employees to do. And that's really important. And that is how you can kind of find your voice online, is to speak with passion and honesty, and talk about when you failed and how you can get better. So in my sort of working career, when I worked at businesses and organizations, I did quite a lot of hiring, and I didn't get all of those decisions right. And sometimes I made decisions that were based on my bias, and sometimes it was because of conflict avoidance or trying to get out of the situation that was difficult in terms of structural issues. I didn't get everything right. I try harder each day to be better, and that's my authentic position. It's not to kind of go online and say, hey, I'm great, I've done everything great all the time, because that's not realistic. Yeah. But then, social media encourages us to put our best foot, the best things. You put your best picture on Instagram, you put your best memories on Facebook. That's not a true reflection of who we are.
Yeah, and I think we also need to sort of reward, and what you did was basically authentic, you combined authenticity with strength and vulnerability, right? And putting yourself out there. And I think that was really what resonated and helped. And I think that's something that we normally haven't rewarded men for, is being vulnerable. And that's been shown as a weakness. And I think that's not a weakness, it's actually a strength. And it gets people to go to war with you, war for you, you know?
Yeah.
Hira, what is the most important first step men can take to advocate for women that you learned when you wrote Her Allies, a practical toolkit to help men through advocacy? And to add to that, can you tell us the difference between advocacy and allyship?
Gosh, where do I start? There's so many steps, but of course, the first step would be to challenge yourself. And I think the very first thing when you're challenging yourself is to educate yourself, because you can't change what you're not aware of. So I think it's important to not only do your research and read about it, but also go and expand your social circle and meet with people who are not like you. Because I can't believe the number of times I've had to tell men that just because women in your circle haven't vented out to you, haven't shared a grievance, or it hasn't happened to them, doesn't mean that it doesn't exist. It still exists. It exists with other groups of women, which you probably are not aware of. So I think expand your social circle. And also when you're educating yourself, I think it's important to look at challenges impacting women through an intersectional lens, because sometimes women can experience marginalization because of the multiple identities they own. So not stereotyping, not generalizing or assuming that just because she's a woman of color, so her experience is going to be very similar to another woman of color, which is not true, because as an Asian, brown, Muslim woman, my experience might be very different from a Black woman. So every experience is valid, every experience is unique. There's, you can't cluster, you can't generalize, you can't dilute the challenges of one group and say that, oh, this is what all women are experiencing. So I think it's important to look at it from an intersectional lens, be it gender identity, be it sexuality, sexual orientation, disability, socioeconomic background, ethnicity, race, faith. So that's important. And allyship and advocacy, well, you got me there, because I'm just thinking, what is the difference between allyship and advocacy? But I think allyship is, from what I can see, allyship, you can be like a silent ally. You don't have to, in your own capacity, you can be an ally, and you can whether it's at home, whether it's with your friends, whether it's in your organization, you can be an ally in your own little area. But when you start advocating for it, when you start speaking out, when you start championing it, and you start talking about it, tweeting about it, sharing articles, writing, like Henry's written this post about it. So I think that's when allies become advocates, because they're not only silently being allies to women in their circle, but they're also actively advocating about it. So I think that's how I feel what the difference is. But I think over to the rest of the people.
Yeah, Dr. Johnson, do you have any thoughts around that? I know you talked about this in the past too.
I love the way Hira's talking about this, and it's funny. I haven't heard so much about advocacy separate. I realize you can do that, though. Hearing Hira say that has been helpful for me. I could be an advocate without doing any other ally stuff, and I think there's some real truth there. Yeah. I think when Dave and I are having conversations with men, we sort of put this all on a continuum, right? And we want to be so inclusive. We want to invite men in, recognizing that there's somewhere on the continuum. Mm-hmm. There are men, let's be honest, who are apathetic. Mm-hmm. And we don't encounter that many of those guys, right? I just don't really even care about gender equity or diversity. It doesn't even register as significant. I find very few men are apathetic about this. But there are men who are, maybe just sticking their big toe in the water. And yeah, I realize there are some inequities. I'm trying to understand this. I have some awareness, but I'm really not sure what to. And then you move a little farther on that continuum, and there are men who are a lot more active, right? These guys may call some things out in meetings when there's bias or sexism. These are men who are more deliberately and publicly mentoring and sponsoring women. So there are men on that kind of active phase of the continuum. And then you move to the far end, opposite of apathetic. And I think you start getting to advocacy, again, under this big umbrella, maybe of allyship. And those are the gentlemen who tend to really be leading on this. They lend their voice. You heard Henry is writing about this, online. So he's being more of an advocate. He's putting himself out there, I think, and also willing to put skin in the game when it comes to joining causes or lending my political capital and privilege to causes that I really value and that are important, that promote this. But I think to Hira's point, I'm convinced that you could do the advocacy piece without, necessarily being an ally in other ways. Yeah.
Absolutely. Anyone else have thoughts around that?
I think one of the challenges here also, just to kind of call out maybe one of the elephants in the room, is that I think around allyship, we've seen the faux, fake, or performative allyship is one of the challenges that, when we see people being true advocates and co-conspirators, they're really living it, right? They're doing it, 24/7 every day, and we know that. Whereas performative allyship can be done by choice, right? When you want to do it, or when it's advantageous for you to do it, when it makes you look good, and it's really often very, it's just very cursory, and it can sound like a lot of nice talk, and there's really not a lot of action, and you're really probably not putting any skin in the game. And I think that was one of the things that, when Brad and I were doing some of the interviews with men for our book, Good Guys, that a lot of men talked about how they really felt like, when they were really being that advocate, that's when they were really putting some skin in the game. They felt a sense of maybe personal risk or professional risk. They felt vulnerable in those situations, and it's really interesting to see when we can kind of sense that and feel that I'm really uncomfortable. I'm in a place where I'm uncomfortable, and then just getting okay. It's okay to be in this space, right? This is something I've got to learn to become more comfortable with, and doing that work and overcoming some of the things, the signals and the perceptions around us that we're worried about.
No, absolutely. And speaking of that, do you think we need to value and reward men for non-traditional behavior, such as being collaborative, and how this might help advance equality for all? Should we change the word masculinity to maybe leveraging your strengths for progress to get more men aboard?
Yeah, this is an interesting one because, one of the challenges here is that we don't want to reinforce, what we call the pedestal effect of, so when men do something right, and they get put up on a pedestal for doing what they should be doing. And I completely agree with that. The challenge is that, just calling out negative behavior, right, all the time, it doesn't always lead to the kind of results that we're looking for. So sometimes having some positive reinforcement, we know works really well. And so finding ways that, because sometimes I think as leaders, we're often doing things that we go, well, that's just who I am as a leader. It's the right thing to do for my people. And we don't necessarily understand the impact of it. We do it because it is the right thing. It's just who I am and who I am as a leader. But sometimes having one of our close colleagues or maybe one of our subordinates tell us that, hey, today when you did that, it really meant a lot to me, and here's why. And it's like, oh, wow, I had no idea the impact I was having. And so sometimes sharing some of that person, that reinforcing aspect, I think is really helpful. But to your point about should we change, right? Should we change how we talk about masculinity or more traditional masculine behaviors? And I think absolutely. I think a lot of things as leaders, if we just keep it in a leadership perspective, a lot of things as leaders that we did or maybe were trained or socialized to do from a 20th century perspective are just not working in this 21st century, and they're not valued. And we know the research shows us that that's the case, and that we're losing, right? We're losing, as leaders, we're not as effective as we can be. You're not encouraging the right kind of performance. We're not attracting the right kind of talent in our organization. So it's just suboptimal. And I think the sooner we can get to more men understanding that, what's really valued and what's really making a difference, then that's what's going to change the workplace.
Absolutely.
And if I can add a woman's perspective to this, when you're talking about appreciating men for being allies, I know there are a lot of controversial opinions on this, but I personally believe that because there's such few men doing it, I think you do need to recognize. I mean, I do. I always make them, I make videos. I put David and Brad in videos. I celebrate them. I celebrate the men in my life, my husband, my father, my brother, like who I think it's important to recognize these efforts. Yes, this should be normalized. But because I think not many people are doing it, I think if we acknowledge it and recognize it and appreciate it, encourage it, we'll have more role models and we'll have more people doing it. So I personally believe that, yes, you should recognize those who are standing up as allies.
Great points. Dr. Johnson, what role do men play in gender equality in that movement? And then what's your response to be a man who argues this is versus sexism? Why do we sometimes see defensiveness around this topic?
Wow. Well, I can probably streamline my answer because my main thought about that, Ashish, is back to zero-sum thinking. When I hear the reverse sexism comment, I have to equate that in my own mind with defensiveness. That, hey, this is not fair to me. I'm going to lose. It can reflect a fundamental sense of defensiveness. And, beyond the zero-sum thinking, just missing all of the information about how we all thrive when we're more inclusive and we have more diversity and creativity on our teams. There's also an issue of privilege here. And I think you got to have Dave and I have taken to calling this the P word because men find privilege so aversive, when you bring that up. But you got to talk about the P word, right? And the irony here is that when I, as a majority cisgender white male, call things out, advocate for fairness and inclusion, on average, I take a bump up, right, in my annual evaluations because I'm a gender champion. Wow, look at that guy. Look how terrific he is. When a woman does exactly the same thing, or any other minoritized group, on aggregate, they're going to take a hit, right? Because they're just pursuing their own best interests, or they're abrasive, or, you name it. Yeah. It's only when I really understand what Dave and I have taken to calling this, invisible backpack of privilege that I've been carrying around my whole life as a white male. I have not been aware, honestly, of the tailwinds I've had my whole life. Once I recognize I have this backpack and all this opportunity, then I get to actually use it. I get to start sharing it. I get to actually start changing the workplace. It can be a really powerful thing to become aware of my privilege. And especially when I'm aware that, hey, I'm not losing when I use this because my backpack constantly refills. As a white man, it never gets depleted. Yep. Once I have that kind of, epiphany taken to heart, I think I become really empowered to begin sharing that. And I think that's what can change men's attitudes and their behavior. But that getting to that awareness, I think, is a challenge.
No, absolutely. So do you think maybe our assumptions are wrong? Like we're assuming that power is finite. And so for me to get something, you have to lose it. And then the second thing is, there's probably a factor of guilt if I acknowledge that I had some sort of advantage, then you're taking away from my progress or whatever I've earned.
I think that's a big part of the defensiveness around privilege. Yes, whenever you bring up privilege, and it doesn't matter whether it's around gender or race or any other group, there's this immediate defensiveness that, hey, I worked hard, to get where I am. And I think, message back about that is, of course, you worked hard, but so did everybody else. And you just haven't had these constant headwinds. You haven't been aware of it because you've had the backpack and the tailwinds. It's only when I really grasp that. We are not diminishing you or your hard work. We're just pointing out your experience has been quite different and you just haven't been aware of that. So I think it's having, that kind of humble authenticity and maybe flash of insight that really begins to change hearts and behavior.
Yeah. And I don't think it takes away from capability. Like reality is, I may have an old boys network and I got somewhere because that gave me a little bit of advantage. But if I wasn't capable, I still couldn't get there, but it did give me an advantage. And so we have to recognize that. Purvis, you wrote an article, as a Black man, I understand Will Smith's reaction, but that wasn't the way. Can you share your thoughts on men's roles as a protector of women and what you think is a better way forward?
Yes. So firstly, I was so grateful that the Griot reached out to me to write that piece. They wanted to get my opinion because I'd worked with them before and they knew that I was probably going to offer a completely different perspective than the other op-ed pieces that were out there. And, in writing it, I was thinking about, because, Will Smith kept saying that he wanted to protect Black women. And I was thinking around the word protection. And when we think about it, at the core of it, we're talking safety, right? Protecting someone from harm. And in one respect, physical harm, there is a need for protection in that sense. But when you expand it, there's also, safety of one's dignity, of one's pride, of one's humanity. And I think about that in terms of protecting women. Like, it's not necessarily this rescuing, right, which we've already covered, because no one's a savior, but I think it's about making sure that someone's dignity is still intact. And the way that we affirm one's dignity is to make sure that they get the same rights and privileges that we get, right? And so when I think about it, I teach men emotional intelligence, and at the core of it is the foundation of it is self-awareness. And then we get to self-management, then we get to social awareness, then we get to relationship management. Even within, Brad, to your point, even within your privilege, you've experienced some injustice, right? And if you can tap into that injustice and recognize that there are people who experience that injustice you've experienced all the time, right? We can cultivate that empathy, right? And then once we get to the social awareness aspect, that's where we develop compassion. Compassion is action. That's how we manage the relationship, is through compassion. And one of the things I always say is that a person who is committed to their healing journey, so to be emotionally intelligent means that you have to be introspective and reflect over your life and think about your choices and how you've shown up to now, right? And think about your fragilities, your frailties, your traumas, all those things, right? So when you're thinking about your healing journey, any person who is committed to being on a healing journey, it would hurt them to see someone else in pain or in flux, right? So healed people heal people, right? And so we have to teach men. One of the things I try to teach men is to be committed to your healing journey. That's why I wrote the book, Heal Forward. Heal with the future in mind, but you can only heal if you're helping others to heal as well. So we have to get men to be committed and intentional on their healing journeys.
I love that perspective.
Yep.
Anyone else add to that?
I think Purvis said it all. Oh, go ahead, Hira.
Sorry, Brad, you go ahead.
No. Yeah.
No, I think, as a person belonging to a racially diverse group and who ticks many boxes, I think what Purvis said, it really hit the nail. You really do need to heal yourself, because a lot of us are carrying past trauma of injustices and, the way they've been treated, and discrimination and interpersonal prejudice, and all these things has affected us. And there's a thing known as acculturative stress, which I've recently been talking about, which a lot of people don't know, but people from racially diverse groups, marginalized groups, even women, because they have been diminished and trivialized and debased in such a long time, they have an acculturative stress where they have to adapt to the values of a dominant group. For example, if I'm the only woman in the room or the only woman of color. And that is a lot of stress. That's a lot of anxiety. And if you put in actual lived experiences in that, then that can really create havoc in a person's life. So I think what Purvis says is, I completely relate to that. It's important for you to heal, because if you're not healing, then you will be reacting at everything. But when you are healed, then you'll be able to, and you heal by helping others and reaching out to others. So I think, yes, that definitely resonated.
Yeah. I was also thinking, like, do you guys see the Oprah interview with him prior to the event? right? It's almost like he was trying to fix his trauma of not being able to protect his mom by instilling more trauma, and that doesn't really justify like the response, because then we never get out of this cycle, you know?
Yeah. And that's why it's so important for us to heal and be committed and intentional about it. You know, men in particular, it's because that's my, you know, what I specialize in. We don't have a lot of times we're not introspective. We don't have the language, and we also don't have the accountability. And to your point earlier, we don't understand, you know, vulnerability is truly a strength, and vulnerability, you know, it's a risk as well, because it's an invitation for feedback, right? That's really what vulnerability is. It's an invitation to feedback. And I think if we're honest, I'll be honest, I've been afraid of feedback.
Oh, absolutely. Because then if you don't like the response, then it makes you feel really bad.
Right? Absolutely. And I think, and then that becomes shameful, and then that becomes, you know, and then we tuck and hide, and then we just put on the, you know, the masculine face, or whatever that is, you know?
Yeah. And one follow on to that, Purvis, Dave and I, you know, I find it so interesting that the men who tend to get really good feedback, you know, to your feedback point, tend to be those men who respond to it really effectively.
Absolutely.
You know, they welcome it. And even if they've really gotten it wrong, they show gratitude for that and say, thank you. Wow, I had no idea. And they might even be authentic enough to say, that's really painful for me to hear. I had no idea that I was blowing it like that. And this is a little hard for me. Could I come back to you, you know, maybe in a day or so, and continue this conversation? Because I know I need to get better. And let me just also thank you for trusting me enough to share that, because I know that wasn't easy. Men who tend to do that are those guys who really have this cluster of confidants around them, who trust them enough to continue giving them the feedback.
Absolutely. And they're also on their healing journeys as well.
So you're kind of saying our strengths are like, or what we perceive strengths are sort of routed in insecurity on some level? Like me being machismo or whatever, I'm just like, it's a way to sort of mask something else that I'm not really sure about.
Yeah, it can, because I think, you know, this kind of goes full circle, right? To make myself vulnerable and to really be humble and to accept that, you know, be open to this kind of feedback, you know, you're acknowledging that I think one of the challenges there is that people feel like they're accepting that risk, and the risk of what they're seeing happen around them, especially for more senior people, CEOs, for example, back to the cancel culture, right? Of that I'm going to get canceled if I'm that vulnerable, I'm that open and that honest and humble about this. But I think what we find is that the reality is that it's something different, right? That when men are putting themselves out there, and this is part of who they are as leaders, as people, that we are on that journey, that healing journey, as Purvis was talking about, that people will meet us there. They'll meet us where we are, and they really, I think, appreciate that authenticity.
Absolutely.
So going back to the cancel culture issue, in this environment, leaders really are afraid to make mistakes and saying things wrong. They don't have permission to be honest, even if the intent is there. And that really does affect allyship. And so how do we give them the space to learn and not be perfect, but actually just push the movement forward?
I think as a woman, I would say that if a man has made a mistake or said something accidentally which was sexist or racist or, you know, transphobic, homophobic, whatever it is, but that person did it because of lack of awareness and is genuinely apologetic and is acknowledging responsibility, saying sorry and ready to move on and not repeat the mistake. I think that genuineness does come across, and it's going to really help the person. Of course, if you are resorting to half-hearted cover-ups and making excuses and defending yourself and being dismissive, then that might backfire. That might go in a very wrong direction. But if you are genuine, if you're authentic, if you're vulnerable, people most of the time are able to recognize that, and hopefully you will not be cancelled. But yes, I think given the environment that we are in, it's difficult to say what can get you into trouble. But again, I would say authenticity, vulnerability, acknowledging responsibility, these are the keys. If you can do that, then hopefully everything is going to be okay, and you will be accepted for even for your mistakes, and you will be forgiven.
Absolutely. We all have biases. It's part of being human. Our collective biases can show up in systems that contribute to gender inequalities. How can we become more self-aware and start to interrupt our own biases? Like, what's one action step you guys do to sort of shortcut that decision-making or stop the decision-making shortcut process?
I think in terms of biases, it's important that you kind of speak to people outside of your echo chamber is really important. So social media allows you to build really kind of unhealthy echo chambers of people who just agree with you. And I think, Twitter and even LinkedIn allows you to just kind of connect with people who think the same way as you, and that's really unhealthy in some ways, because you're not being you can avoid people whose opinions you don't like. So I think we all hold biases, and sometimes they're overt, and people are not capable of moving beyond them. To speak to people, listen to what they say. So you can speak to people and kind of switch off, but really kind of listen to what they say, get content from outside of your echo chamber, and understand. I think one of the issues with sort of men's fear of cancelling and that kind of thing is men are not used to being uncomfortable. They're not used to white men are not used to walking into a room and it being full of people who are not the same as them. And even talking about allyship and women's issues online, not everyone's going to agree with you and they're going to come back at you, but you have to get comfortable being uncomfortable if you're going to change anything, because if you don't do that, then nothing will change at all, and you can build these kind of walls around yourself. So getting comfortable with being uncomfortable is incredibly important, and that's one of the things that I put on this LinkedIn post was, get into spaces where you are the only person of a certain type. So last year I mentored through a network called Like-Minded Females, a really brilliant mentoring network. And it was mostly women mentoring women. I can't even remember how I came across this network, but they asked me to mentor, and I was a bit like, am I allowed to? Can I do it? Like, is this okay? Anyway, it was okay. And it was a really kind of great experience. So you have to get outside of your echo chamber and read deeply, read different perspectives. And then when you're faced with stuff you're uncertain about, lean into it and not run away. But I think most of the time men run away from those situations. So if I put a post online around intersectional issues, around women's issues, I know that 90% of the people that interact with that are going to be either women or people of color. There'll be no white men that interact with that post because they'll be like, oh, that's not for me. I'm not really interested in that. So yeah. That's how I think you can confront your own biases.
I love that. Anyone else want to add to that?
I think that if we're talking about gender, just one add-on, I was nodding my head to everything Henry said, but I one subtle thing that I've had to learn slowly, and I've had to kind of work at this, are some of the more subtle forms of sexism that I think we can miss, and especially as men, because we don't receive it as much. So, how about benevolent sexism, right? All of that stuff that sounds chivalrous, it sounds positive, it sounds protective on the surface. Like, hey, we shouldn't consider Hira for that promotion because, she has kids. Well, that sounds positive, right? But no, it's not. I'm making all kinds of assumptions about her. I don't know what she wants, but I should take the time to check with her. Hey, can I put you forward for this? Are you even interested? But too often we default to the benevolent sexism. And I think when people hear it, they don't pick up on the fact that this is one of those death by 1,000 cuts women experience every day, it undermines them, right? It takes away their autonomy. And so it's not just the egregious sexism and bias I need to look for. I need to educate myself, to Henry's point, about some of the more subtle kinds of things. And I see that as being maybe the next step and the next challenge.
Absolutely.
I think one other thing we can do, and I love to, I think one of the ways I think about this is how do I put it into action every day? And certainly, from my background as a sociologist, I think about the language aspect of it, and certainly we find biased language, right, in lots of different ways. As you learn that something is biased, is then the hard part there is, it's like, well, how am I going to change that for myself? Because that sounds like a lot of work, and it is, and it's really, I mean, just try to, for example, if you always go into a meeting and you refer to large groups of people as just generically guys, which has become so culturally common in lots of different settings, and everybody's like, well, yeah, I didn't mean to privilege the men in the room. I wasn't really referring. I was referring to the women, everybody in the room in that way. It's like, well, but it's not really all that inclusive of language. Could you use a different term, a different way to address people so that everybody felt included, and you're in the way that you did that? You'll find yourself, as you begin to work on that, catching yourself, and you probably will make the mistake of continuing to use the word over and over again, but you'll start to catch yourself, and it almost becomes frustrating in some ways, until you get to the point where it's like, now I'm actually thinking far enough in advance where I'm actually changing it. I'm thinking about it. All right, so I'm not going to say that. I'm going to say this instead, and now I change it. And now that's the first practice, right, in terms of changing behavior in a direction that we're looking for. And it takes time, especially I think the older we are, the more time we've spent in one particular culture, around one set of workplace experiences. It's hard to change these behaviors that we've used for a long time.
No, absolutely. I love that. And it's almost kind of where we were going to end this with too. So I think you kind of rolled us right into that. So consciously unbiased, we talk about microprogressions, and they're basically small action steps that you can do to change the culture or an environment within an organization. And so I'd love to hear one small action step that can lead to a big impact over time that men can take to support women at work. And I'll give you an example of a microprogression that I learned early on in when COVID started, was that we were doing these Zoom calls, and I'd always want to get my idea across, so I'd cut people off and talk over them, right? And what does that do? So if you're a minority, it went and sends a subconscious signal that you're not important to me and your ideas aren't, because I was so busy trying to barf my ideas onto you. And so one small action step I do is now I listen, digest what you're asking for, and then respond to the question you're asking for, rather than pushing something that you don't really care about. So that's an example of microprogression.
Thank you.
I like that. That's very good. Active listening, which is what that is, right? Active listening on purpose, and listening to what is said and what is not said. And I think, I try to cultivate that in my CEO clients often, is to listen to what's not being said, listen to the body language, listen to the tone of voice, right? Just being intentional about your leadership, being intentional about listening, because people, believe it or not, people can tell how you're listening to them. So that is a great microprogression.
Love that.
I would add to that and say that I'm a huge fan of surveys and polls. I love to do surveys and polls every now and then to capture experiences of people and find out what exactly it is that they want. So I would say go and talk to women, either through surveys, polls, or have actual conversations rather than assuming what women want and what they don't want. Find out from them what is it that want, what is it that they want. And once they do share their grievances, or once they do vent out, don't dismiss them, and don't treat bias as a dirty word, except that we are all biased, because if we are dismissing that, we're dismissing science. The brain functionality is designed in such a way that we all develop. We all have a biases. As a woman, I have biases against other women too. But what we do need to do, there's no button that you can consciously press and stop the bias. You have to actually question yourself all the time and take a step back, because we've grown up with deeply entrenched biases. So I think if we can consciously take a step back and see what is it that we're doing wrong, and question ourselves, what assumptions am I making on the basis of a person's gender, race, ethnicity, faith, or any other protected characteristic? I think that would really help.
I love the way you put that. I've never heard it said that way before, especially about the bias piece and questioning science. I'm going to use that if that's okay.
Absolutely.
I'll keep mine really short. I'm going to hit the sponsorship piece. My micro progression, if you happen to be a male and you happen to be a male with any seniority, it's not enough to be nice to women and to mentor them that way. You need to talk about talented women when they're not even in the room. Tell other people why they're rock stars, why they should be considered. Tell them about their great performance. This requires more skin in the game and risk on your part, but you need to step up and do that.
Love that.
Right.
And on the note of gender equity starts at home. If you're not sure if you're partnered with a woman, you're not sure if you're doing your fair share and being a great ally at home, go home tonight and do your domestic audit and ask. And when she tells you, here's places you could be stepping up your game, time to go take a macro progression and step it up big time, and then do the same thing at work, right? And when it's your turn to take the kids to the doctor or stay home with sick kids or something like that, don't slink out the back door quietly, leave loudly. Leave so it normalizes it for everybody, junior men, and for the women, so it's not so stigmatizing for them.
Absolutely.
And I will say something different. So buy from female-owned businesses. So women don't want more mentoring. They don't want more kind of unsolicited advice. They want you to buy from their business if they're a business owner. So buy from female-owned businesses.
Love it. But thank you all so much. It's so enlightening, and we're honored to have you today.
Yeah.
Thank you.
All right. Well, I want to thank you all for coming here. My name is Mike Anderson. Here's my particulars. My company, the PTR Group, I've been a speaker here at Embedded Linux Conference and many of the other OSS shows for about 20 years now. And we have been, my particular company, PTR Group, we're a consulting house, and we do a fair amount of work with different customers in the embedded space mostly, although we also build space robots for NASA. We handle all the software that's done in the space refueling mission for Restore-L at NASA and for RSGS at DARPA. So we've been in the business quite a while. I sold the company. I was one of the founders. I sold the company last year, the end of 2018, or excuse me, beginning of 2018. And then in February of this year, we got bought. The company who bought us got bought. And so I go from a 24-person consulting shop to a 40,000-person industry. If you want to have, for instance, a nuclear submarine or an aircraft carrier, hit me up. I can put you in contact with the right guys. That's what Huntington Ingalls does. All right, so let's move on here. So we're going to do a quick overview of the C group interface. We'll then talk about enabling and using C groups and what we can actually control with C groups. We'll talk about I'll show you a couple of example usages, and we'll get into a quick summary here. This is a very short session. It's only 35 minutes, I think. So we'll have to move through things pretty quickly. So there's not a whole lot of depth I can really get into in the short time, but we'll do the best we can. All right, so what is a C group? It stands for control group. It was actually added to the kernel in the 2624 timeframe. So it's been in the kernel a long time. But it didn't get really significant enhancement until the 3.15, 3.16 kernel timeframe. So it is a mechanism that's basically focused on trying to kind of hierarchically organize resources across multiple platforms, or excuse me, across multiple applications. And it applies to any schedulable entity. So this means that it works on containers, it works on VMs, it works on threads, it works on processes. So any schedulable entity inside of the kernel can be subject to C groups. Now, this becomes particularly interesting when we start dealing with multi-tenancy inside of large VM environments, where I need to be able to significantly limit the amount of resources that are assigned to a particular tenant or to a particular set of VMs. So we'll get into the details of that here in a moment. So exactly what does it do? Well, a lot of times we're interested in trying to place restrictions on applications. If we're doing safety critical applications, we need to make sure that no particular application hogs all of the CPU or hogs all of the memory or consumes all the IO bandwidth or all of the network bandwidth. So we need to be able to control that. And that's exactly what cgroups does. Now, it's as a mechanism, it manifests itself in sysfs. It is a file system, so it's a virtual file system, a lot like ProcFS. You do have to mount it. Depending on which version of the kernel you have, it may be automatically mounted or you may have to mount it manually. I'll show you how to do that in a moment. But the key thing here is, let's assume that I have a couple of processes that I want to be able to guarantee that no single process consumes all of the CPU. I want to be able to guarantee that both processes get exactly 50% of the CPU. With cgroups, I can do that. In any other mechanism, if I just let them run, then I'm not going to be able to control them that way. More importantly, I can also do things like lock them to specific CPU cores. So I can do CPU pinning and a few other things. We'll talk about all the stuff we can do with cgroups in a moment. There are two parts to cgroup. Now, is it cgroup or is it cgroups? It's cgroup if you're referring to the components in the kernel. It's cgroups if you have groups of cgroup. So it's kind of weird the way they define it, but that's okay. As far as the core is concerned, it's really responsible for establishing that hierarchy inside of the kernel. Now, the core is integrated in with eBPF. So if you're into Berkeley packet filters and all the things that BPF can do, then you'll find that cgroups is integrated quite nicely into that whole environment and can actually be controlled and provide additional information for you. The other piece of cgroup is the controller hierarchy, and the controllers themselves are the things that we're going to focus most of our effort on, because those are the things that manifest down in user space. So the cgroup hierarchy is actually manifest inside of sysfs, excuse me, by default. You can mount it other places. You can have multiple different mounts of the same cgroup interface in multiple locations in the file system. So the reason we might do something like that is a case in a multi-tenancy environment where I have individual companies in their own separate disk areas. So I may mount a cgroup interface inside of their particular disk area because I want to control that particular VM or set of containers separately from other VMs or sets of containers. So in the normal mechanism, if we're going to use mount, we'd use mount-t cgroup2 none, and then whatever mount point we wanted. Now, if you've got a cgroup2, it implies there's a cgroup1 someplace, and there is in fact a cgroup1. cgroup1 has now been deprecated, but you'll still find a lot of systems that still use it. You can actually mount cgroup1 and cgroup2 simultaneously on the same system. So that makes for some really confusing times. I don't recommend that you do that. Just use cgroup2. The major reason they came out with cgroup2 was to make it more compatible with Kubernetes and other similar sorts of mechanisms. So they actually saw, hey, yeah, the cgroup1, the hierarchies are kind of weird and it gets a little difficult to manage. So they simplified it considerably by simply saying, okay, let's just use cgroup2 and we'll clear a lot of this stuff up. Now, not all distributions enable cgroups. And even if they do enable cgroup, they may not necessarily enable everything inside of cgroup. So here's a quick little snapshot out of my 5.2.1 kernel. Obviously, it's an eye chart. You can't really see it very well, but there is a thing that says cgroup support. And when you enable cgroup support, there's a whole bunch of options that show up, which are all the individual cgroup mechanisms, the controllers themselves. So we'll talk about what the controllers are, but just understand that if you go to use cgroups in your distribution, you may not necessarily have the cgroup mechanism turned on in your kernel, which may mean you have to go back and rebuild the kernel. Now, most of the major distros, Ubuntu, Red Hat, SUSE, most of those distros have cgroup turned on. Whether they turn on everything in cgroup remains to be seen. You have to kind of look at it and see which ones are which, but at least you'll have a likely case that the cgroup will be turned on in most of the major distros. Now, there are some user space interfaces that you also have to have. In particular, libcgroup, cgroup bin, cgroup tools, and cgroup fs mount. Now, depending on your distribution, that's what they're called in the Debian world. If you're using one of the Red Hat or SUSE distributions, then your names may differ. But these are all user space tools that are focused on being able to manipulate and control the cgroup. So once I have the cgroup file system mounted, I can look at it here in the hierarchy, and you'll notice there's a whole bunch of things that are put together on this. We have, and we'll go through most of these functions here. So whether it's block IO, the CPU sets, the funky one is freezer. Oh, that's an interesting one. We'll talk about that one. And some of these others. We'll go through most of these just so that you understand exactly what they're supposed to be doing. And remember, this is a virtual file system. So what we're going to do is we're going to create a cgroup and then add processes to the cgroup. And then once we've added them to the cgroup, we can then associate these controllers to them. So what sorts of things can we actually control? Well, the first one is block IO. We're interested in making sure that no particular application takes the lion's share of all the disk IO. So for block IO, we're trying to limit it based on block IO performance. We want to make sure that this particular application gets no more than 35% of the disk IO. This is, of course, part of this, if you've never been in the service carrier or the service provider business, we have these things called SLAs. And an SLA is a service level agreement. So that's a contract between the service provider and the customer, where the service provider guarantees to the customer through the SLA certain percentages of performance. So they will guarantee that you will get X number of CPU cycles per second or X amount of disk IO per second. And in order for them to be able to guarantee that those numbers are met, they'll typically use cgroup in order to enforce that. And this also gives us the ability to do some accounting on that. So if somebody comes along and says, hey, you're not meeting my SLA, if the service provider can't meet the SLA, the customer gets money back. And no service provider wants to do that. So they're going to be able, they're going to focus on whatever tools they can get in order to be able to demonstrate to the customer that they've actually met the details of the SLA. So the first one there is the block IO. We just talked about that one. The next one is CPU. CPU deals with what percentage of the CPU you get for a particular application. Now, each application has at most 1,024 units of CPU time. And we can then adjust the units accordingly to limit the amount of CPU time a particular process gets. I'll show you an example of that here in just a moment. CPU sets. CPU sets is an interesting one because if you're familiar with the hardware, of course, when we're dealing with hardware, we have the L1 and L2 caches, potentially a tertiary cache if we're dealing with the x86, and then we have physical memory that we're trying to pull applications out of. So when I get ready to fetch something from the processor, and if it's in the L1 cache, then I can usually fetch it at the speed of the processor. So I'm really not losing any time if I'm running out of the L1 cache. However, the L1 cache is limited in size. Even on the big x86 platforms, having 32 kbytes of L1 cache, that's a big cache. And that's because the L1 cache is oftentimes implemented with like a 64-way set associative memory. It's extremely expensive from a silicon real estate perspective on the die. So we'll have 32 kbytes of L1 cache, but maybe 6 megabytes of L2 cache. So the L1 cache is made up oftentimes of static memory, whereas the L2 cache is typically dynamic memory. So if I have an L1 cache miss and it's in the L2, it's probably going to cost me anywhere from 5 to 10 clock cycles to pull something out of the L2. If I have an L2 cache miss and I have to go to the tertiary cache, then it's going to cost me 20 to 25 clock cycles. But if I have to go all the way out to memory to fetch that instruction or fetch that piece of data, that's going to cost me anywhere from 200 to 300 clock cycles. Now, understand in a processor like the x86 is a superscalar processor. A lot of processors these days are, which means that I'm executing more than one instruction per cycle. So let's assume that I'm running 10 instructions per cycle, which is one of the older x86 platforms, but let's just do that for the math. If I have to reach out to physical memory and it costs me 200 clock cycles to retrieve something from physical memory, well, that's 200 clock cycles times 10 instructions per cycle. That's 2,000 instructions that I've lost for one fetch out of physical memory. And I will never get that back. So how does that impact us with CPU sets? One of the things that we want to do with CPU sets is we want to lock processes to particular processor cores. And by locking, they call it CPU pinning. And when you pin a process to a processor core, you lock it into the cache. So when you allow an application to migrate from one processor core to another, it's coming into a cold cache. And therefore, all subsequent accesses for the first several thousand will be cache misses and force you to go out to the either to RAM or to the L3. So allowing an application to move back and forth is a significant problem if you're trying to guarantee performance. So what the CPU set C group does is it allows us to specify a number, a collection of processor cores that we're going to allow this application to run on. And by setting that collection of processor cores, we can then say, all right, I want to make sure that everything that's health and status monitoring runs on processor cores 1 and 2, and everything that's customer focused is going to run on the other processor cores. And I may, in fact, lock particular customers to particular processor cores, again, to optimize the use of the cache and guarantee that I can meet my SLA. So those are something that we would typically do through C groups. There's another mechanism to do this. This is called the task set mechanism in Linux. And task set allows me to lock applications to particular CPU cores from the command line. So you can also do this from the command line. You can do this with CPU sets. You can do it from the command line, or you can do it from within a GUI like virt-manager. CPU accounting just gives me information about the accounting usage. This might be something we would want to do in order to be able to guarantee and prove to a customer that we've met their SLA. We have devices that allows me to set which devices a particular environment or particular process can get access to. This is important. How many of you have ever heard of network function virtualization? Anybody? A couple of you. All right, so network function virtualization has to do with how I can take, say, an Ethernet card and dedicate 5 of the 32 channels off the Ethernet card to a particular VM or to a particular container. I can do this with containers as well. So they have some low-level stuff they do. They call it SRIOV, single root IO vector IO virtualization. They also have, Intel has their version called VMDQ. It's part of the VTC virtualization. The vPro virtualization is part of that particular architecture. But oftentimes what we want to be able to do is we want to be able to say to a particular application or container or VM, no, I'm sorry, you cannot open the modem. Or you cannot open device X, the card reader, the smart card reader. Or the smart card reader is dedicated to you so that nobody else can get it. So that's what the devices option does for us. The freezer, we'll come back to that one in just a second. Huge TLB for translation look-aside buffers. This is an option we can turn on in the kernel. You've got your machine that's got 64 gigabytes of RAM. How do you take advantage of those 64 gigabytes of RAM? One of the mechanisms is called huge TLB. If you turn on huge TLB support, some of the virtualization layers will automatically take advantage of it. If you have a virtualization layer that understands huge TLBs, you'll get about a 10 to 15% improvement in performance for that particular VM. So it's a significant piece, but huge TLB allows me to control which applications have access to the huge TLB facility. Memory, that one's pretty straightforward. That is how much memory I'm going to give to a particular application. And then I can deal with both user space memory, kernel space memory, and swap usage. So I can track it, I can limit it, I can make sure that I can account for it. All of that sort of stuff can be done through the memory functions. NetCLS, this is the classification interface. This one is particularly interesting for those of you who have quality of service requirements. So the Linux quality of service code has both classless and classful queuing disciplines inside of it. And when we're using the net classification option, we can then put tags on network traffic that will then force them down particular paths inside of the quality of service code. So I can guarantee that video, for instance, is going to be treated in one way, whereas bulk transfers like FTP would be transferred in a different way. So I could do traffic shaping, I could do traffic scheduling, I can do traffic policing using the net classification option. One that's similar, somewhat related, but because it has to do with networking, is the network priority code. Now, the network priority option then says, oh, well, I want to prioritize this user's application over this other user's application as far as network traffic is concerned. So if both of them are generating network traffic, I'm going to take this one first and then deal with this one. So I'm going to be able to set priorities on traffic. Now, I talked about the freezer. Let's talk about specifically what freezer does. Freezer is like putting your laptop to sleep. So with freezer, I can say all of the applications, all the processes that are part of this process group, part of this C group, go to sleep now, shuts them off. Now, I can then move them to another application, to another processor, and wake them back up again. So it's like process checkpoint restart kind of things you can do with the freezer interface. And it can also be used for, some of the virtualization layers actually take advantage of it. So for instance, KVM knows what to do with the freezer interface when it gets ready to migrate VMs from one place to another. Perf event, this is going to give me per CPU a mechanism basically to monitor threads that are given in a particular C group. I have the PIDs interface, which then allows me to keep track of parents and children when you get forked. So when you fork something off, who does it belong to? RDMA is the regulation of the DMA mechanism. So if I'm going to be doing high-speed DMA from kernel space to user space, this is a way I can control that. And then Unified actually splits out the control interface not by process, but by user. So I can then get to the point where I go, okay, well, let's say user A has 4 processes, user B has 20 processes. Well, in the grand scheme of things, user A is getting 1/4 of the CPU that user B is getting, because user B's got more processes that are all looking for CPU time. Well, what I'd like to be able to do is I'd like to be able to say that user A and user B are equally important. So give user A 50% of the CPU, so his 4 applications get 50% of the CPU, and user B's application, their 20 applications, get 50% of the CPU. So I can then do balancing at that level as well, which is really handy, again, for service level agreements where I have multi-tenancy that I have to deal with. So kind of the good and bad about the C-scope interface, or C-group interface rather, is that there are a lot of knobs that you can twist. And so many adjustments that sometimes it's kind of mind-boggling. Here's an example of just one of the C-group mechanisms, one of the controllers. This is the memory controller. And you'll notice here that we have kernel memory, we have memory usage limits. This is in user space. We have maximum usages in bytes. We have swapping. We have control for NUMA interfaces. We'll talk about that in a moment, which is becoming an increasingly important interface in a lot of the larger systems. And then I happen to have LXC and LXD installed on my platform. So when I took this screenshot, we saw a couple of extra things that were out there specific to LXC and LXD. So here's an example of manual C-group interface. I've got this test script here, and all it does is it prints a message and then goes to sleep. And it does that forever. So what I would like to do is I would like to then create a C-group. So I'm going to do, and this is going to be doing it by hand. We'll show you in just a minute how you can do it automatically as well. So we'll do a make dir inside of the C-group hierarchy. In the memory controller, we're going to create a new object called foo. And so this is just a directory is all we're doing here, but now we're going to add things to that directory. So we're going to echo 50 megabytes here into the limit in bytes option. So this will then set the maximum limit for the foo group Anything that's in the foo group will have this maximum amount of memory associated with it. If you did around and did a CAD on that, it turns out that the way these things work is they always round up to the next available page size. So on the x86, those page sizes are 4096 byte pages. And if you look at 50 million divided by 4096, you get these numbers. All right, so let's go ahead and we'll create an application. We'll launch it, and we'll get its process ID. Now, we need to get its process ID because that's the major mechanism that we use to add things to a C group. So now I know the process ID is 31344. So I'm going to then echo 31344 into the foo memory group cgroup.procs. So that's going to add it to that particular process tag inside a C group. We will then take a look at this using the PS command. We'll say, show me the C groups associated with process ID 31344. And this shows me that I have memory is associated with the foo group that I created. So that's the only one that's actually specific to foo. So now I can run the application, because I'm running the application at this moment. I can take a look at how much memory it's actually using. So I can take a look at its current usage in bytes and see that it's using only about 262 bytes worth of RAM. So I can limit it, I can monitor it, but I can also control it in the way that it dies. So let's assume that I have a memory leak. I can then set up the killer in such a way that it understands that this application, when it exhausts all the memory, is supposed to be killed and restarted automatically. So obviously I've got a memory leak. I need to report that and fix that. But I need to be able to also keep the system running while the DevOps folks are out there trying to figure out what's wrong. So I can then use the C group interface to be able to control that and make that happen. Now, here's an example of using this using libcgroup. And libcgroup has with it the C group tools. And these tools include applications like CG create and CG exec and CG get. So we'll see how those all work. So CG create allows me to create a group. So I'm going to create a group in the CPU controller called group A. I'm going to do the same thing for group B. Now, this is the CPU controller, so this is controlling what percentage of CPU time each one of these applications gets whenever they're a member of that particular group. So I'm going to use the CG get command. I will get the number of CPU shares for group A, and it comes back as 1024, which is the maximum number of CPU time slots for that particular application. And that's the default. We have the same sort of thing for group B. So now, what I'd like to do is I'd like to test this out. So let's create a couple of applications. We're going to do a CG exec into group A, and we're just going to do a DD. And we're just going to grab lots of nulls and send them off to the bit bucket. So we're just going to burn a lot of CPU time. Basically, I didn't want anything that would incorporate any disk I/O or network I/O or anything else. Just measure CPU performance. Do the same thing for CPU group B. Now, because both of those were both given the 1024 chunk slots, you will notice that they actually end up eating 50% of the CPU for each one of those two applications. Now, if that's not what I want, I can then go in and adjust it. So I can say that the CPU shares for group A are 768, or 3/4 of the actual full value. And for CPU group B, I'm 256, or 1/4 of the total value. And sure enough, when we take a look down here at the percentage of CPU time being used, I've now got 75% of the CPU going to group A and 25% of the CPU going to group B. So, and the dot, the actual decimal point out there had to do with the startup code and a few other things, so it ate up a little bit more than it should have. But once it gets to steady state, then it settles down and locks in at 25%. So we have effectively here a mechanism that allows us to control what's going on in our system. We can control memory, we can control network I/O, we can control disk I/O, we can control the assignment of CPU cores, groups of CPU cores. We can do all of that through through the use of the C group interface. Where this really starts to become important is when we're using either containers or VMs in a multi-tenant environment. If we're just running on-prem and we're just running our own code, then it's not really all that important. But it's when you're a service provider and you have to guarantee service to particular customers, or you're writing a mission critical application that has to have a particular percentage of the overall CPU, then this starts to become important. Some of the container solutions like LXC and LXD have an automatic interface to C group. We saw that when we did the little screenshot there. Others, you have to do it by hand. There's a monitoring tool. Actually, Kubernetes has a mechanism to go in and dork around with this as well. So we can either do it manually or we can allow things to happen automatically, depending on the policies that we set. Now, C group mechanism is tied to namespaces. So if we have a particular namespace defined, then we can add the namespace to the C group, and everything that's a member of the namespace then becomes controlled by that C group, whatever controller we added to it. We can have multiple controllers associated with a particular group. So I can limit not just memory or CPU time, I can limit everything on a per group basis. So if I have a namespace that I've got applications that are a member of that namespace, I can then drop the whole namespace into the C group interface and then control the namespace from there. So that's another capability that we have with this. And so that with namespaces and C groups, although they're not the same thing, they are closely related to each other. So we can actually take advantage of both interfaces if we need them for whatever application we're trying to do. So I got a couple minutes for questions. Anybody got any questions? Yes.
So on the slide number 17, where you showed this.
Yeah.
I was wondering what would happen if there was another process, not in a C group, that was also occurring CPU. What would we see?
Yeah. So in fact, this was just a snapshot of the top two. And it has to do with whether I've allocated them to specific CPU cores. So if you have multiple applications that are running on the same processor, and you typically do, then they're going to get in your way. So I can guarantee that these particular groups are well behaved, but anything else that's running on the platform may not necessarily be well behaved. So this is where the CPU sets C group comes into play, because now I'm going to assign C groups in such a way that the ones that are important are locked to their own CPU core and nobody else plays on that CPU core. So the scheduler will continue to run, and it will schedule things as it normally would, but it will not allow anything that's not a member of this particular C group to execute on those CPU cores. So I can then basically restrict the access to particular resources using this mechanism and taking advantage of the CPU set mechanism.
So as soon as you affect one C group to, or one core to one C group, the scheduler will keep the other ones, everybody else.
Well, there's another thing that you have to do. It gets a little bit more complicated than that. I wish it was that simple. But you do basically have to then tell the scheduler, don't schedule anything else on these particular CPU cores. So that's a little bit more complicated than that, but that's essentially what you're doing, is you're saying these CPU cores or core or, and this, because of the way the CPU set mechanism works, inside of a virtual machine, say VMware, I have virtual CPUs. Each one of those virtual CPUs is a process. So I can then set my C group restrictions on a per process basis for the virtual CPUs and control everything that happens inside of the VM. They do the same thing for containers, but it's a little more visible when you're controlling the virtual CPU. Yeah.
Child processes, so if there is a process that's been assigned to a C group, are subsequent child processes automatically spawned in the same C group?
Yes. Now, so they do in fact inherit the C group settings from their parents. If you're in a hierarchy, you cannot subvert the hierarchy. So you can't have a child process down here that's in a C group that only gets 25% of the CPU, suddenly say, I want 75% of the CPU. So you can't subvert the hierarchy. That's locked in.
So, sorry.
Yeah, go ahead.
So if you had assigned a process 25% of the CPU, and then its children start, and
But they will only get 25% of the CPU. The whole group will only get 25% of the CPU. So yes, you had a question back there.
Yeah, so let's say we've done all the allocations per C group for networking, CPU shares.
Mm-hmm.
Is there like alerting or thresholding that can be done through EPF?
Yes, yes, you can. So you can have it not only tell you that something is not looking right, but you can also have it reach in and start controlling things. And this can also be done as a script, by the way. So we can have it all basically set up so that it just starts up and just runs this way, and we don't have to sit there and interact with it in any way. Yeah, your question.
Can I, the system administrator, subvert the hierarchy? If I have an application in a C group that gets 25%,
Mm-hmm. Yes, you can migrate it to another C group. So yes, you can if you're the system administrator and you know where the hell you're moving it to, then yes, you can in fact do that. But it's no longer under the control of that C group. It's now moved someplace else.
The C group hierarchy doesn't necessarily follow the process.
Not, well, it does when you normally spawn it, but yes, you can in fact subvert it. It's like all Linux. There's always a way around it, right? Yeah.
Is there a good way to, after I've done all this work to set up these C groups, is there a good way to, instead of going back and manually writing these scripts, like pull my current C group?
Yes, that's inside of the C group tools. There's a mechanism to do that. And then if you're using things like Virt Manager will automatically be able to do it as well. There was a question over here. Yeah. Yes, CPU share. The question is, are the CPU shares relative to 1024? Yes, they are. That's a full CPU. That's correct. Yep. And it's real powers of 2, not bogus powers of 2, like 1,000. Yeah.
But by default, both of those processes got 1024. So didn't it add their shares together and then figure out their respective?
So yeah, so when you do 1,024, it's unlimited CPU time. And all we're doing is we're simply restricting it from the unlimited CPU time. And so the same thing applies to bandwidth, disk I/O, network I/O. 1,024 is unlimited, and you're basically restricting it from there.
If you only had those two groups, you probably could have said E was 256, and then the other one would have gotten the rest.
Yep, that's correct. Yeah, just like we got another one here. Yeah.
So if you just had the one group A, would it be allowed to go above 75%?
No. No. So if I restricted it to 75%, then it wouldn't matter what else was running, it would still only get 75%. Yes?
In this exact example, what would have happened if you tried to set these CPU shares higher so that the sum exceeded 1,024?
Then it would have jumped them to different CPU cores. And this is again where we get into the CPU set stuff. Because what's going to happen here is understand how the completely fair scheduler works. The completely fair scheduler tries to be completely fair. And that means it's got this red-black tree that's implemented that then keeps track of what CPU time you should have gotten in the perfect multitasking environment. So it's actually tracking what CPU time you should have gotten. And the one that's on the left-hand side of the red-black tree, the one that gets dispatched next, is the one with the gravest need. And so when we're tinkering around with these kinds of things, now we have to understand how the completely fair scheduler works. And of course, we can completely subvert that by moving its priority to a higher priority than 0. And it also has, you can still mess around with the soft priorities as well. So the things from -19 to +20. So you can still do that as well. Yeah. By default, it's overall in the system. So mine's a hexacore. If I look at it across the system, it's across all 12 cores because I got cores plus threads. If you did that in what will happen in the CPU set, you actually assign a flag for each CPU core you want it to run on.
Hello, good morning, good afternoon, good evening, wherever you are in this world. We are here again for another Coffee with C. How to let go of anger and resentment. We all have negative things that happen to us. People betray us. A random person is rude for no reason. As a result, we end up walking around bitter, angry, and upset. The thing that we don't realize is that the longer we carry this baggage around, the longer it will weigh us down. The best thing we can do is drop that baggage now. Whether the betrayal happened 10 years ago or 10 minutes ago.
Well, see, they betrayed me. They took advantage of me. They broke my heart. That's why I have all this resentment and anger with me. Are you just telling me to just let it go and tolerate the bad things that they do?
My friend, they hurt you once or twice. Don't let them to continue hurting you by you thinking about it. As long as you keep dwelling on that, they will continuously hold you back from peace and the happiness that you deserve. What I've learned is that emotions do not give us good advice, especially on the tough times that we are in. Knowing this, you have to know how to control your emotions. You should not let your emotions dictate what you have to do. Yes, what they did sting. It was the worst that ever happened to you. I get it. I really do. You have the right to be angry. You have the right to feel the pain. And you know what? Regardless of how much you contemplate and think to yourself why they did what they did, you will never understand. Because you are not like them. We have different values and experiences in life. You will never know the reason why. These are just many things in life that you don't have answer for. And if you keep trying asking yourself, you will get stuck and be more frustrated. Of course, there is a wide scale of how extreme that could have been. The lesser scale where they yelled at you or said something bad about you, all the way to the extreme of physical abuse and being continuously victimized by somebody. So here's what I want you to know. Being victimized, powerless, helpless is the reason why you are feeling that resentment. That's why you want to get even. You want to revenge because you are powerless and your initial response is to get your power back ASAP. But my friend, that is not the right way to get your power back. In fact, if you stay in a position of resentment, you will stay powerless because you will keep battling with this cycle of anger, resentment, and unhappiness. I know people who carry their resentment even what happened was 10 years ago. Guess what? The person who did you wrong could not care less about you. In fact, they're living their life without thinking about you. They couldn't care less about how you feel. They are now happy living their life without a single thought of you. Now, if you really want to get out of that powerless situation, I want you to shift your mindset. Are you ready for this? Okay, here it is. What I want to do is to equip you with the right mindset why you should let go of resentment. Now see, how can I get my power back? Here's the answer to this, my friends. Let it go. By letting go, you are positioning yourself to gain that power back. Letting go of that resentment frees you up. You are just about to drop that heavy burden that kept you stuck for so long. I want you to understand this, that letting go of that resentment is for your own self. You are not doing this to the person who did you wrong. What do I mean by this? So let's understand, why do you feel that resentment? What causes the resentment? Resentment comes from a situation where you felt victimized, betrayed, or powerless. Someone did something to you that he or she shouldn't have done. It made you feel victimized and powerless. Look, when you let go of that burden of resentment, you start to welcome forgiveness, peace, and happiness. There is no way for all of these to get to you if you let resentment block all of them. You will get your power back by being able to control your emotion, let alone that situation. You now get to decide how the situation will affect you now and in the future. All right, what happened, happened. What you felt about it, you felt about it. What that person did to you happened. You have acknowledged that already. You went through the pain, the anger. And now it's time for you to get your power back. Now, from here, from the new place that you are in, how would you go about it? From this, who do you want to be? How do you want to move forward? How long will you let this affect you? How can you take your power back and say, okay, this person did this terrible thing, but you know what? I want to get up. How can I take control? I want to get my power back. I am going to turn this situation into something positive. I am going to turn this into something that will make me learn and grow. I will use this to make me stronger and more capable. I am back and I am here to get my power back. So that's why I am moving forward. I am no longer going to allow this to make me feel bitter, angry, helpless, and powerless. I will let it go and get my power back by not letting it affect me ever again. I will take charge of my life, of how I feel, and how I will move forward. Keep your requests, your topics, comment down below. I create videos every week for my Coffee with C community, and your topic may be next. Until next time!
Welcome to the Mirror Talks podcast, where we deconstruct some of humanity's most disconnecting and limiting assumptions and offer an alternative, a free state of consciousness, unbiased, naturally wise, and genuinely loving. We will shed a more enlightened perspective on everyday experiences to help anyone willing realize their true potential and inspire a contemporary spiritual life lived in service to all. Say goodbye to the man-made paradigms of distorted ideas. Let's become pure, free, and actually intelligent once again.
We just finished recording an episode on deep suffering or deeply afflictive states, whether it's depression, chronic depression, or sort of more of a daily happening jealousy or being upset about something and it just sort of takes over your mood, and just how to deal with these states and really how to transmute them and take advantage of them. So one thing I just loved about this episode, and that I think you'll love too, is that in addition to being very technically precise, Bentinho outlines 3 methods for really transmuting these deeply afflictive states. So in addition to being really technical in that way, it's also a meditation of its own. So I was even thinking, as we were recording this episode, I was thinking, like, if I'm in another deeply afflictive state in the future, I'm going to remember this episode and I'm going to come back to it just for a reminder. It's like it's just like piercing the bubble of that, of whatever suffering might come up. So really, this is a resource in and of itself. In addition to that, there was a really special, cool ending. Dennis asked a question about social anxiety, which prompted Bentinho to go into just the coolest delineation of how the ego is hiding from us, and really how that mechanism is what causes the suffering and the deeply afflictive states. So basically comes at it from a whole nother angle. So it was a wonderful episode, really a resource forever, I think. And I know you'll enjoy it.
So welcome back, everyone, to another episode of Mirror Talks. Again, here with me, Kelly and Corey. How are you guys?
Great.
Good.
Awesome.
How are you?
Really good.
Nice.
Actually, really good. Yeah. So, as we're wrapping up the recording of our first season of this podcast, we were feeling into what other episodes to still shoot. And one that stood out pretty evidently is to give people some tools and some perhaps reassurance and some sort of a compassionate understanding space where they get some acknowledgement for the phenomenon of experiencing deeply afflictive states of mind, states of emotion, and so forth. So what's an afflictive state? An affliction or afflictive literally means something that's causing pain or suffering. So deeply afflictive states are states that just feel like impossible to escape. They have debilitating effects on our mental, emotional, physical well-being. They can even lead to physical illness. It's something that sort of can haunt us along the lines of PTSD. It's something that makes us feel like we don't want to get out of bed in the morning. It derails our sort of sense of purpose and our sense of flow during the day. And so these states are quite common in humanity, and I think everyone who is human will at one point or another experience something like that. So we figured we have addressed the mechanics of the emotional guidance system already, but this is kind of a beast on its own, like how to deal with deep suffering, with intense suffering, with debilitating suffering, with deeply afflictive states. So that's the intention for this session.
Awesome.
If you guys have any prompting question, feel free.
All right. Well, I know a bunch of people who spend a lot of their time, most of their life, in a deeply afflictive state. Like chronic depression or whatever it is, some sort of addiction. So I think it is really quite common. And I wonder, like, for people who this makes up their norm, this is their normal life,
their daily background noise.
Right. How do you break through to someone like that? How do you break through a cycle like that?
If you're that person, right?
Yeah.
So I think I want to refer back to sort of a core structure that people can fall back on. And that is, I'm quoting the law of one, that the path consists of 3 steps. Step 1 is know yourself, know thyself. In other words, understand yourself. And this sentence, know thyself, in this context, it doesn't mean know yourself as the absolute infinite reality, know yourself as God. In this case, know yourself means know what's happening within you, know what's going on in front of your consciousness, know what's going on the screen of your experience, the screen of your life. What's happening within you? Why are you having, first of all, recognize and acknowledge the thoughts and emotions that arise. Like recognize them, acknowledge them.
As opposed to ignoring them or being in denial.
Right, yeah, which would be not knowing them.
Got it.
So know yourself is a process of acknowledgement, of observation, of becoming familiar also with your own patterns and recognizing the patterns in your emotional responses to things. Recognizing the patterns in your thinking and so forth. So a full-bodied knowledge of oneself is ideal. To know yourself as clearly as you can. This is how I typically react in these types of circumstances. This is the bias that I have. This is the belief that I have. These are the preferences that I have. And when this kind of thing happens, this is how I emotionally respond. This is how I respond in terms of action. This is what I'm thinking. This is how I'm feeling. This is when I feel victimized. This is when I feel arrogant, and so forth. Just all of it included. Ideally, the holistic being, the holistic seeker, knows themselves fully, knows themselves on all levels as much as possible. There are other priorities than knowing yourself in every detail on all levels, because that could be the study of a million lifetimes, right? So we got to take that with a grain of salt at some point. But the basis is there. The basic instruction is know yourself, understand yourself. Step 2 is accept yourself. So now that you know yourself, now that you see your patterns, now that you've observed your pain and you kind of begin to understand it, or maybe even fully understand it, now it's time to accept/forgive/release/let go of that which you know. To just let it be as it is, to not interfere, to not blame, to not judge, to not hold on, to not constrict, and so on. So again, step 1, know yourself. Step 2, accept that which you now know about yourself, accept yourself. And then, and for the most part, almost only then, does the third step open up, at least in a holistic, integrated manner. You could try to skip to step 3, and some people do, but very few do so successfully. And so I don't recommend it. On the whole, periodically, one can do it, but on the whole, it's important to understand yourself and to accept yourself, to incorporate that. And at step 3, that opens up once we know ourselves and once we accept ourselves. And once, therefore, we're in a sort of a state of peace with ourselves and equilibrium and acceptance. So once we know ourselves and once we've accepted that which we've now discovered about ourselves, the third step opens up, and that is, at least in Law of One, they state it as, become the creator. And this is really the step where spirituality in its truest form begins. The first 2 steps are prerequisites, and that's what we're mostly going to talk about today, is like how to accept that, how to attain that self-knowledge on a relative level, knowing my relative self and accepting my relative self. And relative self simply means anything that moves and changes and has shape and form and dimension and emotional charge and belief systems and so forth. Those things are all relative. They're all contextual. They all exist within the realm of perspectives, belief systems, thoughts and emotions, and physical events. Seemingly physical. So a lot of my work focuses on the third step. Also, a lot of my work focuses on the first 2, but a lot of my work focuses on the third step. So we won't talk too much about that today, but it's good to notice or to know that it's part of this 3-step formula, right? So we have to know our relative selves, accept our relative selves, and then it's like our beingness, our mind, body, spirit complex becomes sort of this fit, integrated, whole, potent trampoline for us to take the shuttle up into spirituality, true spirituality. Transcendence, awakening, enlightenment, self-realization, higher states of consciousness, and so on. But how can one have access to that in debilitating states of suffering?
Right.
For the most part, one can't. I mean, it's possible. It's definitely possible. And part of the methods that I'll be prescribing, so to speak, will allow for that access to deepen. So when we are in deeply afflictive states, the experience is that of extreme disconnect from source, from the creator that we are ultimately. So that third step of that true spiritual step, that quantum leaping into self-realization, enlightenment, realizing the oneness and so on, the universal love, we feel very disconnected from that. In fact, that is the pain. That feeling of disconnect, we can never be disconnected, but the feeling of disconnect is generated by some perspective, some belief that has such an opposite view to the truth of God, to the truth of source, to the truth of existence, to the truth of oneness, to the truth of our infinite worth, to the truth of our eternal nature, to the truth of our absolute freedom, to the truth of the cosmic perspective. Our perspective in a deeply afflictive state is so contradicting that infinite abundance, infinite love, and so on, that we feel the contrast between the truth and our perspective so strongly.
Mhm.
And it's so strongly that it doesn't typically let us go. It doesn't allow our attention to wander away or to sort of rise up to the higher levels. And so we feel stuck in our bodies, we feel stuck in our emotions to a debilitating extent where we can't even mentally function normally anymore. We don't want to see other people. It's got all kinds of expressions. So for the basic understanding of this contrast between our connection to source, the truth that's always here, and our perspective, I'll just refer people to the episode we did in depth on the purpose of emotions, the emotional guidance system, how to use them, and also and so on. So people can watch that or listen to that, which is actually good prerequisite content for this episode. So now we're just highlighting, we're singling out the experiences that are so distracting that we can't focus on our spirituality anymore, such as chronic depression, sort of existential angst, deep sort of confusion, lethargy because of this deep-rooted sense of unworthiness, perhaps.
Or even temporary jealousy or heartbreak or...
True. Yeah, the responses that we give to certain circumstances,
Right.
certain catalytic circumstances that then trigger our perspective, our belief that we're lacking something very important to us.
Right.
Which is another way of saying, like, we believe we're disconnected from source.
Mhm.
So how to deal with those states if you experience one? Whether it's through like a sudden heartbreak or the death of a loved one, or whether it's just sort of a state that you have become familiar with for quite some time, but it won't let you go, like it's causing you deep suffering every day. There are several ways to handle this that has benefits, beneficial ways to deal with it.
Cool.
Without having to use substances and so on. Now, there's a lot of nuances here because it really is a case-by-case basis in the end. So people have to sort of take this general knowledge and apply it in a way that is helpful for them in their situation and their selves. So they have to know themselves and then apply this to themselves in the best way, according to their own intuition. So a few ways that we can use these afflictive states. If the afflictive state is not too intense, because here's the thing, more context, this is important. The reason these states stay with us when they do, when they are there, the reason they don't dissolve is because we're not gaining the understanding and the acceptance that are the first two steps. Because it sucks our consciousness into such a tiny little confined corner or perspective or point of view within the overall infinite existence that we really, in that sense, feel trapped. And because we feel trapped, we lack perspective. If we feel trapped in a little box, we lack the meta view. We lack the overview. We lack context. We see no context. All that we see is that we're suffering, that we're in pain, that our loved ones left us, or some other kind of catalyst. So we only see the details of the event that we select based on our insecurities and our fears. And we only see our perspective. So we're stuck in it. That's why it's so deeply painful. It's because we're lacking understanding. We're lacking perspective in that moment. Understanding and overview or perspective are somewhat synonymous. So if we don't have that perspective, then naturally our perspective is so small that it will contradict the nature of reality. And so we feel that strong emotion. If the afflictive state is not very afflictive, if it's just a general emotion, I would typically recommend people just use the emotional guidance system and they observe their emotion. They observe what they must believe is true in order to feel this way about this event or that person or this happening. And when we have just a general emotion, that's quite easy to do because we're not sucked into it all the way. So we still have some understanding. We still have some context. We still have some overview. We still have some access to the greater picture of things. We still have access to other points of view. Now, this one might be triggering. This one might be painful. But because we have access to, at least to some degree, to other points of view, it's manageable. It's something we can observe. We're not completely locked into it. We're not completely identified with it. And therefore, we have the space to observe it. We have the space to understand it. So then in that case, which more applies to our session about the emotional guidance system for most sort of everyday general emotions and reactions. So let's say there's just an everyday sort of emotion. Something gets triggered in us and it feels very annoying and it feels frustrating and it draws our attention in. However, we can still rationalize. We can still see that it's maybe not entirely true. On some level, maybe we realize that we're being a little irrational because we have access to other points of view. But when you're in a deeply afflictive state, you have no access to other points of view, or very, very minimally. Therefore, you might be able from the back of your mind to sort of know that you're no longer being rational, but you don't have access to that point. You're not seeing it from that point of view, right? So again, you're boxed in, you feel imprisoned in your emotional experience. So this is where the understanding part makes sense as well. The more space we have from our present perspective, from our activated perspective, the more distance we have, the more overview we maintain, the more we can understand that no point of view, although it's logical from its own point of view, the perspective is logical from its own point of view. We at the same time can realize that it's not the whole truth. We have access to sort of, we can, what's the word, relativize? Is that a word?
I don't know, but I like it.
Make relative to, we can see, we can compare perspectives and be, well, maybe this is an overreaction. What's going on here? Let me look at it. It doesn't grip us by the gut or the heart and just takes us over. So again, in that case of the general everyday type of emotional reaction or trigger, apply the emotional guidance system and use it as a tool, as a reminder to get to know yourself. So the question, one of the main questions to ask yourself to get to know yourself is, what must I believe? Or what perspective must I have? What definition or belief system must I have in order to have this feeling about this situation? Because again, if you didn't have that belief or definition or perspective, you wouldn't be able to have the emotional feeling. So every emotion is an invitation for us to get to know our perspectives. And this is the process of know yourself, understand yourself. And then once you understand it, like, oh, this is why I feel this way. Because I believe if this person says that I'm not good enough. Great. I've now identified that belief. And I can now relativize that, meaning contextualize that, meaning compare it to other perspectives, other things that I've learned in life, other things that I also believe in and know. And through that comparison or relativizing principle, again, I don't know if that's an English word, but you understand what it means now, to make relative to other perspectives. Because we can do that, we maintain greater access to more of existence, and therefore we feel better than we do in an afflictive state where we only have access to one perspective for the most part. Or it might be a series of perspectives, but it's all rooted in this one sort of core belief that's being triggered. So then moving on from the general emotional triggers to those more deeply afflictive states of deep suffering, intense suffering, debilitating suffering, where our entire sense of self is wrapped up in it and we lose access to the vaster context of existence. And we can no longer make our experience relative to a bigger contextual view, the meta view. What to do when that's the case, when you're just gripped at your very core and there seems to be no way out. And I mean, this is the state people are in when they are contemplating suicide. It's like, I don't know how to get out of this state, right?
I think in many ways, aside from people who are suicidal, it's way more common than we think. Just people actually boxed in this little, completely limited, completely separate. I think it's quite common. I think a lot of people just live their their 9-to-5 work life with this type of a.
Totally, I agree. Yeah. So then moving on from our everyday sort of emotions where we don't lose all touch with reality. We don't lose all touch with other perspectives, even just human reality, because I mean human reality, meaning human perspective, the perspectives that are sort of accepted by all human beings to be true to some degree, the paradigm of the human mind, basically. To me, comparatively to what I know, that is equals suffering. It is an afflictive state. However, compared to the even deeper, more boxed in afflictive states and perspectives that we can have, that's actually a breath of fresh air.
Mm-hmm.
It's context. It's what we call reality. Like, oh, I can rationalize. I can see that I'm being kind of irrational, that it's not completely true what I'm thinking. But again, if we then move into those deeply afflictive states where all of our energy is sucked into this box of a perspective, of a belief, then how do we deal with that? Because now, even if we know about the emotional guidance system, we may not have access to it. We may not have access to any kind of wisdom or any feelings of relief or any sense of a bigger perspective. So then how do we deal with that in that moment when we have no inspiration to go on YouTube and watch one of my videos or listen to a guided meditation or meditate ourselves, when it's just so consuming and so distracting? What do we do? What's left? In this type of state of mind, state of attention, state of consciousness, state of emotion, we cannot always go the route of understanding ourselves because we don't have access to it, because understanding requires context. You see, you cannot understand something unless you stand under it, so to speak, unless you're beyond it. So as long as we stand beyond what we're perceiving, as long as we have space around the perspective that's generating the emotion, we can observe it, trace it back to its root belief or perspective, compare that to what else we know about life, what else have we learned, what else do we truly believe, and or faith in our infinite nature, even if we don't fully believe in it yet, but we can compare our painful perspective to something that we've learned in sort of these spiritual teachings, for example, and we can gain faith, and we can in that way ease the emotion, deepen our understanding, and release the core belief and accept ourselves in the process. But if you're completely sucked into the moment energetically and you don't have any access to any of that, what do you do? Like I said, you cannot really understand because you lack perspective. Therefore, the understand yourself step kind of goes out the window. And that's quite okay. We don't always have to understand why we have certain emotions. It's helpful, but we don't always have to. Sometimes not understanding our emotions and having such a deeply afflictive state that completely draws in our attention and boxes us in is a great teaching tool that teaches us other types of understandings, quantum leaps, and it can sort of enforce a self-acceptance at a deeper level because we don't even have the understanding. If we understand something, typically it's easier to accept it because now our rational mind is involved, our logic is involved, our perspective is involved, our conscious mind is involved. But what if you can't understand exactly why you feel the way you feel? You just feel overwhelmed by the feeling. Now you can, in a sense, skip the understanding step. It will always come later anyway. And try to go to the acceptance stage if you can. So here's one way to deal with afflictive states. And to use an analogy to further elucidate the distinction between sort of an everyday emotion that's not super high on the scale of being afflictive versus a deeply afflictive state would be like being on a train station and having many different trains to choose from. You can go on this train, that train, and you know they go to different directions. So you might experience the train that's right in front of you, but you know you can get to a next, to a different, platform and take a different train. So you have options. The difference is options. Perspectives are available to you. In a deeply afflictive state, you're already on the train you're on. And what can you do when you're on the train you're on? You can't jump off. You can't choose another train. So it feels very limiting. It feels very constrictive and therefore debilitating. You're on a train you don't want to be on, and you're going in a direction you don't want to be going in. But you're on it, and you can't, the only thing to do would be to jump out of a train, but that would equal suicide, which I would try to avoid. So then you're on this train, and your only option is, therefore, to accept. What is to accept your current state? But even the thought, if you're in a truly deeply afflictive state, even the thought of self-acceptance is not always that available.
Right.
So in those more extreme afflictive states, I recommend, there's a couple of things you can do. I'm going to prescribe 3 methods. One is use this as an invitation, because you have no other options in that moment to change your feeling state. You always do, but it doesn't seem like you do. You don't feel like you have access to it. You try as hard as you can, but it's not working. So since you have no other options anyway, use this as an opportunity to get to know the ability that you have, the innate ability to direct your focus. So this is different than trying to work with the perspective. So give up working with the perspective. Again, only when you're in a really deeply afflictive state. Otherwise, it can be helpful to deal with perspectives and understand them. But if you can't, then you simply can't. And so in that moment, what I would recommend is grab a hold of your attention itself. Notice that you can direct your attention to something. Now, ideally, this is the God state, for example, the state of awareness, love, light. But sometimes you simply won't be able to do that. Or you will feel like you won't be able to do that. So, but that doesn't matter so much. You can focus your attention on anything that takes you out of the perspective that you're in. It may take some time. So this is practicing concentration. So you're using your deeply afflictive state as a concentration exercise, because you have no other options. It's either intense suffering or slightly less suffering with the training of your concentration. So choose anything, the image of a mountain, or the concept of space, or a feeling in your body that's not affected by the afflictive state. Some feeling of peace, some feeling of stillness, perhaps, in the storm, amidst the storm of your emotions. But the key here is to not try to change what you're experiencing, because you already hopped on the train and you have to wait until the next station. In between, you can't do anything. And right now, your afflictive state can be seen as being on a train in between 2 stations. And you know at some point it's going to change. Now, some people are on a very long train ride from one station to the next, but the train can be rerouted to an intermittent station that you didn't see coming if you practice concentration. Because focus is everything in these states. You always have access to focus on one thing more than the other, always. This free will is never taken from you, no matter how afflictive your state of emotions is. If you grab a hold of your concentration, of your attention itself, and you direct it onto something that is not directly related to your suffering, like I said, a mountain, or a memory, or space, or if you can, faith in God, faith in that all is well, that a station will come your way. So just simply write this one out. Don't try to change the train, because you can't. Don't try to change your emotions, because you can't. Don't try to relativize your perspectives, because you can't. If you can, great. But if you can't, and you notice repeatedly, I can't, it doesn't work, it continues to even make the emotion bigger and more highlighted. And I feel even worse because it's not working, and da-da-da. So then you got to get out of the frustration about your afflictive state as much as you can. Because there's often a lot of layers of frustration and unself-worthiness and lack of self-esteem and all that added onto the afflictive state when we're having it, because we can't change it and we can't function properly. And so we blame ourselves further and judge ourselves further. But this is not due to the afflictive state. This is due to our lack of concentration on something else. So in those moments where you're on the train, you can't change anything, seemingly, grab a hold of your attention and just focus as pristinely as you can. Ignore, let be, allow whatever is to be exactly as it is, and take your attention itself and focus it, point it in a different direction. Point it on something that is not that perspective or emotional state. That's not that circumstance. You could call it ignoring. Ignore what is experienced as much as you can which is better in this case than trying to change it. So you ignore it as often as you can, as frequently as you can, for as long as you can. And this is not something that requires like physical effort. You know, I don't want people to have the image of like squinting eyes and like, you know, wrinkles forming on your forehead, like you're concentrating. It's not that, because that's all part of the afflictive state. So it's like you want to almost drop underneath your current experience. Let it be, give up, don't try to change it, realize you can't change it right now, and that's okay. Find some acceptance with that. And instead go one step back to your attention itself, knowing that what's right in front of you, if you open your eyes, is the suffering. But if you close your eyes, symbolically speaking, if you go back one step in your interior experience, you can grab a hold of your attention itself and you can concentrate on something else. It doesn't have to be meaningful, but it can. But not if it conjures up more negative emotions. Because if now, let's say you're now using that, you're grabbing your attention and you're starting to focus on God and the spiritual teachings. But because you have no access to it, all kinds of negative thoughts about it start flowing in and developing a negative relationship to spirituality or to God, or like, why am I experiencing this? God must not love me. So then that's not a productive way. That's not effective to concentrate on that. So in that case, something meaningless is actually more effective. So focus on the substance of wood, for example, like, because I'm just looking at this table right now. It's a beautiful wooden table. And just appreciate the way that the light reflects off and how it shows different textures. And just keep focusing on that. Bring your attention to the detail of something else. And mostly two things happen. One is you begin to take away the energy, the inertia, the momentum behind your perspective. So you're starting to rob it of the fuel that it needs, which is your attention, to survive. So you're actually suffocating the core perspective in that moment that is giving you such a deep afflictive state, such a contracting feeling. And you're depriving it of that fuel, and you're beginning to reroute it. And don't be in a rush with this. Just know this is a long-term game, almost. Nice. Like, it can take you hours. And it's okay. It can take you hours to find some relief. But what's your other option? Right. Your other option is just to further exacerbate what you already have going on, further add fuel to that momentum, and further frustrate yourself. So since you have no other option, since you can't go to the beach and hang out with your friends and have fun, since you can't go plan your next most exciting project because you have no energy for it and you're so distracted by these emotions, then really suddenly it sounds quite appealing to focus on a wooden table for 3 hours, right?
That's
because
great.
It's not normally appealing. It wouldn't normally appeal to the ego. But if that gives you even a little bit of relief, you know, when you're in like intense physical pain, and it just dissipates by 20%. It's like, you feel even better than when you normally feel when you have no pain and you're just distracted and it's just a random moment.
Yeah.
Because the contrast of going from intense pain to slightly less pain feels like pleasure almost. And you can train this in yourself to concentrate on something meaningless and hold on to that, not with tension, but with subtlety, if you can. So ignore the loud thoughts as much as you can. Let them be, accept them. Don't try to change them because it's not working. Drop into a subtler realm where attention itself becomes aware of itself. And now you can redirect this attention to a completely different view. And it might take practice because you're distracted by your thoughts. So you concentrate little by little, little by little. You notice more details. And what you start to notice after a while of going back to your new, let's say the table that you're focused on, or the image of the mountain, or some feeling in your perspective that's not bothered or that's not somehow affected by the rest of the canvas of your experience. If you can find one little spot in the canvas, in the painting of your present experience, that's somehow not turbulent, that's somehow still or unaffected, and you just develop that sober attitude, just radically stop wanting it to disappear, the suffering. Radically stop wanting pleasure. Radically stop wanting to change your life. Just stop all that because it's not working. All you do is you suddenly become excited about the simplest, soberest, most mundane thing, which is to focus on wood. And first of all, you start to discover things about wood you never knew. But But the most important part here is that you're suffocating the perspective. You stop fueling the perspective that generates the afflictive state. So you'll start to notice more and more and more relief. And now this energy momentum of your attention begins to pick up momentum in a different direction. And you're gaining perspective again. Don't immediately go back, try to understand the suffering, because you're not ready yet. You're going to be sucked right into that vortex of momentum, and you're going to be stuck in the same perspective, because the more you think about it, the more convincing it seems again. Have you experienced that? Where there's some situation in your life and you have some relief from it for a little bit, and you're like, oh, I'm done. Maybe I'm over it or whatever. And then you get some text message or like some picture on Instagram that reminds you of this or that situation or that person that has something to do with. And boom, you start thinking again, this was unfair. This is not good. This is, but this is going to, and immediately you're back in the vortex. And when you're back in that energy of negative, afflictive states and perspectives, it's again going to be pretty hard to get out of it.
Yeah.
So you want, if it's a truly afflictive state, give yourself permission to ignore it for quite some time.
I love that.
Not as an attitude of denial, but as a sign of faith in yourself that you'll come back around to it when you're ready. But right now you don't have the means, meaning understanding or context or perspective or meta view. You don't have the means to deal with it, to understand it, to resolve it, to heal it in a relative way. You got to go and ignore it for a while. And you've got to take your attention away from fueling that perspective. You've got to gain different experiences that are outside of that box, that give you confirmation of your worth, that give you confirmation of your self-esteem, that give you positive self-esteem, that give you confirmation that there is hope, that give you confirmation that there's other things to focus on in life, that give you confirmation that maybe it's not as bad as it seemed. And focusing on a wooden table can be your initial way out of that energy momentum, something meaningless. And it's all about concentration, subtle attention, redirection, repeatedly. Just commit fully to that, because what's the alternative, my friend? It's absolute suffering and pain and destructive behavior. So suddenly, doesn't it sound quite exciting to redirect your attention and concentrate? Place your attention on something that allows you to not be in the perspective that generates that emotional suffering.
Nice. I love the rationalization of that, of just looking at the ultimatum of an afflictive state. Like, if this is my only option, then it makes anything else quite appealing.
Nice.
But I think a lot of times people just don't have the context even enough to make it into an ultimatum. They think they're going to solve it by continuing to think about it and think about it. But so that's what I love, the permission to just.
That's a great point. Yeah. They think that by staying in it, they're somehow going to fix it.
Right.
And this at least gives you a direction of your focus. Because I think one of the worst things about those states is feeling how directionless it is. And you're kind of searching for a direction. You're like searching for a way out, but you just can't find it. And it becomes your whole reality, your whole world. And when there's sort of a way out or a window, it's such a massive relief.
Great. Yep. So the second method, which is very closely related to this one, but it's just sort of the next somewhat more advanced, perhaps, step. And whether or not this is a more advanced step kind of depends on your prior experience with resting in awareness, with resting in sort of pure presence and beingness and awareness aware of itself, or attention aware of attention, or consciousness aware of consciousness. This is a subtle practice. This is the science of self-realization, or the art of self-realization. It's where the self, that witnessing consciousness, becomes aware of its own essence, its own nature, its own presence, its own existence. And then it more and more maintains that existence awareness, that self-existence awareness. If you can do this, that's fantastic. It's the same exact principle as focusing on wood and just staying with it, subtly staying with it, subtly staying with it, getting distracted by it, returning to it, staying with it, generating a different momentum. If you can apply this principle of concentration on attention itself, then you start to drill in the direction of the well of well-being, the well of joy, the well of love, the well of bliss, the well of transcendence, the well of knowing yourself. So that's great if people can do that. They can just stay with that sense of I am, I exist. And sometimes we give ourselves, from a higher self's point of view, we give ourselves these catalytic events to really purge ourselves of the perspectives that lay dormant within us, that then come out full force, and we have no other perspective, no access to other perspectives. We really feel the full blow of it. But then, because it's so all-consuming, it's a great opportunity to not try to get into it and understand the relative mechanics of our thoughts, but to just sort of bypass it altogether for a period of time, not as an attitude of denial, but as an attitude of faith and just logic, like this is all that works for me right now. And I'll come back to it later when I have the space and the clarity and the perspective I need to change that perspective into a proper understanding of the way reality works, and my true worth and my true infinite nature, and so on. So if in that moment you can hold on just to attention itself, being aware of itself, then that's sort of a step up that's more beneficial than focusing on the wooden table. But the initial step, if you don't have access to anything that subtle, focus on something that you know you can maintain concentration on, that's less subtle than consciousness, that's more obvious, like the wooden table, which is reflecting light in a certain pattern right now. Or anything. I mean, this is just one example. People should choose whatever they have access to. It doesn't matter what it is. What matters is that you redirect your focus. That's all that matters. So whatever you feel you can focus on, that doesn't generate, that's one requirement, it doesn't generate negative emotions. So you're not focused on a topic that means something to you, that you could conjure up negative thoughts about or beliefs. Hence, the wooden table, because most people don't have beliefs or definitions about that. Doesn't matter to them. And if you can maintain that, then you can progress and just hold on to awareness itself, consciousness itself, I exist itself. You could try that immediately if you have prior experience with it. But if not, it'll just frustrate you. Like, oh, I can't find enlightenment. I can't find myself. Da, da, da. So only do that step, the second version of this method, if you know you can. But then it's a great opportunity. Then it's a great catalyst, because now you're forced to concentrate. Whereas when you don't have such an afflictive state, you're easily distracted by your addiction to sense pleasures and sensuality and hope and promise of a better future and this and that, and relationships and validation from others and all these ego boosters, success. You're so distracted by that. But when you're faced with a brick wall or a train that you're on that you cannot step off of, and you've got to experience what you experience, accept it and move your attention. Don't try to change it, in other words. Let it be. Let it be exactly as it is. Don't try to change even a single ounce of it. Don't want anything to change from your emotional state. This frees up your attention to focus on something else. Become fascinated with the details of the table. Do this for hours if you need to. Because again, what's the alternative? It's quite exciting suddenly. Do that. If you can't focus on I exist, just the feeling I exist, that's spacious but spaceless, timeless feeling I am. And rest in it, stay with it. And then notice, as soon as you start suffering, you're back in the mind. Great reminder. Normally you're distracted by pleasure, but now that you only know pain when you go out into the mind field, which is kind of like a minefield, then you're instantly remembering, you're instantly reminded in a very obvious, painful way that you've lost attention of I exist. So use this. If you have prior experience with the I am, and this is one of your passions, then especially use the afflictive states to become anchored in that consciousness of consciousness itself. And it doesn't take long then, if that's successful, it doesn't take long for the afflictive state to leave you, to disappear, to diminish over time, but rather rapidly. Sometimes instantly, if you sort of hit a new level of freedom and perspective. Because again, emotions are the reaction to a perspective that you're having, because they're guidance. It's a guidance system. So if suddenly you change your perspective by drilling into the I am, that 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 I am, I'm conscious, I'm conscious, I'm conscious, I'm aware, I'm aware, I'm aware, I'm aware, I'm aware, I'm aware, and you stay with that, stay with that, stay with that. And as soon as you go out of it, it's like, the feeling is there. Okay, I am. Coax yourself into this repeatedly, subtly, no stress, but concentrate. Give yourself this gift. Ignore the thing, let it be. Focus on I exist, I exist, I exist. Or wooden table, wooden table, wooden table. Clear blue sky, clear blue sky, clear blue sky. What can you learn about the clear blue sky that you've never noticed before? Go there, go there, go there. Fantasize if you must. If you can't concentrate on one state, fantasize a little bit about that one topic that has nothing to do with the things that trigger your emotions. Something meaningless that you could discover some form of beauty in, perhaps even. Not meaning, but beauty. Mystery, awe, some sense of like, respect. This will change your energy. And then suddenly you have, because you're in a higher frequency, now you have access to different songs coming through the radio because you've dialed your radio, your body, your mind, your attention to a different range of frequencies. Therefore, the song that you're hearing, the emotions that you're feeling, the response of your emotional guidance system that's now responding to your new perspective, once it's stabilized, is going to be a stable, steady song that is commensurate with how much that perspective is in or out of alignment with source. If it's closer in alignment than your previous perspective, the afflictive state is going to pale in comparison to your next negative state, which will feel very positive comparatively, right? And so you just you bump this up a little bit every time. You move your frequency up, your perspective up. Once over time, over days, over weeks, maybe over months, maybe over years, when you're able to stabilize and you've gained so much new perspective of yourself and of life, and your symbiotic relationship of yourself and life and your self-esteem has changed, now you can look back upon such things without getting sucked into them because you maintain the overview. So now what used to trigger an afflictive emotion becomes more like a general everyday type of emotion that you can now study if you want to observe and get to understand, why was I feeling that way? Because I believed that situation meant I was abandoned. Now I see I was never abandoned. My higher self, cosmic consciousness, God, it was all present in me that very moment. I just couldn't see it, but I see it now. So now, bringing my current perspective to that sort of past perspective that was at the time all I could see, and therefore the emotions that could respond to that were only negative. Now, I can look at that perspective, even look through the lens of it a little bit, but I can't believe in it anymore because I've learned too much about life. I've learned too much about my freedom. I've learned too much about my existence. So there's no way that this thought could now convince me to feel that way, to believe that way, and therefore feel that way. This is similar to the relationship episode we did, where I sort of described the process of being in deeply afflictive states about a partner leaving me, and now kind of just that causing a giggle in a way, where I can't believe in that perspective anymore. That cost me so much pain. That seemed to be my entire reality at the time. So emotions are not factual. They're never factual. They're always the opposite of factual, if we take it all the way. Any emotion is evidence that we're not seeing things clearly. But again, we address this in depth in the Emotional Guidance System episode. So again, I refer people to that one. So,
cool. Method 2. I love basically using an afflictive state as meditation boot camp practice.
Enforcer, yeah.
Yeah.
It's your higher self forcing you to sit your ass down and realize more of yourself.
Yeah, drill sergeant.
Yeah.
Love it.
So in that sense, it's a gift, and you can see that. Me looking back on my own afflictive phases in life, I just see how they purged and reprioritized my entire focus. So I'm only grateful for them, and I can only see how benevolent and divine, if you will, or intelligent that guidance system was. But at the time, I couldn't see that for sure. So it's all good. It's all you giving this gift to yourself. I know it doesn't feel that way when you're in it, but you'll see that later on. Have faith in that. That alone can bring you some soothing feelings that will take you a little bit out of that momentum of the afflictive state. Now, another step one could take, which arguably is even more advanced.
Is this the third method?
The third method, yeah, would be to investigate. But I really don't recommend this for most people, because you gotta sort of have this clarity already practiced to a high degree in order to not fall into an intellectualizing process with yourself. But it's asking yourself the question, who is id? What is the me that believes it's the one that's at the end of the stick of this experience? Who is this me? What is this me that believes this experience belongs to, or pertains to, or is happening to, or is created by? Because there is no such me. It is just another idea, a notion, a belief. So by asking that question, it's like our attention turns away from the canvas and back onto the viewer, the assumed participant or experiencer of the experiences, the assumed me or ego or sense of self that we just always throw into the mix. Whatever we see in life, whatever we experience, oh, there it is, the sense of me at the root of that experience. Because without that sense of me, you wouldn't feel like that experience belongs to you or that it affects you. So it's kind of the self-inquiry method as taught in some Advaita Vedanta, Ramana Maharshi. It's the question, what is I? Or who am I? But who am I is a bit more...
There's connotations.
Yeah, there's in English, I think it's sort of a mistranslation, personally, from Nanyar, which is self-inquiry. The English translation, who am I think is quite confusing to people. I think what is I
love that.
Is better, or what is me, or who is me. But who am I is too common tongue language, and it has these connotations to it. So I would recommend the question, what is me? And this draws the attention to the root, the experiencer, which believes it's the victim of its experience, always. And then we can dissolve that notion. And then we become freer and freer and freer from being affected by all emotions and thoughts and perspectives of a limiting nature. And then God realization becomes really stable and starts to really shine forth. And less do we assume this false identity that then suffers. But this is a more advanced process, and it requires sort of a keenness and a subtlety of mind being already developed. So they're kind of in order. Focus on something meaningless, bring all your concentration to that in as relaxed, as subtle a manner as possible, while you let the rest of your experience just kind of be and go and ignore it. And just start focusing in a different train of thought. Consistency, relentlessly, consistently. What's your better option? Just go and fucking do it. Give yourself that gift. I know it's boring, sober. Yes, it seems like you're ignoring your problems and you can't figure out this thing that you think is so important that's giving you so much pain. But that's the alternative. And you've been in it probably for days, probably for weeks, probably for months maybe. It's not paying off. The things you think you need to attend to clearly are not the things you need to attend to. You need to shift your focus, your attention. Grab a hold of your attention. Consistently focus on something meaningless. This reroutes the energy. Then when that opens up, you can recognize awareness. You can rest in the I amness. And then you can ask the question, what is the me that I even believe is the experiencer of these emotions? And then you can dissolve the me more and more. And the victim, therefore, this relentless victimization that we have, that we always insert into our experience with no good reason whatsoever. There's no proof for a little me. There's no evidence for it. There's bodies walking around, but that's not evidence of a me inside the body. So it's a core assumption that's causing all the suffering. It's the root misaligned belief. It's that I am a me that's somehow not God. That's somehow different from infinite reality.
Cool. So what was the last afflictive state that you experienced yourself? And which of these methods did you use? If any.
Yeah, I've used all of them, like alternatingly, whatever worked, whatever I had access to in that type of moment, I would use.
I'm asking about the most recent one though, but I'm also curious because earlier you said that like even a normal state of human walking around is an afflictive state for you.
Not a human walking around. It's the human beliefs. It's what we call normal. It's what people see as reality. So reality is quite stable. Our collective reality perspective is quite stable. Where this is what's normal, this is what's not normal. Just because someone says something to you doesn't mean you have to take it personally. Therefore, you can relativize and be back in human reality. Like, oh yeah, those were just a bunch of words. So there's no real reason for me to continue this emotional perspective. Oh, okay, so I'm back in human reality. the human context. But there's so many flawed premises at the foundation of human perspective, what's humanly accepted as normal, that to me, any of those beliefs would feel similar. If I really believed in them, I would feel similarly constricted as someone who believes they've been wronged or this or that.
Mm-hmm.
So it's just a matter of perspective and what you're anchored in, what state of frequency is your predominant state. And the higher you go in that frequency, the freer you become, the more free you become also from this human paradigm of thought and belief. As for the most recent afflictive state, I honestly wouldn't be able to tell, because an afflictive state, I've had similar echoes as afflictive states in my experience, but they can't quite be compared to when you really believe in them. The closest thing probably was during my sort of process with the negative media kind of attacking me and giving all these distorted images of my work and my intentions and my character, and then all the effects it's had on the people around me, the crew, friends around me, and audience and so forth. I think that was the most recent thing that would be somewhat comparable to having afflictive states. I have deep emotional waves occur from time to time, but they're no longer personal, and they always serve some kind of a teaching discourse, or they're always inspiring me towards a certain direction. So it's a type of guidance for what's going on in the collective. I might wake up some days and be overcome with this feeling, but it's not personal. Therefore, it's not really an afflictive state, even if the emotional energy can be very intense and high and backed up with like lots of energy. It's not quite the same as an afflictive state because I'm not locked into that perspective, which is the crucial difference, right?
Yeah.
I don't believe that something is happening to me. It makes all the difference. So while the emotions can be just as intense in terms of their energy appearance, in terms of the feeling of it, as someone in an afflictive state, it's still not an afflictive state because I'm not on a train. I'm experiencing the train fully. I'm experiencing all the nuances of that train, but it's like I'm just a ghost that hovers through the train. It's like a visitor I can view and I can gain some knowledge from it somehow or channel it into a teaching for people, but it's not me. Like at any point I can exit the train.
Like watching a movie of...
Like watching a movie, exactly.
Yeah.
So there's echoes like that, and there's some collective insights that happen through those kinds of experiences. But because this has gradually shifted to freedom more and more over the course of my life, that's why I can't really say when was my most recent afflictive state. Because even in that period that I just mentioned with the negative media and friendships breaking up and people believing all kinds of nasty things about me, even that was already backed up with a lot of perspective and freedom. So yes, that was the most intense recent memory that felt perhaps the closest to being personal or hitting some kind of a personal assumption of me. But even so, I can't say that it's the same as like when my lover left me when I was 18 years old or something like that. You know? It's a different type of, because there's no real stuckness. There is stickiness to it though. So that's why I would call that the most recent kind of afflictive state, but it was already very malleable. It would only sting in the way that an afflictive state would make you feel stuck for a short amount of time, and then the excess would immediately return. And so it doesn't mean I wouldn't still feel the perspective and emotion. It doesn't mean I wasn't processing it and understanding it and trying to get to the root of what's the most balanced approach to this, from love and wisdom being in unity. So there was a process involved. There was some stickiness involved. But again, it wasn't like I was completely stuck in the experience. So yeah, even though it felt more intense than my lover leaving me at a certain age, like when I was younger, even though these experiences were more intense, they were less afflictive or less constricting. They were less limiting. Does that make sense?
Yeah.
So there's a difference there. That's why freedom doesn't have to mean that we have no emotions. I mean, that's a very advanced state of consciousness where there are no emotions consistently. What's more important is that we can let our experience be as it is and relativize and continue to have access to a bigger perspective. That's a more relevant step for where we're at as a human species right now. To realize that freedom doesn't mean you don't experience a certain emotion or you don't experience a certain perspective. It means that you're not constricted by it. You can see beyond it while it's happening. So then you can experience more and more simultaneously peace and freedom and bliss and pain and suffering and confusion, which sounds very weird, but you can have a simultaneous experience where they both coexist within the same state of consciousness or space of consciousness.
What about disconnect? Can you like experience disconnect while not having disconnect apply to you?
That's a good way actually of making the distinction. The experience of disconnect hasn't happened for me for a long time, except maybe there were a few very short moments which served a particular purpose, mainly to, for a moment, give me a taste of what it's like again, to be in the shoes of some of the people that I'm sharing my message with. So it generates, because if you don't have that experience of disconnect for, let's say, 2 years in a row, your perspective changes so much. And your perspective of stuckness and victimization changes so much that it becomes kind of difficult to relate to someone who believes they're disconnected, stuck, or victimized. You can understand it, but sometimes, I guess, I've wanted for myself or needed sort of a reminder of, oh, this is what it feels like when you have no access. So my experience of that is that even that wasn't personal still. That was me from a higher level of my consciousness than my ordinary physical consciousness, giving me a taste, an experience of disconnect that is very much out of my own free will. That's how that was experienced.
Like within your own free will.
Within my own free will, I was fully aware that I experienced the disconnect, but at the same time, I was fully aware. So I experienced the disconnect as real in that moment, but still, I was fully aware of the fact that I was choosing it for a purpose. Because at some point, you just can't disconnect entirely anymore, right? And that's what I hope to give people access to through this kind of work, because it's worth it. It's worth the practice. It's worth the understanding. And it's people's birthright to understand this and to be free and to ever know their connection to source. And it will heal everything. It will heal everything in our thinking.
I think what you said earlier was important to remember, that we can never truly be disconnected, but only feel that we are disconnected.
Yep. And this might be too intellectual to really hit home if you're in an emotional state, but it can still be somewhat helpful if you realize in a moment where you feel so disconnected, if you remember that, first of all, you cannot ever be disconnected from consciousness, from God, from existing, from this infinite creation. And the proof for that in that moment is the fact that you're feeling disconnected. If you know the emotional guidance system and how it operates, because of your connection to the true reality of God, you can feel the emotional guidance system kicking in as the feeling of disconnect when you're believing that you're disconnected. The feeling of disconnect is just an emotion. It's just showing you the contrast of your belief in disconnect with the truth of connection. So the feeling of disconnect is evidence that you're still connected. So it's a bit intellectual perhaps, but I think it can provide people with some relief in those moments if you remember that. You can never truly be disconnected. It's impossible. And the proof for that is that you feel disconnected. That's the irony, but so you can use it in that way. Yeah. So when we then enter into a greater state of freedom, we again gain perspective. And as a result, the understanding and the acceptance of ourselves becomes easier. But you cannot accept something from the state of being that is creating that very experience of affliction. So you have to kind of step out of it Because again, what is understanding? It is having more than one access point or perspective. You can't understand object A if you're not also having object or space B to compare it with. Understanding is a process of comparison. It's a process of contrast. It's a process of context. It's a process of having multiple views. A thing can never understand itself. It needs an observer. Similarly, your thought process cannot understand itself. It needs a different perspective to view that object or that thought. But if you have become so identified, unified with that perspective that's causing the afflictive state, then you can't understand it. So don't even try. Let it be. Focus on your access point to a new perspective, which again can just be meaningless object that you're concentrating on. And then the acceptance of self will follow. The understanding of that will naturally follow over time as you gain access again to greater freedom. If you really gain access to freedom, then it's instantly understood, typically. It's very like, of course, because you just see from such a clear point of view. There's no substance, there's no matter, there's no gravity anymore to the perspective that was impossible to understand when you were in its gravitational field. And you had not a bigger gravitational field of your own to contrast it by, to understand it with. So know yourself, accept yourself, and become the creator. These are very much linked. The more you become the creator, the easier it is to know and understand and accept yourself on a relative level as well. And sometimes not having access to it, to understanding yourself, leads instantly into accepting yourself. And then that opens the door again to knowing the creator. And then when that afflictive emotion again arises, you'll understand it and you'll be able to accept it because you have a new space of consciousness to compare it to understand it by. That's kind of the journey of using, or how I would use anyway, these afflictive states, to resolve them, to understand them, to accept them, and to transcend them.
Yeah, it's helpful to recognize and to remember that it's an afflictive state. I think that the moments where I've been in these kind of experiences, I didn't recognize that it was just a state. It was like, this is the end of the world, the end of my world. This is an affliction that I'm never going to get out of. And it just becomes like, this black hole, and not the good kind.
I love the good kind of black hole. Just the right black hole. Oh, it's so great. It's true though.
I know.
There's a delicious black hole and there's a terrible black hole.
Exactly. So yeah, it's so helpful to recognize it's just a state, and that it is happening to you because you can handle it and you actually want to teach yourself through this. And to me, I did feel like, I don't know if I can handle this. I don't know if I can get through this. But now looking back, I can see that the fact I was even experiencing it to begin with was proof that I could handle it and get through this. On a higher level, it's like, my understanding is that it's a really terrible afflictive state is sort of the accumulation of a lot of misunderstandings and misperspectives. And then it's just, you're ready to make a quantum leap. So your higher self just says, okay, take it all at once. You got this.
Yeah.
So it's so helpful to recognize that you have got this if you're experiencing it and you've chosen it.
Nice.
That is so helpful.
Yeah. And you wouldn't have chosen it if you couldn't handle it.
Beautiful. Because the worst part about it is not even the emotions, it's the belief that you're all alone, that you can't handle it, that God doesn't love you, or that you're somehow unworthy or abandoned. That's the most painful part of these things, that you're a victim of it, that there's no way out of it, that there's no help, no guidance, no love, that's the most painful perspective. It's not even the initial emotional trigger, right? And actually, this reminds me of another method people can apply when it's sort of in between this scale of emotional affliction, between sort of the everyday emotional thing that you can kind of play with and understand and investigate, in between that and the emotion that is just so afflictive that you can't do anything with it. And that is to just sort of bring full presence to the emotional feeling and to feel it without labeling it. right? Now, if you're in a truly, deeply, extremely afflictive state, even that is not doable because you're too close to the perspective that you have, and it'll just conjure up more perspectives of a negative nature, and you'll be distracted by them. So the only thing you can do is radically allow it to be as it is, and therefore ignore it and grab a hold of your attention and place it somewhere else is all you can do. But if it's not quite that extreme, but it is quite painful, it is like a heartbreak kind of thing or something like that. But you have some space to interact with it without completely collapsing in it. Then I can recommend also the simple method of just feeling the feelings, bringing awareness. Awareness is always here. You don't bring it, but allowing the feeling to be experienced and witnessed by awareness, by your consciousness, that innate principle of I am and I know that I am. Allowing yourself to experience the feelings and just maintaining the witnessing state so that you don't go into thoughts about it. You don't define it. You don't label it. You don't try to intellectually understand the emotion. Intellectual insights might come as a result of just feeling the essence of the feeling without additions, without descriptions, just letting it be as it is. And a beautiful thing can happen. Typically, the more advanced we are in these spiritual practices of self-realization, it becomes easier, is that when we just become present to a feeling, we find the golden nugget within it, which is really the entire thing is the golden nugget. In other words, when we stop resisting it with descriptions and labels and definitions and just feel it, just have the courage to feel it just in its raw state, no intellectualizing, no definitions, no descriptions. Stay as empty of describing it as you can. Don't describe your experience. Just be it. Just feel it without getting lost in it. But you can only get lost in the description. So, or definition or belief. So, but to just purely feel it, be fully present to it, you start to over time transmute it. You start to discover something beautiful, which is that every emotion is made up of the same presence, the same love that is the creator in manifest form, in energetic form. So you're starting to access the essential energy manifestation of the infinite creator, that very sort of substratum essential first type of manifestation, that presence energy, that then is the primordial substance for everything else to be made out of. And if you can be with your feelings without labeling them, without getting lost in the sensuality of them, without describing them, without trying to change them, just allowing them to be exactly as they are. If you can find that courage, that stillness, that presence, and then just feel them as they are, they begin to take on a golden shape, a golden color, if you will. They start to sort of radiate something else. That's not the described emotion. It is, yes, the emotional feeling is there, but because the definitions are dropped and the acceptance arises, now we start to align ourselves with this primordial energy field, and therefore we start to see the love as the emotion. We start to see the emotion as being love, light energy, that primordial, essential presence energy of God. And then we're transmuting it, and there's a sense of unity and inseparability with it. And then there's no problem because we're not opposing it. We're not resisting it. We're not against it. We're not trying to change it or control it. We're accepting it, and therefore we're becoming one with the essence of it. And that just reveals itself to be this beautiful golden love light, if you will.
That's very cool.
That's beautiful.
It's kind of like the first method then, like being present to the wood or being present to the, it's like that same focus on.
Yep. Yes, exactly. But if it's a super afflictive state, that we only have access to negative emotions when we're present to our emotions, then you can't quite do that because you'll just get sucked into negative thoughts.
Yeah.
Right? But if it's somewhere in between, sort of a random everyday emotion and a deeply afflictive state, so if it's like a sort of a deep heartbreak, but you're not totally victimized by it, you can see kind of through it and with it, then you can beautifully apply this method, and it's very healing. And you will then, through that process, understand the emotion also. You will understand yourself through the acceptance of it, through the total allowance of it, and then the recognizing the essential energy that makes up the energy of the emotion by just feeling it, by being present to it. It is exactly the same method, actually, mechanically speaking, as focusing on the wood of the table. and the way light reflects off of it. Because what you're doing is you're taking your attention away from the definitions and you're shifting it to something else. In this case, the presence of the emotion rather than the thought about the emotion. But if you're present to the emotional feeling, it's still very close to your conditioned, boxed in perspective that generated the emotional response in the first place. So it's not, we don't always have access to this courage, this naked, present awareness that recognizes the essence of an emotion to be love and light. If it's too convincing, if it's too painful, so then the only thing we can typically do is sort of ignore it and focus on something else entirely that's not meaningful to us, that doesn't trigger the same thoughts or perspectives. So there's this wide range sort of fluidity to our consciousness, which emotions have a beautiful way of showing us how fluid and malleable our consciousness and our attention and our self-creating, self-conjuring up capacities really are. And we gain this freedom and this malleability through facing those emotions in different ways. But I did want to add that to sort of the in-between type of emotion.
That's great.
Beautiful.
Did you have a question?
Yeah. Would these methods also apply for someone that's experiencing afflicted states in a group setting, for instance, or like social encounters? Because I do feel a lot of people like experience like really intense anxiety or different emotions when they're like in a group setting.
Yeah, in my experience, from my own experience, when I was in a truly afflictive state, I would not be in social situations. You know what I mean? I mean, of course, it's possible, it can happen. But typically, I wouldn't be hanging out and sort of being anxious. I would define that as sort of the in-between, maybe. Either the general emotions or a little bit higher than that, a little bit more intense than that. But the truly extremely afflictive states are debilitating. You're not social. You just shut down. You're like, you don't know what to do, You're stuck. In most cases, of course it's possible, but in most cases, I would say in group settings, if you're even already in group settings, typically that type of anxiety is more of an everyday type of nature. And it just comes with the package of your low self-esteem and thinking that you are a person inside of a body, which is impossible. But we believe it. We insert all the time, that back burner sense of self that's on the back burner. It's just there. It's just in the background. I am experiencing this. I am being watched right now. You're not being watched. That's a total assumption. But because we have that sense of me always inserted into the canvas of life, we have to investigate that. But therefore we feel anxious in social circumstances. And then we can bring presence, the presence of awareness to it and not define it. Just allow ourselves to feel the discomfort of the anxiety and not react and flee into thoughts or trying to change it, control it, stop it, avoid it. Just find the courage to be naked with it. Feel the vulnerability of it until it turns ultimately into a feeling of indestructibility. That's the golden you that comes out of it. But initially, just take those small steps to more and more break the chain of describing your experience and trying to change it and avoid it, and just let it be. Develop the courage of naked consciousness, of naked acceptance, naked awareness. Be naked, be naked, be naked, be naked. Allow to be as it is. And then gradually over time, you'll become that interior alchemist, and it will change the color, the shape, the size, the nature, the feeling, the essence of the emotion will be revealed to you. You'll become a discoverer of God's love in all forms. So in social situations, I would suggest the anxiety is based in some ego construct, and therefore you can allow it. For the most part, you can practice that allowance, and you can transmute it. Does that relate to or resonate with your example?
I think so. I don't know. I just loved the energy of it, like discovery of God's love.
Cool. But does that answer your imagined scenario? Or you have a more specific kind of example or question about it?
It does answer mine, but I'm kind of I want to position myself as someone that's maybe not that experienced with like just releasing and being more naked
So, well, what do you do then? If you're already more experienced in it, then you could teach the same answer to your question. How have you become more able to be more courageous and more naked with your anxiety in social circumstances? What's that first access point that you would recommend to people?
Nice. Good question. It is to not wanting or not efforting to hide something, or believing that there's something wrong, or that I need to hide something, or that I need, or that I might be afraid something be revealed, exposed.
Yep.
So that's like just creates these pockets where stuckness or anxiety can creep in.
Great.
Which kind of is the same thing that you were saying, like just being naked more and more.
Yep. But I love your specific nuance of that being to drop the fear for the outcome in a way, to drop the fear of being discovered and exposed. Because what we call the ego, that imagined sense of me in the background of every canvas painting experience of our life, it always wants to hide its true falseness. It wants to hide the fact that it's not real. And it's got 10,000 different ways to do that, more probably. And these are all sort of layers of self-deceit, layers of self-control, layers of manipulation, layers of hiding, layers of avoiding, layers of recontextualizing things, layers of describing things in certain ways, layers of justifying things, layers of avoiding certain circumstances, certain people at certain times, all to avoid being seen by you, not by others, by you. But you think it's you trying to avoid. That's because you're hijacked, right? We're hijacked by the false self. It's a hijacker of our sense of self. It's like a little virus. It's like a little COVID-19 called me. And it's hijacked our consciousness, our sense of self. So now we're operating on behalf of COVID-19. So we're wearing masks because we don't want to be seen. We don't want to show our true selves. So we think, but actually not the case at all. And if you can see this, you can break through very quickly. But you got to be ready to be free of your false self, which you think is you. That's the tricky part. It's like you got to be willing to have your ego die in front of you. But if you think you're your ego, you will never want to die.
Wow.
It has hijacked you. It will consistently hide its self-deceiving layers. It will continue to lie and not know that it's lying, or partially know that it's lying, but have yet another layer ready to justify why or how the lie is not really a lie, or how everyone is lying in that way, so it's normal. So to burn through those layers of self-deceit, we need to know that we're not that hijacked version of ourselves. We're not the virus. We're not COVID-19. We're bigger than that. We are bigger than the one that feels anxious in that situation. So instead of us hiding from being exposed in the eyes of others, we need to realize that it's the ego not wanting to be seen by us. Does that make sense? And it's using us and other people to accomplish its aim. So we got to realize that the one who's afraid to be exposed is not us by others. It is the ego by us using others.
Fuck, I love that so much.
So if you can see that, you can take a shortcut. You can take a direct route and cut the bastard off at the root, using all the love in the world. Like, love it to death. Be radically slice it off. Nope. I'm not going to lie to myself. I'm not going to believe I am this person that feels anxious about being exposed, because that's not me. It's just this hijacked person that's been in the back of my taxi for all my life, taking on different shapes and sizes and forms and instructing me to go left and right. And I've just been doing its bidding. It hasn't paid me once. Maybe in childhood, when I needed to navigate a tricky emotion or situation where my dad was abusive and I had to protect myself, there's some reason to that, right? So then we create this monster in the back of the seat that keeps us safe. But that's, for most people, not necessary. Now it's just a self-perpetuating story, and then it creates circumstances that seem to mimic that reality being needed, because we're now identified with the voice in our head. But the voice in our head is observable, and anything observable cannot be us. Anything. So the thinker cannot be us. Therefore, the hijacker, the mind, the ego cannot be us. So it's not us afraid to be exposed in the eyes of others. It's our own guest, our little beautiful, loving, monstrous guest in the back seat that doesn't want us to kick it out of our cab. And so it uses us to navigate and lie and manipulate and pretend and all that stuff. Fun, huh?
Mm-hmm. That's so cool.
But the way to do that is to just gain more courage in naked exposure, because that's how we sever the connection between the hijacker and our true selves, between the analyzing, thinking, egoic mind and our true ever-present free self, which is already free of whatever we observe. But we identify with what we observe and we put it in the background of our subconscious, and it continues to operate as if it's its own entity. And we think it is us, and we think it defends us, and it's on behalf of us, but it's not. It's robbing us of all our energy, inspiration, clarity, self-knowledge, truthfulness, sincerity, earnestness, love, compassion, spiritual progress, advancement, and so forth. So it's really not our friend anymore. It's time to let go of that toxic friendship. So expose it to death. Here's my most shameful moment, guys. I've been using all of you in the following way. If you can, that's an extreme example, but you could, if you're ready to part ways with the monster in the backseat, doesn't mean you should hate it, because it has served you. You've invited it in. It's your choice. It's not, it's just offering its services. You've let it into your cap. So when I say monster, yes, it's a monster, but it's really our own allowance. It's us enabling it. So it deserves sort of gratitude. At the same time, it deserves our decision to sever all ties with it. I'm done with you. And at the same time, a feeling of, I love you. Thank you very much for your service, but it's no longer needed. So I'm not trying to imply that we should fight the ego, because that just is more of the same thing. We should love it to death, but radically and decisively, if we want quick progress and quick freedom and quick self-knowledge and quick enlightenment. We need to be ready to part ways, and therefore it doesn't matter what is exposed, because it's not us that's exposed. It's the ego, the monster in the back seat that we are now becoming aware of. And you can use other people as reflectors to accelerate that. But it takes some courage. What is courage? Courage is, in this context, knowing that you're more than the guy in the back seat, the monster in the back seat. That's all it is. Knowing that you are more than the monster in the back seat of your mind. Once you know that, you have faith, you have courage. Now to expose the monster, it's not so big of a deal, because you know you are more than the monster. You know that they can leave your cab and you'd be fine without them. You no longer need them to protect you. You can now consciously reason and see and decide for yourself what is safe, what's not safe, what is true, what's not true. As a 6-year-old, yeah, you need some protection. So you invite in this monster in the back of your cab. But at some point, you got to kick him out, lovingly. Thank you. Okay, this is your stop,
okay,
isn't
bye-bye.
it? Yep.
Yeah.
Okay, bye-bye. Okay, bye-bye.
Okay, bye-bye.
Okay, bye-bye. Thank you. Uh-oh. Bye-bye. Radically, lovingly say, no more. That's not who I am. Find that naked courage to rediscover who you really are and to ditch the hijacker. With love. With gratitude. But not with continuing to enable it. Not with complacency. Not with giving into it. Not with believing in what it says. Courage is the ability to not believe in your own thinking process. To know that you're more than your thoughts. And then exposure becomes less dangerous, because it's not you that gets exposed. It's the guy in the back of the seat. It's not me. Oh, I've never manipulated. I've never controlled. I've never been false. I've never wanted these false things. I've never wanted safety and security in distorted ways. I've always been pure and free. But I believed I was this voice that is observable. Therefore, how can I be it? So stop believing in it. The real way to believe in yourself is to stop believing in yourself. Stop believing in everything you think is you. That's true faith in yourself. True courage, naked being. Let what comes, let what goes go, and let it burn up into clarity of consciousness. Be free. Free yourself from yourself. It's the biggest freedom. Because you're not this. You're not what you're defending. So, something like that.
What about any homework?
Kick out the hitchhiker.
Yeah.
It's been a long ride. It's been a long road trip with a stranger in the back seat. And you've adopted its toxic thoughts and life philosophy. Imagine at the age of 5 or 6, picking up this hitchhiker out of good intentions. Like, oh, maybe he can help me and I can help him. And ever since you've been road tripping for like 20, 30, 40, 50, 60 years, you've been road tripping with this stranger in the back. But then he's no longer a stranger, is he? In fact, if it's just you and the hitchhiker for 60 years in the car, it's going to feel like you're married. It's going to feel like it's exactly who you are. There's going to be no distinction in your sense of self between your true sense of self and the false sense of self. So now you've become one with the toxic thoughts. You've accepted them all as if they are your free will. They've never been your free will, because it's never been your soul's priority to be safe, secure, protected, having acquired lots of things and success and status. That's never been your intention, ever. But you've adopted these things as a means to compensate for lack of courage. What's courage? The faith that you are free from anything that's observable, including your own thoughts. When you gain that faith, you'll gain the courage to act on that faith. And then exposing yourself doesn't make much of a difference anymore. In fact, it helps you remove the Band-Aid, this toxic Band-Aid that just keeps the wound festering. Take it off and you'll heal very quickly. But you got to be willing to not believe in yourself. That takes faith in yourself.
Beautiful.
Yeah, so that's the homework. I mean, do it as you please. But it's just a radical decision of self-honesty, realizing how you've been full of shit like 100,000 different ways every day. How you've manipulated everything, how you've tried to control everything, and just see that that's never really been you. That'd be the homework. And then you find a lot of your afflictive states will disappear as well, if not all of them. Because part of the voice in the back of your seat, in the back of your mind, that false sense of me, is continuously suggesting that you're lacking things, that you're not worthy, that you're not good enough, that you're not perfect yet, that you don't deserve love, that you can die, that you can lose somebody, that you can lack what you need. It's telling you all this stuff because it's the hitchhiker's own journey. It's not yours, but you've adopted it as truth because it's the only voice you've ever heard for for your adult life and longer. So find a way to lovingly sever that connection with the toxic guest in the back of your mind. See that you're ready to let it go. And the afflictive states will then also very quickly disappear. Because they're not part of who you are. They're false suggestions. Afflictive states are based in false suggestions, made by the me you think you are on the back of the seat. But you're not. You're the driver. You're free from any hitchhikers. Cool. Any additions? Are we good?
Wonderful.
Yeah.
Okay. Great. Thank you all.
Thank you.
And,
Thank you.
Have a fabulous day.
Thank you for tuning in to this episode of the Mirror Talks podcast with Bentinho Massaro. If you love these teachings and you want full access to almost all of Bentinho's recorded material, go to bentinhomassaro.tv. Right now, we're offering a free 7-day trial with unlimited access to everything on bentinhomassaro.tv, including curated playlists, guided meditations, and much more. This is our #1 recommendation for you. As a subscriber, you'll get first access to these podcast episodes 2 weeks before they go public. You'll also get access to exclusive Q&As with Bentinho and other content only available to subscribers of bentinhomassaro.tv. Also, Bentinho recently created a free online global enlightenment retreat. It's 8 long-form sessions that coherently guide you through the foundation of his enlightenment teachings. You can watch the free online global enlightenment retreat at bentinhomassaro.tv or on YouTube. If you're interested in the most current and complete overview of Bentinho's work to date, this is where we recommend you start. Another great resource is Trinfinity Academy, Bentinho's free online school for enlightenment, empowerment, and infinity. Each class is concise and clear and distills one key topic at a time, including homework. We strongly recommend you check out Trinfinity Academy if you want to master the mechanics of Bentinho's teachings. Finally, don't underestimate the value of sharing this episode with the people who came to mind as you were watching or listening. It's a service to them and the collective, and it's also the best thing you can do to support us in getting this message far and wide. We also encourage you to like, subscribe, and leave positive reviews and ratings on your preferred platforms, and follow Bentinho on social media.
And what we're going to talk about is money and kind of the really core fundamental basics that I think we don't talk enough about. So it's weird for me because talking about money and writing books about money now is my job, which is very, very weird to me because for most of my life, believe it or not, I was absolutely absurdly terrible with money. If you think that you're bad with money, I promise you I was worse. I grew up in one of those families where you could talk about literally anything around the dinner table. You could make jokes about like farting or sex jokes. You could have a robust, respectful conversation about religion or politics. Everything was allowed. But the one thing that we never, ever, ever spoke about was money. And so when I entered the adult world and I got my first job and very quickly got my first credit card, which just arrived in the post one day, I had this incredible financial strategy, which was just never think about it. I'm sure it'll be fine. I'm sure it'll all work its way out and whatever. And spoiler alert, it wasn't fine. By not understanding how money works, by not having these kind of really basic concepts that you understand, there's this ironic thing that happens where the less you understand about money, the more money ends up controlling your life. And that was certainly true for me. By having this very, like ostrich approach to finances, and it was so bad, by the way, that I was that person who, when I would go and draw money from the ATM, I would get the slip and I would scrumple it up and throw it away without ever looking at it, so that I didn't have to see how little money was in my bank account. And at its worst, I managed to get myself into more than 300,000 rands worth of debt by my mid-20s. I don't even know who gave or offered a 20-something-year-old 300,000 rands worth of money. My brain wasn't fully developed yet. I certainly could not be trusted with these infinite credit cards, and yet I was. And things got worse for me when and one day I had this realization, and I was must have been about 25, 26, and I had this realization that I hated my job. I was in a relationship that was making me really unhappy. And I felt like I couldn't leave either of those things because of my financial situation. And I'm really, really glad that that happened, because that was the wake-up call that I needed to put on my cowboy hat and confront this thing that I had seen as I thought was really terrifying, and I thought was uninteresting, and I thought this is just not something I ever want to think about. I realized I kind of had to. So I made learning about money my mission in life. I managed to sneakily get myself a job inside the finance industry, because I figured if you go into the belly of the beast, that's the best way to figure out how it actually works. So I ended up working in the finance industry, and I did everything I could to learn these basic lessons about money. And what I learned was kind of nuts. It was kind of wild. And so I became really passionate about sharing those really surprising things that I learned while I was there with other young people, specifically young people. Here's the first crazy thing that I learned. It's to do with this very large number at the top, 451 billion rand and some change. That is the amount of money that South Africans spent on gambling. And that is in 1 year alone. That is in sorry, I'm busy checking my notes. That is 2019. They spent 451 billion rand in that 1 year, and 32 billion, that is the amount of profit that the gambling industry declared in that same 1 year. Nuts, right? And this is only legal gambling as well. So this excludes online gaming, and it excludes all of those like dodgy things that your weird uncle is always trying to convince you to waste money on. And that was the first thing that I learned, really, was when I was walking around the world feeling like I missed something. There was a class at school one day about how money works, and I must have been sick that day. And I'm the only person who doesn't understand how money works and what I'm supposed to be doing. And I was feeling so ashamed of that and so scared of asking for help because I felt like I should just know all of this stuff. I realized that wasn't true. I realized that most people feel like they don't understand what they are supposed to be doing. And of course they don't, because we don't do a good job in South Africa or anywhere in the world really teaching young people the basic principles of money. We just don't. And then we just assume everyone will sort of just figure it out on their own. And unfortunately, people are not figuring it out on their own. Time Bank ran a study, I think it was 2-3 years ago now, where they interviewed South Africans across the income spectrum. And they found that 76%, so that's 3/4 of people, run out of money before the end of the month regularly. And in fact, more than half of people, 57%, run out of money by the 15th of the month. And if you think that that's just a problem of income, and certainly in our economy, that is often part of the problem, is people just are not earning enough money. But that's not the only part of the problem, because in fact, if you just go and ask individuals who earn more than 50,000 Rand a month, which is the top 1% of income earners in South Africa, nearly half of them are running out of money before the end of the month every month also. You can't really out-earn not knowing what you are supposed to be doing, not feeling like you are in control of your spending. And it was really helpful to have this realization when I made it my job to start talking to people about money, because it made me feel less alone. And the other thing that I learned, which was even more optimistic and even more hopeful, is that it's really not actually as complicated as I had been led to believe. This is the dark secret that most of the financial services industry doesn't really want us to understand. Because a lot of people, when they talk about how money works, they very quickly start talking about a bunch of complicated financial jargon, and they start talking about products, and they start saying, oh, you know, you should know what a TFSA is, and you should make sure that you've got a retirement annuity, and you've got to think about stocks and bonds and all these different things and crypto and they throw a lot of words at you. But the good news is that the fundamental principles, the things that really matter most, are really not that complicated at all. And that's a really good thing. One of the biggest kind of mind flips, I think, happens when you start thinking about your money in a sort of fundamentally different way. Most of us, when we think about being good with our money, being in control of our money, what we're thinking about is just getting through from paycheck to paycheck. We think about, I have this amount of money left and I'm going to get paid again on the 25th, and I need to get from here to there. And if I can just do that, and it's sort of like a trapeze, right? Or George of the Jungle swinging from vine to vine. If I can just do that and never miss a vine, that's okay, I'm coping. And many people aren't even able to do that. They're not even able to get through the month, right? But really what gets really powerful and can help you change how you feel about your finances in quite a different way is to take a step back from that month-to-month picture and to sort of just visualize all of the money that you're ever going to earn over your whole lifetime as a whole. So I want you to do that now. I want you to imagine this huge big pile of money. You can imagine it with like actual physical cash, and you could imagine you could dive into it like this oak, like Scrooge McDuck, and you could swim through it, and just imagine that big pile of money. And that is all the money that you are going to earn between now and the rest of your life, right? Now, the good news is that pile of money is probably bigger than you think it is. So what I want you to do is I want you to find at the top of this graph the number that is the closest to your average monthly income. And on the left of the graph, I want you to find the number that is closest to the age that you are right now. And see where those two numbers meet, find that number. So that number is the amount of money that you will still earn over the rest of your life. It assumes a 6% increase every year for inflation, or you could remove that and do some different maths, and it assumes that you work until the age of 65, right? So that's a big number. It's a bigger number than most people realize often. So that's the good news, because every rand that you will ever earn is really a piece of possibility, because you could do anything with it. Money is what we call fungible, which means you can turn the same rand into anything. You could turn it into a holiday, you could turn it into school fees, you could turn it into whatever you want. So you have a lot of choices. That's the good news. But the bad news is you don't really have a lot of time to make those choices in. So I'm not going to do a lot of math in the next hour, I promise. This is the last bit of math that we have to look at. Imagine that you work for 40 years. So you work from age 25 to age 65, and you get 12 paychecks every year, and you never take a break. You never stop working. You work for that full 40 years. That means that you only have 480 paychecks over your whole lifetime. And really, those are your moments to decide where all of that money is going to go. Because let's be honest, once the month goes on and money's in your bank account, it just tends to vanish, right? That happens to all of us, which really means that you have 480 choices, 480 times to decide what you're going to turn all of that money that's going to flow through your life into, what it's going to fund in your life, right? And the truth is that even though that pile of money might be big, it might be bigger than many of us think about when we're stuck in our month-to-month cycle, it's not infinite. None of us are going to earn money forever. If we're lucky, many of us, the reason that we will stop earning money is because we will get old and we will not be able to earn money anymore, and we'll also hopefully deserve some good, calm downtime. And the biggest flip that really helps people to start to feel more in control of their finances, in my experience, is thinking about how they can make sure that they can still pay for the things that they need, even in times when that next paycheck is not there. And that means thinking about that pile holistically. So really the goal is to think about how you can earn money during the times when you yourself are not earning money. And that's what assets are. Jobs are things where you go out and you use your labor and you go and create an income. Assets are things that you can buy that put your money to work so your money can make money for you, right? And that, my friends, is the single core, most important lesson about feeling in control of your money. Buy assets, build a portfolio of assets. That's it. That is the single most important thing to know. Everything after this is how do we buy assets, right? I have a little story that I like to tell myself to really help me imagine what this looks like in my own life. And with the story, I like to imagine that I have all these little pets in my house, and I call them snorgels, and they're cute as heck. This is what they look like. And snorgels need to eat apples to survive. Every one snorgel needs one apple every day. Otherwise, your snorgel will starve slowly, and no one wants that because they're cute, right? So every day I have to go out to the fields and I have to go pick apples and I have to bring them back home so that I can feed my snorgels, right? And that's good and well, but there are times when I can't go do that. And there are times when I don't want to be doing that. So my goal is to rather start growing my own orchard of apple trees that I can laze around, I can play Xbox, I can teach my snorgels to hula hoop, and I don't have to go and pick apples every single day. Or it's not a disaster if there are days when I cannot pick apples. I think in the last year, all of us have confronted the fact that there are times when those paychecks dry up, and that's not in our control. That's not about us having done something bad or wrong. That can happen to everyone. So the goal is lots and lots of apple trees, right? Simple. How do you do that? 3 things. You save, you get out of debt, and then you start investing. You grow that money. Done. That's it. That's everything you need to do. But obviously, it's easier said than done. And the first part of the first step, really, which is saving, is interesting to me because it is the easiest one to understand and it's the hardest one to do. Saving is a lot like running a marathon, right? It's not complicated. In order to know what you need to do to run a marathon, you don't need to go and get a degree in biokinetics. You don't need to be a doctor. You don't need to understand what proteins muscles are made of. All you have to do is you have to put running shoes on your feet and you have to actually go running every day until you get fit. And saving is kind of the same thing. It's the easiest thing to understand, but it's so hard to do. So what do I mean by saving? Saving just means creating a surplus, which is making sure that you have apples left over, that you have more apples coming in than your snorgels are eating, right? So back to the snorgels are eating apples. You either earn extra apples, maybe you have a side hustle, maybe you get a long overdue raise at your job, or you put your snorgels on a diet and then you have a surplus. What you can do with that surplus is you can keep them aside so that you've got a bit of a spare cash if there's a day when you need some apples. And then once that pile is big enough that you've got emergency apples, you can then also start planting some of those apples, which is the investing side of things. Saving has to come first, right? But the reason that saving is so hard, right, is everyone hears, okay, I need to start saving money, fine. And then the first thing that we all think about is, okay, I'm going to go and create this big, long, complicated spreadsheet called a budget. And then I'm going to follow that budget. And that budget is going to tell me that I am never allowed to eat sushi or buy coffee or do any of the things that are fun. And I just have to follow the spreadsheet. And then, great, excellent, I'll have saved money. Problem solved, magic. And of course, all of us who've tried creating a budget and just following it know that unfortunately they're very seldom effective. And the reason that they are very seldom effective is that we like to imagine that our brains are these perfect computers and you feed our brains instructions and then your brain just does what you tell it to do. And that's kind of what a budget is. It's like a set of instructions for your brain. And then cool, you just follow those instructions. But the truth is that your brain is not a computer. You have the brain of a primate, right? You are a primate with pants on. That is all you are. And your brain doesn't work like that. And we set ourselves up to fail when we treat our brain like a computer instead of treating it like a brain, which is this fallible thing. And you've got to work with how your brain really works, not pretend it's something that it isn't. So instead of just trying to save by writing down how you want to be spending your money in an ideal imaginary world, which is often all budgets are, try something that does actually work. So 3 of the tactics that are best supported by the data. So research shows that these things tend to be more effective than just trying to change your behavior. The first one is just to make saving automatic, something that you don't think about. And this is that old idea called pay yourself first, which when I was in my 20s, I told myself meant that on payday, I could take myself shopping. That's what it meant, to pay yourself first. Sadly, that is not what it means. What pay yourself first means is on the day you get paid, have an automatic transaction that goes off your bank account so that that money goes off away into a savings account or an investment or paying off debt. So you never see it to begin with. It's gone before you get attached to it. It's just away. The other thing to do is, rather than focusing on all of those small, tiny things that often give you a lot of pleasure, normally when we feel like our spending is out of control, we start off by thinking about the small things we do often, right? Because we do it often, so it feels like those are the things that matter. But really, if you look at where your money really does go, you'll find that for most people, there are three things that consume most of your spending, and that is where you live, how you get around, and what food you eat. Those three things. For other people, school fees can be number 4, or even sometimes number 3. But for most of us, it's those 3 categories. And if you just make one big change in one of those 3 categories, it is so much easier to free up a big chunk of money every month. And it doesn't mean that you have to constantly feel bad every time you spend a little bit of money on something that makes you happy. So it can be much more effective to focus on the regular recurring bills in your life rather than the kind of fun money. But ironically, we always start with the fun money. And then the third thing that you can do is, there's this funny thing our brains do called mental accounting, which is we think about different kinds of money as being different, right? So we think about money that we get from bonuses or from a side hustle as being free money, and that's money that we generally spend on nice things like holidays, right? But really, what can be very helpful for a lot of people if you're struggling to find extra money to save is to just have a rule with yourself that you actually save 100% of any of that magical money. Because think about it, that is money that you were planning to do without already. So it can be very easy to just funnel that 100% into your savings. Or just in general, to have rules for yourself that maybe it's not 100%, because buying things is also nice. Maybe it's 90%. But whatever it is, having these rules that certain types of money is just for saving. And those are 3 things that can be easier for people. But a great way to start is to just start seeing where your money actually goes today. I used to work for a local app called 227. It's now a part of Old Mutual. And what it does is, it's a totally free app. You can connect up all of your bank accounts. You can connect your investments, your credit cards, your store cards, even if you've got like a Edgar's account or whatever, you can put it in, Pick and Pay, cards, everything. And it can give you a full picture of where your money is actually going. So it'll categorize your transactions for you. So for example, if you spend money at KFC, it'll say, cool, that's eating out. If you spend money buying the last pie at the garage at 10 p.m., it'll say, cool, that's bad life choices. That's the diarrhea category. So it gives you a picture for the first time of where your money actually goes. And we used to do a lot of research with people where we'd play these guessing games with them. So we would ask them to write down where they think their spending goes. So we would say, what do you think you spend on eating out every month? What do you think you spend on petrol? And then we would get the real answer. And people were often very surprised by the differences, and often in good ways. Like, I think many people are surprised to learn how much of their money is going into these bills or these subscriptions that you've forgotten about often, that aren't really bringing you joy. And how much money is going into stuff like insurance, which is important, but a lot of people have too much insurance in South Africa, or it's been a while since we've gone and actually shopped around for cheaper insurance because it's a hassle. But when you see how much easier it is to control your spending with the boring monthly things than all the fun things for most people, it can be a great first thing to start. So if there's just one thing that you do after this evening, install an app that helps give you a picture of your true spending. It'll be insightful. Don't be like me, who was like an ostrich and just didn't want to know. So saving is the most emotional part of the process, because it's the part that's about controlling your behavior. So the good news is once you have confronted that step and you've dealt with all of those difficult feelings, figuring out what to do with the surplus you've created, with all the money that you've freed up, that's actually pretty easy. It's not the complicated part. And it can be quite like step by step. And for many people, the next step after you have built up some savings and you have freed up a surplus every month, so you're saving consistently every month, is to start thinking about getting out of debt. So we have this idea when we talk about debt often that people get into debt because of frivolous things, because they weren't in control of themselves and, you know, they were just being silly. And that is certainly sometimes true. It was definitely true for me. But the most common reason that people get into debt, particularly in South Africa, is because they have unexpected emergencies that come up and they don't have a savings cushion, or they lose their job temporarily and don't have a savings cushion. And we talk about debt in this really morally loaded way. And it's part of what makes people feel so ashamed when they are struggling with debt. And that shame doesn't really help anyone, because it just means that people like me who really needed help don't ask for help. So if you are struggling with a lot of debt, this is my permission to you to stop feeling bad about it and to just deal with it. Just make a plan, right? It's okay. Debt is not a moral failing. It's a consequence of our economic system. So what debt is and specifically how consumer debt works. I'm not talking about like house debt to buy a house. So go back to our lovely snorgels. What happens when something happens and you can't go and pick apples for that day and you don't have any emergency apples in your savings pile? You have no choice but to go and borrow apples from your very creepy neighbor. I call her Myrta, and she's very mean. And she'll give you apples, that's fine. And then there's an IOU, right? So like if you borrow money from a friend, you can have some apples now, but you have to give them back to me later. That's not the problematic part. That kind of debt, which is more like how we often loan money to friends and family, that doesn't cause debt spirals. What causes debt spirals is usually if Myrta, the person I'm borrowing apples from, is a bank or it's a store card or it's a credit card or a personal loan or a mashonisa or anything like that. It comes along with this creature called interest. So Myrta says, I'll loan you these apples, but you now have to adopt my pet too. And my pet is the interest monster. It's a bit gross, it's fine. The problem is that the interest monster also needs to eat apples and it grows. And the longer that you keep it, the bigger it gets. And the bigger it gets, you still only have the same amount of apples every day. And eventually the interest monster is eating all of your apples and there's nothing left for your own snorgels. And that is a debt spiral when that interest monster is growing faster than you are able to keep up with its growth by picking more apples. And in South Africa, what that often looks like is people who end up spending 60 to 70% of every paycheck just paying their interest. So that's a real stat from Debtbusters, which is one of the biggest debt counseling services in South Africa. So by the time a customer comes to them and asks for debt rescue, on average, it's 64% of their income, their paycheck is going just towards paying their debt, keeping up with their debt, which means they're now living off 36% of every paycheck, which is really, really hard. And that's why debt spirals are so dangerous for people, specifically when we're talking about high interest debt. The other thing about carrying debt is if the goal, we keep our eyes on the prize, which is the goal is to grow lots of beautiful apple trees, to have lots of assets so that you can, feed your snorgels even in times when you can't go pick apples. Carrying debt erodes that whole plan. And that's because of something quite simple, which is that if you go to the bank and you ask for a credit card, the interest rate that they will make you pay on it is about 18% usually. And if you go to the same bank and you say, here's my money, would you pay me interest on this if I keep it in a savings account? with you, they will typically give you what, like 4%? And the difference between 18% and 4% is the reason that bankers drive nicer cars than you do. That gap is why bankers make so much money. And the thing is, if you are sitting on debt, almost always the best investment you can make is paying off your debt first. And again, this only applies when I'm talking about high interest debt. So that's stuff like credit cards and store cards, right? But there is no investment on earth that can guarantee growth of 18% every year. And that's the growth that you get by paying off your debt. So the really thrilling thing about paying off your debt is, you know, if you've had debt, you're used to living on a small chunk of your paycheck. So you are used to creating a surplus, and once you've paid it off, you can really start to grow your money in the future, and you can free yourself from paying for stuff you bought in the past, and you can start focusing on growth. But you can't start focusing on growth if you are carrying debt, because it makes no sense to be investing in something that might be giving you 12 or 13% growth as an investment if it's losing value on your debt faster. See what I'm saying? So get out of debt. You don't need it. Your life is better without it, I promise. Once you've done that, you can start doing the really fun part, which before I knew anything about how money works, I assumed was the difficult and boring and scary part, and now I know is the fun and also incredibly simple part and very satisfying. So you want to get to this step as quickly as you can, and that is starting to invest. I used to think that investing was something that just wasn't relevant to people like me. Investing was something that you had to worry about if you were like, I don't know, some swanky oak living in Sandton, or I don't know, you had a yacht and you would read the business news on your yacht and you'd listen to Bruce Whitfield every day. I love Bruce, he's great, but like, you know, no one wants to be listening to business news every day. Some people like Simon, I think, find it interesting. Many of us do not. So for a long time, I was just like, well, investing just doesn't apply to me. It's only for people who really know a lot about business and are interested in business. But the truth is, all of us have to figure out how investing works. And the reason is that keeping your money just in a regular savings account, ironically, is the most reliable way to make it lose value. And the reason is not because of, you know, like little kleptomaniac tokoloshes who are like living under your bed, eating all the savings you've got stashed under your mattress. The reason is because of inflation. And all inflation means is that your money is worth less every single year. So the 10 Rand that today can buy you a can of Coke, in 20 years' time will only be able to buy you half of that same can of Coke, probably even less, right? That's what inflation is. So we have to invest to just preserve the value of our savings over time. It's something that all of us have to wrap our heads around. And the other thing about investing that makes it relevant to all of us is that most of us who are alive today will, if we're lucky, statistically, live a very long time. And it's very difficult to keep working in a job after the age of 65. It's not fair, but that is the world that we live in. Most people who lose their jobs between the ages of 60 and 65 find that they cannot find another job even when they want to, right? So the reality for many of us is that we are likely, on average, to live for often almost as many decades after we're retired as we worked before our retirement. Now, imagine that. So imagine you live for 30 years after you retired, from 65 to 95, which is very feasible for many people alive today, statistically. That is almost as long as many people's working careers. So imagine that every paycheck you get, you have to fund 1 month of your life now and 1 month of your life after you retire. Imagine you had to always live with half of every paycheck. It would be really difficult. Now, the good news is if you can invest smartly, you don't have to do that. You can get some of that extra money that you need by investing in that extra growth, right? So that you don't have to, like, I don't know, live on salty cracks and 2-minute noodles now. That's the goal. So investing just means buying assets. And assets is like this complicated term, but all of us instinctively really understand what assets are, I think. So let's talk about a cow. A cow is an asset, and it's a very popular type of asset in a lot of South Africa. And I think we all understand how a cow can increase in value. You can buy it as a small baby cute cow with cute little eyes, and you can feed it, and then when it's big, you can murder it, and then you can eat it. Or you can make it produce milk, and you can sell its milk, right? So we understand a cow is a really good asset. A cow produces value. I don't have a cow, I have a cat. I have tried selling his meat. No one is interested in buying it. The cats are terrible, terrible assets. But the problem with cows, obviously, is they are, I don't know if you've seen a cow, but they're very big, and I don't have room for them in my house. They also poop a lot, and then you end up with cow dung on everything, and it's stinky. No one's really got time to own cows. And that is why the type of asset that I am most unironically enthusiastic about is the stock market. And to be perfectly honest, I didn't actually know what the stock market was until my mid-20s. So if you don't know, don't worry about it. I will tell you what it is. So I want you to imagine that you go to the Pick n Pay, or you go to this shop, right? So you can picture a shop with shelves, except I want you to imagine that in this shop, you can buy literally every type of product that the world makes. You can buy cannabis oil, you can buy cat food, shoes, you can buy like gallon drums full of petrol, anything that the world makes, you can buy it in the shop. Now, all the stock market is the stock market is that shop, except instead of buying the products, you can buy very, very tiny pieces of the companies that make those products. So instead of buying a laptop made by Apple, you can buy a very, very tiny piece of Apple, the company. And that is what the stock market is. It is a virtual market. It used to be a real place in specific cities. Now it's all on the internet. So it's more like Superbalist than like Pick n Pay. Does Superbalist still exist? Side note. But the great thing is that as a person sitting in South Africa, it is very, very easy as shopping online and buying jeans, to buy tiny, tiny pieces of the biggest companies in the world. So all of the brands that you already know and you already love, you can sit on the loo with your phone and you can buy tiny, tiny pieces of those companies. And you can often do so now with very, very small amounts of money. So it's really cool. There are two ways that your money can grow by buying shares. The first one is what we call dividends. So if you think back to the cow, if your cow produces milk and you go and sell that milk, that's equivalent in the stock market to a dividend. It's just a boring name for it's the profit, right? So when Apple sells lots of computers, they make a profit. They can either reinvest that profit back in their business, or they can pay it back to its shareholders. And if you own 1/100,000th of Apple, you will get 1/100,000th of the profits that Apple distributes, and those are called dividends. And they're awesome, right? Similar to the milk, because you still own the underlying thing. You haven't killed your cow. But if you do want to rather go and kill your cow, or rather just sell your cow to someone else, you don't own it anymore, you sell it, and hopefully you sell it for more money than you bought it for. That in the world of investing is usually called a capital gain. They're fancy words, but if you come back to just remembering what the underlying thing is and what you are doing with those businesses, I think it's actually pretty easy to understand. Now, here's the problem with buying and selling shares on the stock market. Some people find it really, really fun. They like trading. They like reading the business news. They like looking at the price graphs and figuring out, is it going to be smarter for me to buy Burger King or McDonald's? Who's going to do better? But if you're like me and you just don't know much about businesses, and you don't want to know much about businesses because you like doing other things, the good news is that you don't have to. In fact, for many people, the best way to start investing on the stock market is so absurdly easy that it almost feels like it shouldn't be allowed, but it is. And that's called buying a product called an ETF. Again, finance people give things terrible names, but it's really, really easy. What an ETF is imagine you go to this stock market shop and you take every single company that's on the shelves, all of them, just like Reggie's Rush your way through the stock market, and you just stick it all in a trolley. And you go home and you put all of those little pieces of companies into a big blender and you blend it up, and then you make a smoothie. And that smoothie contains tiny, tiny, tiny pieces of Coca-Cola, of oil companies, of everything, right? That smoothie is now an ETF. It's a blend of pretty much everything that you can buy usually. So you can get ETFs that are truly global. So they go to all the world stock markets, all the big ones, and they put everything into one smoothie. Or you get ones that are local. So you can get something that just is the South African business smoothie, and that's an ETF. And the cool thing about an ETF is it is really diversified, which is a fancy way of saying you haven't put all of your eggs in one basket. You can have a whole global pandemic even, and not every business is going to fail. Some businesses, like tech businesses, have done really, really well. So the great thing about spreading your money across thousands of businesses means that it's much less likely for something to go horribly, horribly wrong. So this is why they're a great investment for most people. There are lots and lots of different ETFs. Some of my favorites locally are, there's a Satrix Top 40. You've probably heard of that one. What that means is it is just the 40 biggest companies on South Africa's stock market in a business smoothie. That's all it is. Or you can get something like the MSCI World, which is the global version of that. It's like all of the companies. And there are ETFs in every country that you want to invest in. But for many people, the easiest thing to do is to just buy a South African one that is a smoothie of companies all around the world. Because by doing that, you are making sure that all of your risk is not attached just to South Africa. You're like, something has to go wrong in Taiwan and South Africa and England and America and everywhere else at the same time for you to lose your money, and that's unlikely. And the good news is that for most people, this really lazy way of investing actually works out better than trying to do that intense trading. Trading can be really fun and it can make you a lot of money if you know what you are doing. And if you don't want to invest all of that time, great way to start, just start buying ETFs, business smoothies. And you can literally do that with as little as 20 Rand. And you can start today, and you should. Now, on average, the South African stock market has grown at about 7.2% every year. And what's cool about this number is that we have over 100 years worth of data about this. So investing in the stock market can be a bit scary because in the short term, the price is really, really wobbly. Today, something will be worth 100 Rand and tomorrow it'll be worth 200 Rand. And then the next day it'll be worth 50 Rand, and it just jumps around all over the place. But if you zoom out, the money tends to kind of go back to the normal growth rate, right? So investing in ETFs is not for money that you need tomorrow. It's not for money that you need 3 months from now. It's best suited for money where you can wait at least 5 years, because then those short-term wobbles don't matter. Over the long term, there's no other type of investment that has performed as well as equities that we have this much data for. So it's a really good place for most people to start off with. And at about 7.2%, what that means really is that your money doubles about every decade, right? Which can be powerful. Sorry, I forgot to say this, which is just that the stock market has performed much better than many other types of assets in South Africa, and especially residential property, buying houses on average for most people. But that is a whole side thing. Let's not get into that. Okay, so investing in the stock market is cool. Your money can double about every 10 years. Why is this great? This is great because of a little thing called compound interest. Compound interest is also probably something that you've heard of before, but it can be really hard to understand exactly how powerful it is until you see it in action. So to see it in action, I'm going to stop talking about money for a second because that's boring. Instead, I want to talk to you about vampires, which is my true passion, honestly. So have you ever noticed that in vampire TV shows and movies and books, vampires always live in mansions and they always wear fancy waistcoats and they're drinking good wine? In other words, vampires are always loaded, right? They are rich. And have you ever stopped to wonder why that is? And the answer is compound interest. And what this means is when you invest money, it doesn't grow just in a straight line. What happens is that it grows in a curved line, a lot like COVID does, is kind of like a terrible analogy. So if you have 100 Rand and you invest it and it doubles after 10 years, which is on average what it does in the stock market, then imagine you have two little pockets of that same 100 Rand, right? If it doubles again, both of those 100 Rand notes that you now have double. So, and then imagine it keeps doing that. Now that's exponential growth. It's not as easy as just the original thing doubles every 2 years. And to see why that's so powerful, I want you to imagine that 200 years ago, Edward Cullen, Dream Bay, went to Capitec Bank, and all he had with him was he had one 200 Rand note. And he put it in a Capitec savings account earning 6% interest, which is more than Capitec will give you these days, but a couple of years ago, they were giving you 6%. And then he forgets about it for 200 years. Now, Capitec didn't exist 200 years ago, neither did South African Rands, but just go with it, right? If you invest 200 Rand and it grows at just 6% interest, but you leave it for 200 years, what that turns into today is 1 billion Rand. Just think about that, 1 billion Rand. That's crazy. And that is because of the power of compounding. And the thing about compounding is, and all money that you invest pretty much grows in this compounded way. And what it means is, what matters more than any other variable is how long you leave it alone for. That matters more than how much you start with. It even matters more than how fast it grows. The variable that is the most powerful is time. And you might be thinking, well, I'm not an immortal blood-sucking demon. This doesn't apply to me. But the thing is, it does, because there is a reason that you will want to invest for a very long period of time. And it's the one that we spoke about right at the beginning. One day, hopefully, you will retire. And compounding is a superpower when it comes to saving for your retirement. And you might have seen this graph before, and forgive me if you have, because I think it is one of the most important things that I saw when I was learning about money. And it's this graph that compares two different people. Person A, let's call her Bella for lols. I want you to imagine that Bella starts saving for retirement when she is 25, and she saves 1,000 Rand every month. And she does that for 5 years until she's 30. So age 25 to age 30, 1,000 Rand a month. And then she stops. She never saves another cent for her retirement. So in total, I think she saved 60,000 Rand over that 5 years, never saves another cent. Now compare Bella to Edward, who does exactly the same thing, also saves 1,000 Rand a month for 5 years, and he just starts 5 years later. So he starts at age 30 and he saves until age 35, saves the same amount of money. Now, Bella's savings by the time she's 65 are going to have grown to almost 1 million Rand because of compound interest. Awesome. And now it seems like Edward, it shouldn't matter that much that he just started 5 years later, but it does. It turns out that it's a difference of nearly 300,000 Rand, which is almost a third of the final amount that you end up with. And it's much, much more than the total amount of money that he saved. And this fact, this truth about compound interest, is why I'm so glad that you decided to spend this time here right now, this evening. When I was young, the biggest mistake that I made about money was I told myself that this could be future me's problem. because I told myself, you know what, I'm young, I'm having fun, I'm not earning a lot of money right now. Let me wait until I'm 30 or 35 and I'm a proper adult and I've got more money, and then it'll be easier. Then I will start saving. Then I will start growing my orchard of apple trees. But that is not how money works. You only have 480 choices, moments to choose what is going to happen with all the money that is going to flow through your life. And because of compound interest, it is those early paychecks that matter the most, which means that every month that you delay starting this process, it's not just the extra 100 Rand or 1,000 Rand that you might have saved in this month that you're losing out on. It's all of the money that that little amount of money would have doubled up and doubled up and doubled up into by the time you retire that you're wasting. So it is so important to start. And starting is not as hard as you think. Well, it's hard, but it's not complicated. You already know everything that you need to know to get started. The most important first step is just to start saving. Figure out how to create a surplus so that you have more money coming in every month than you have going out. Once you do that, everything else is simpler. You already know what you need to do. You just now need to go and do it. And it is worth doing, and it is not that scary. And I am rooting for you to do it. And if you want more extra goodies and bonuses, go check out my website, which is sandbeckbessinger.com. And there are a bunch of things on there, like a detailed guide for getting out of debt, if that's what you need, recommendations for apps to go and install. I hope that this last hour has given you an idea for one action you could take. It's more important to just start doing it than to stay stuck wondering and worrying. And that's it from me.
Yeah, so and I'm never going to get that vampire out of my mind. Why are vampires rich? Of course, they always are. They wear the most swag. I mean, it's insane. A couple of points.
They do.
They do. They proper in that sense. Sean's commenting costs compound similar. Sean, 100%. Hence, Sam mentions ETFs. You know, you're coming in with costs there. At Satrix 40 is 0.1%. And I've told the story often about my first unit trust, which I think was 5% plus performance fees. So costs are hugely important, and hence ETFs. I mean, I think the expensive ETFs in our market are about 0.8. So they absolutely are quite cheap. Sam, a great question coming from...
It's such a no-brainer.
Yeah, from Luzani Gugu. And the comment is that they're actually... what they return is slightly better than the cost of their debt, which is unusual. It's usually the other way around. But they're commenting that they still want to pay off the debt because it stresses them. And my response to that is, you know what, sleep well at night. Pay the debt. I don't like debt either. We were chatting off air before we went on. You know, if you have a phobia around debt, and it's not a bad phobia to have, and if it causes you stress, the spreadsheet might say one thing, but do what makes you comfortable.
I couldn't agree enough. And people ask me this question all the time, and it often comes up with people who owe money. Where it comes up the most intensely is where people owe money to friends and family, and often those agreements are interest-free. So if you run that through the spreadsheet, exactly, the spreadsheet says, you know what, like rather invest and wait on this debt. But for me, I think the biggest change in how I think about my money now is understanding that my money is finite and limited, and so is my lifetime, right? So it's really important to not waste money. I don't hate spending money. I love spending money, but I hate wasting money. And for me, you're wasting money when you are funneling it into things that doesn't add to your happiness. And paying off debt might be one of those things for you that adds enormously to your happiness because it adds to your peace. And that's worth doing. Like, it's impossible to give general advice about what you should spend your money on because everyone values different things. But what I encourage everyone to do is make sure that you are being thoughtful about what you are spending your money on, and you are actually putting your money into what you value. And if what you value is relationships, sleeping well at night, totally pay off your debt.
No, I agree 100%. It's about being comfortable. Martin makes a great point, and Martin's point is, how do we get everyone to hear the message? And Martin, there's good news and there's bad news. The bad news is that, let's be clear, corporates, governments the world over are not spreading this message. In fact, governments are pretty much doing the opposite of everything that Sam says, in that they're spending our future money and they're not saving, and they are the worst to follow. That means the responsibility falls on us. And I talk about, I do presentations to the JC Schools Challenge, and I talk about the responsibility of knowledge. When we know something, we need to go and talk about it and tell peeps about it. There is one trick, however, with, I suppose, any knowledge, but mine is about money. You can't talk to someone about it who doesn't want to listen. It's as simple as that. You the cliche, you can lead the horse to the water, but if that horse don't want to drink, there's nothing you can do. You can kind of plant seeds and then wait for people to come back to you and engage them. Sam's got 2 great books, one for adults, one for kids. There's content out there, but kind of let it be known that when people have questions, you're the go-to guy for those questions.
Do you know, it was so amazing for me becoming someone. So, I grew up in a family that just never spoke about money because, and bless my parents for this, their intentions were good. It's because they found money really scary. So they wanted to protect us from ever having to worry about it. But, it had this terrible consequence of, therefore, we just, were clueless. And what I do now is I make up for this by, I talk about money all the time. I have no scam. I tell people everything about my money. And what's incredibly powerful is that once I started doing that, other people started telling me about their money problems. So I found that that's really powerful as well, is just start being really open and honest with the people in your life about the things that are worrying you, but also the trade-offs that you are making. Like, oh, I'm choosing to downgrade my flat because I am doing this with it instead. And, talk about those things. And that is an invitation you'll find to other people to start opening up to you. And few people feel like they can talk about money. So when they find someone that they can talk about money to, they're often very excited to do so.
Yeah, no, this is true. A bunch more coming through. Julia, you worried about 22/7 and sharing details with Old Mutual. I remember when it came out. I know folks who were involved in the process. Your stuff is safe. I mean, they at worst, what they might do is give Old Mutual your email address to phone you, but that hasn't even happened to me. I signed up. Was it 2012, 2011? It came out around mid-year. The Old Mutual's got, they're not going to suddenly start peeking in. I mean, it's just not in their interest. Truthfully, our finances are never that particularly interesting anyway. Here's my favorite.
I will say that.
Yeah.
So just a quick thing on that. I absolutely, I will also, as someone who worked there, can tell you that it is really secure. But I do really respect that you are skeptical, because yes. You should be skeptical whenever anyone asks for your money. Well done for asking the question.
Yeah, be afraid. Be very afraid. Sam, here's one that's going to bless your heart. I'm 10 years old and I would like to invest my savings. What do you advise? Forget starting at 25.
I love you.
25 is an amateur.
No. Buy a 3D Switch. No, that's super exciting. I'm so pleased that you are here. I wish I had started investing when I was 10. One of the richest men in the world, Warren Buffett, started investing when he was 11. So
yes,
you already have
him.
a head start. Well done. And my advice to all newbie investors is the same, which is try one of these business smoothie products. But what I would suggest if you're 10 is Easy Equities, which is this really cool local website, has a demo account. So you can go on there and you can start off playing with imaginary play money, which is a good way to a good thing to do until you feel comfortable and you understand what's happening. And do get an adult to help you open a real account. But it would be the same advice for everyone else. You're investing for a very long time because you're 10. You're basically a vampire. You have forever for your money to grow. So definitely put it into something like a good business smoothie product like I spoke about would be my suggestion.
Yeah. And you're ahead of Warren Buffett, and I think he's the 4th richest man in the. Yeah, anyway, in the top 10 is good enough for me.
Oh, but do save some cash to buy me a Ferrari later, because if you're starting now at 10, you are going to be so rich.
You are going to be so rich. A bunch of comments coming through about it should be part of schools. Some people love your book. No surprises there. Tons coming through. Question about the SAB BEE shares. Is it worth investing? Lauren's short answer, yes. There might be a bit of a price spike as everyone rushes in. A couple of points I'll make is obviously individual stocks, so there's a little more risk than that smoothie that Sam spoke about. But what I like about BEE shares is you get them at a little bit of a discount, and I've never met a discount I didn't like. There's no certainties in life. I mean, could people en masse stop drinking beer? I mean, they could, right? I mean, we'd never heard of pandemics a year ago, so it is possible. But yeah, I do. I like it. I actually did a podcast about it. It's out this morning. You'll find it on Just One Lap. Sam, a question which I really like: is there such a thing as good debt?
Yeah, definitely. So when you are able to use debt to buy an asset, and it's always a bit scary to do that because you are consolidating your risk, and leverage increases your risk like astronomically in math ways that are weird. But if you are using debt to buy something that you really, really value, that you do think is going to grow in time, then sure, it can be good. So specifically, I think that often student loans, if you are very thoughtful about why you are studying what you are studying, and you are very realistic about how that will increase your earnings, I think that can be a really good form of debt. Specifically in South Africa, we have NFIS loans. Yes. We hope one day fees will fall, but until they have, NFIS loans are fantastic. They are really low interest rate loans, great type of loan. I think in certain cases, taking out loans to start a business, if you are able to somewhat protect your personal assets or are comfortable about the realistic risks you are taking on, that can be good debt. It's very hard for many people to start businesses without debt. Your other option is to bootstrap, which is what I did when I started a business, because I am terrified of debt. And debt to buy a house mathematically often comes out as kind of neutral, as long as you stay in that house for at least 10 years on average in South Africa. It usually works out that buying a house that you fund with debt will work out over time to being sort of equivalent to what you would have paid on rent if you would have paid the same amount of rent. So you're not using the debt as an excuse to buy more house than you would have otherwise.
Yeah.
So those are 3 specific times. Simon, is there anything you would add to that?
No, that's what I would have added to it. I mean, education definitely, and even not always necessarily as an 18-year-old or as a 10-year-old. Maybe you're 40 and you want to re-educate yourself or get ahead. Be realistic. I take Sam's point. A house, but don't do. My wife and I moved to Joburg. We'd been living in a 1-bedroom house in the hills of KZN because it's just the 2 of us, a couple of dogs and some cats and a horse, but the horse had a stable. And we came to Joburg and the bank gave us a loan. So we basically made the house fit the loan, which we then had 4 bedrooms. And there were still only 2 of us and a couple of dogs and a cat, and the horse still had its own stable. A last question, because we've hit time and because I don't have a very good answer. Emmanuel's asking, how do you manage money in a relationship? I'm more conservative while my wife is carefree. So in my case, my wife is the conservative one. She would not spend a dime if she could. I'm the carefree one. I mean, I don't know. Same, relationships are tricky. Throw money into that pot.
So I encourage you to go onto my website, and I wrote a long blog post about this topic about a month ago. So I would encourage you to read that. I think that we often think that, sorry, my thingy keeps falling over. We often think that money should be unemotional and we should be unemotional about money. But the reality is that when you're talking about managing your money, you're talking about quite deep questions about what do you value? What does a good life look like? So, someone like Simon who's more carefree, that means that you value experiences, you value those things in your life. And so money is always going to be a part of any relationship, because when you are arguing about money, you are often really arguing about values. and you're arguing about quite deep questions. So I think I don't have a quick answer, but the long answer is it is worth being very thoughtful about what you are actually talking about when you talk about money. And a very practical first step for many people is to make a financial plan together. That is the expression of both of your goals. Often that plan, you're just going to throw it away, but the process of making that plan together and the conversations that it can open up can be really powerful and helpful.
Yeah, that a great answer. That's why Sam Theophane, go to the website, sambeckmessenger.com. I'm going to quickly run through. Would you pay off your car as soon as possible? Yes-ish. I mean, again, it depends how it stresses you. Balloon payments I hate, but yeah, car debt's not too expensive. And as long as it's not like the Ferrari, which someone's going to be buying Sam at some point. We've got a 15-year-old. Should it go local or offshore? You know what? At this point, you're 15, you're starting, you're so ahead of the curve. Local or offshore is not really going to be the issue. Sipo, you're worried about unit trusts. If you're worried about the price, things go up and down, as Sam says, in the short term. You zoom out, they go up. If you're worried about what's in them and the costs and the like, I'm not the biggest fan of unit trusts. They're a giant industry. But if you, again, to the point, when you're, we live in the future, and if something makes you uncomfortable, we'll change it. We can, and there might be a little bit of a cost associated. Maybe you've made some money and there's tax, but rather sleep well at night. That's always the important point. Julia, when does Monday podcasts come back? Yeah, in time. I can promise you, I have not forgotten, I have not neglected, I have not abandoned, I have just not found the answer. But I'm young and I'm patient. Well, I'm not so young, but I'm patient. I promise I will. The other 90%. And then Sam asking what happened to your podcast.
Basically it was taking up so much time, and so I have ADD, right? So I basically I can only motivate myself by doing new things all the time. The podcast was a really fun experiment, and I am now doing other things. I guess if we can find a sponsor, I think we will make another season at some point. I do still have a podcast that I do with one of my best friends, Simon Dingle, about once every 2 months, called Take Back the Day, which is about productivity. It's not about adulting. But thank you for that question, because that tells me that someone listened to the podcast, which is always good to know.
No, the podcast was epic, and I love the one that you and Simon Dingle do, Take Back the Day. What I love almost most about it is it's completely random. It just pops into my feed. None of this, when I do a podcast, I'm ADD, but I go the other way. I'm also OCD. So when I release a podcast, it's released Monday, 12:30, every Monday, Christmas Day, New Year Day. No, not you and the Dingle. You just randomly drop this thing in.
Just basically whenever we can get our shit together.
Folks, I'm going to leave it there. We've done all the questions. We've run our time. Huge thanks to the JSC for facilitating, and massive. Sam, you're absolutely epic. You're awesome. We appreciate you coming back. Thank you hugely. And to everyone who stayed and
we demystify what goes on behind the therapy room door. Join us on this voyage of discovery and co-creative conversations. This is The Therapy Show, Behind Closed Doors podcast, with Bob Cook and Jackie Jones.
Welcome back to episode 41 of The Therapy Show, Behind Closed Doors, with Bob Cook and myself, Jackie Jones. And this week, we're going to be talking about how do we work with the angry client.
Interesting.
It is. This was one of my big fears, I think, when I first started working in private practice from home.
Yeah, I understand that.
Yeah, I've never come across anything untoward while I've been practicing psychotherapy, but I must admit it was one of my main concerns.
Well, yeah, I can understand. I think having your own office provides us a level of safety and security.
Yeah.
New way.
Yeah, I always felt safe when I was practicing from MIP. Yeah, because there was always somebody else in the building.
That's right.
Yeah.
Okay, let's look at these types of clients. Now, when people talk about expression of anger or lack of emotional regulation, so the person
I've got something in my mouth. Hang on. Oh, that's better. The most important thing to bring out, I think, is the contract you have with the client in the first place.
Yeah.
So, we get many people who phone up or over the years want to deal with anger issues. That's absolutely fine. And that's addressed in the contract. Now, I know anger can come out in the therapeutic process when there's other contracts, but quite often people come because they have anger issues or feel overwhelmed with anger issues. And so there's a contract around that.
Yes. Yeah.
And built into that contract, as I hope, with the therapist, is what's acceptable and what's not acceptable, and spelling out boundaries.
Yeah.
Before they even begin.
I have that in my contract, definitely. Yeah.
What do you have?
There's something about no physical contact or, damaging property and things like that. I have been known on the odd occasion to let a client lob a cushion down my hallway. But yeah, no physical contact whatsoever, basically.
Yeah, and that's really in any contract, I think, especially if you're going to take anybody on who's dealing with so-called anger issues.
I'm glad you said so-called anger issues, because a lot of people that come for me with anger issues, they actually say it themselves. Do you know what I mean? I have anger issues. And it's been anxiety or fear that's been underneath. It comes out as anger and aggression, but I've not found them to be angry at all.
Yeah, well, you're probably talking about a piece of theory. I mean, you're trained as a transactional analyst, so you may think this way, I think. The way you're talking anyway, it's about rackets.
Yeah, yeah.
Now, for those people listening who aren't TA therapists, might not know what rackets mean, but in the world of TA, a racket is a substitute feeling.
Yeah.
So if you weren't feeling angry, what would you feel instead? Might be a question that you would ask at the contracting stage.
Yes. Yeah.
For example.
Yeah.
So quite often it isn't the presenting anger, it's the underlying issues. The anger is the racket or the substitute feeling.
Yeah.
And what's underneath that might be sadness, fear, anxiety, frustration.
Yeah.
Any of these underlying processes. So that's where you need to get to.
Yes. That's what I've found with people that actually come themselves and say, I've been told I've got anger issues and I need to come and, my wife has said, I need to come and speak to somebody because I've got anger issues.
So in the contracting is important though.
Yeah. Oh, definitely. Yeah.
In terms of keeping yourself safe and what's acceptable, what's not acceptable, boundaries, written into your contract, I hear is yours about, and most therapists actually, about keeping themselves safe and what's acceptable, what's acceptable. So that's really important. And anybody comes with anger issues, I think the contracting stage is important in that sense.
Yes.
Another aspect about people who may express anger as their major emotion and the other emotions are missing is an inquiry into a person's history in terms of what's been modeled down to them.
Yeah.
Because if anger was the major currency of the day in the family of origin, then they may have taken on that modeling as a way of making contact or solving problems, or in fact as a way of being.
Yes.
They may have not had any permission to be sad or to be frustrated or to be frightened or be anxious, and being angry was the major port of call, which is why I think the theory of rackets is really interesting in TA.
Yeah.
Because if somebody's got a prominent emotion, whatever it is, we're talking about anger here, then it's the missing emotions which you need to get to.
Yeah. I love the racket system. I use that an awful lot with clients. Yeah. And I relate to it personally as well. You know, as a parent, often we say to our kids, don't be angry, don't be sad, So it's like, okay, I can't be sad and I can't be angry. So what can I be? I can be scared or I can be happy. So we kind of, exactly like you say, we substitute one feeling or emotion for another one. Yeah.
So I think that's really important. And in my experience, it's usually the hurt injury in the child where you get to, the child ego state I'm talking about, developmentally.
Yeah.
That is often covered up by expression of anger, which I need to get to. Now, as I said, it's really important at the beginning here in terms of keeping yourself safe. So somebody lacks emotional regulation and starts getting angry in a very sort of outrageous way, then the therapist needs to move to keeping themselves calm and also feeding back to them.
Yeah.
What their behavior is. So even if you fed back, well, you do, I'm experiencing your behavior is quite scary here. Do you know that?
Yeah.
Example.
Yeah.
Because 10 to 1, what they're doing with you, they'll be doing in other relationships. And probably that's why they've come in the first place.
Yes. Yeah. I think the only one that springs to mind specifically, and it was anger, but it was specifically about road rage. That was the reason why he came, was road rage. He just loses the plot if anything happens when he's on the road in the car. He was traveling long distances. If it was a traffic jam or if somebody cut him up or anything, he would feel himself get absolutely irate while he was driving.
So you might do a bit of educative therapy there about teaching him how to regulate his emotions.
Yeah.
That'd be one thing if you want to do that. Another one would be, if you weren't feeling angry in that car, what would you be feeling? And explore that. So I don't know which way you went, but you could do both.
Yeah, I think we had lots of conversations. It was funny. I think, I don't know whether it was the last one or the one before that, we were talking about art therapy. He was very reluctant to talk about a lot of things. It was like, it was hard work with him, let's put it that way. But yeah, I ended up saying, because he traveled a lot and he was paid for traveling, so he got, a daily rate. So it didn't matter how long he was sat in a traffic jam, he got paid. And that was where the conversation went in the end. I was saying, but you get paid the same amount if you stood still in traffic or whether you're humping things up and down stairs. Have you ever thought about it that way, that you're actually being paid by your employer to sit in traffic and listen to a radio or contemplate your navel or whatever you're doing?
Yeah, that's an important technique, reframing.
Yeah.
I think, working with people who are often angry in the way you described it, it's a really important technique to reframe the way you did there.
Yeah.
Yeah. I think anger, I have worked with many people with anger reduction. As I say, I usually think of rackets, go to substitute feelings, look at the developmental hurt, and look into the feelings underneath the anger.
Yeah.
Okay.
Do you just focus on the anger, or do you focus on the situation around which they get angry?
I nearly always look at, well, they come together.
Okay.
So if you say, tell me a little bit about, when you particularly get angry, or what triggers you in the here and now, where you feel so overwhelmed that you have to be angry and you can't control that anger. Could you tell me a little bit about what triggers you in the here and now?
Yeah.
Like, if that's what you mean by situation.
That's particularly what I was thinking about, certain triggers. I work with a lot of alienated parents where, they haven't got access to the children and they're really angry towards their ex-partner and get triggered really easy around anything to do with that. Whereas, in other walks of life, they're absolutely fine. So it's quite specific with some people.
Yeah, so I suppose number one would be contracting.
Yeah.
Keep yourself safe, boundaries, what's acceptable and what's acceptable.
Yeah.
Contract around that. Number two, if a person starts to get angry, keep yourself calm.
Yeah.
number 3, if they continue to be angry, you need to feed back to them what their behavior is like and how it's impacting them.
Yeah.
And ask them to change that behavior, and also link it in. Well, is this what you're usually like then?
Yeah.
So you're actually getting to some frame of reference in the process in terms of, well, what's happening here? Is that what's happening there?
Yeah.
And usually when you do that, people are able to move to their thinking or their adult place quicker because they put the 2 and 2 together.
Yeah. Another thing I tend to do with them is ask them, how would I know if you got angry with me in the room? What would I see?
That's a good question.
Which kind of gets them to really think about the behavior and what goes on in the body, or sort of thing. You know, like if I said something now and you were angry at me, what would happen? What would I see?
That's right. So that's another good way. I usually head developmentally though.
Yeah.
So I want to find out, well, was it modeled to you to be angry to get your needs met? When you were angry, were other needs not seen?
Yeah.
Did you have to be angry to, get heard and understood? If you weren't angry, what would happen? So I do a lot of developmental work, and usually, as I said, the anger usually is a racket, or it's modeled down to them as a way of getting their needs met.
Yeah.
And often anger, sometimes, and especially with borderline clients, for example, when there's a borderline switch, which is usually involving anger or frustration or attacking transactions at the therapist, it actually usually is a real desire to make contact, but they don't know how to do it.
Yeah. I found that with a lot of the foster kids that we had. It was their only way of communication sometimes.
I think it's really important for a therapist to do that developmental work. But I do want to stress that if this person is getting anger in their room, in the room, I think it's really important for the therapist to say that transaction I said earlier, is this the anger issues that you're talking about that you've come into this therapy to resolve? Because actually the way you're behaving now, I feel quite scared.
Yeah.
Are you aware of that?
Yeah.
So you're shifting them to thinking.
Yes. Yeah. Yeah. Because touching on what you were saying then as a form of communication, the strokes, any stroke is better than no stroke. So you can imagine a young child, if they got attention for being angry or having a tantrum or throwing something, that then becomes kind of internalized, that's if you're not listening to me, this is what I'm going to do to get your attention.
That's right. And in the process, other needs can often be missed.
Yeah. Yeah.
And I think if one person, comes to therapy with one expression of emotion, it usually means that other parts of the self or other emotions are hidden.
Yes.
So you need to get to what's beneath the anger.
Yeah.
When you get to the hurt part of the self and you start dealing with that, usually the healing happens there, and then the anger dissipates, or because the real feelings get dealt with.
Yes. Yeah.
That's the developmental approach. If you stay in the here and now, you definitely, I think, it's important contract and keep yourself safe, keep yourself calm, reframe the process. If you're still having problems, go to supervision, talk to the colleagues about it. And at the last analysis, if you still can't get through that process, you can always terminate the say, well, I find it quite hard to work with you because you don't listen to the contract we make. You keep doing XXX. It's quite scary working with you. Are you aware of that? And all those things don't work.
Yeah.
And pass them on.
Yeah. Yeah,
If-
and again, that's it. And I think, you know, your own safety has to be paramount in that situation. You can't be putting yourself at risk, exactly like you said, in a therapy room.
My experience, though, nearly always is that if you go developmental,
Yeah,
help them understand how the past affects the present,
yeah,
you usually get to the feelings which are underneath the anger.
yeah,
You did mention something I think also is really important, another tack as well, is helping them identify the triggers in the present. So they can work out how the past affects the present and how the present affects the past. So they connect the two.
yeah, yeah. I think that's really important. Yeah, definitely. There was something else I was thinking then. Oh yeah, I know we're talking about the angry client or clients who, you know, with lack of emotional regulation, but there are some clients who find it really hard to express anger.
Oh, that's,
which
yeah.
is completely the opposite.
But it is an interesting one because you do get clients who come and say they have anger issues, yeah, and when they walk in, you can tell they have anger issues because, how can I explain this to you? There's a sort of passive aggressive stance.
Yeah,
And the best metaphor I can think about is a pressure cooker.
yeah,
And usually I say to them, you know, you seem quite angry, even though you're talking, you know, in a quite a calm way or whatever way I say it. But you know, do you have a situation like a pressure cooker, where there's a lot going on in your pressure cooker?
Yeah.
And you're attempting to keep it all in, and then something could happen, then it comes out like a intense fury.
Yes.
And I help people look at what's in their pressure cooker. Because most people don't want to, I mean, the example you gave in the car is an interesting, but you know, people don't want to be angry.
No.
Usually they want to try and solve this. And I think, as I just said, the developmental way. Also, and another interesting question to ask yourself, whose anger is it?
Mm. Yeah. Yeah, particularly when you were talking earlier on about how it was modelled and how emotional regulation was modelled and things like that. Yeah, totally.
Yeah, so they may have been brought into an angry household. The
Yeah.
father uses anger as a way of getting control, for example,
Yeah.
or solving problems, and then the child thinks that's the only way to, you know, act or behave or feel in the situation, and they sort of take on the significant others, you know, actual anger, and
Yeah.
it's not theirs anyway.
Yeah, that's quite an interesting concept to try and explain to a client sometimes. It's a slow burner, that one, I find.
Well, I think if people listening to this podcast think developmentally and help the person look at how the past affects the present,
Yeah.
then you're going to get there, aren't you?
Yeah.
Oh,
Yeah.
flashing of lights have started to appear.
Hello, it's like the illuminations.
Yeah, they are.
We're having a disco, Bob. What's going on?
Yeah.
For those that are listening.
Hang on 1 minute. I've got discos. Let's see if this is better.
For those that are listening and can't actually see it on the video, Bob's lights are flashing on and off. It's like there's a bit of a disco going on in his kitchen.
What's happened? Oh, I don't know. What's happened? Anyway, let's hope that's solved the problem. I'm back again from the people who are watching me on a video. People listening to me.
Somebody doesn't like you talking about anger. That's what it is.
Yeah, I haven't got angry about it yet.
No.
So going back, so I think that developmental is really important to think about whose anger it is.
Yeah.
As well, that's another road to go down. And usually, if those two connections add up, then the client can give back the anger that wasn't theirs in the first place.
Yeah, because learning how to regulate our emotions is a developmental thing. There is a period of time where we learn, you know, how to express our emotions appropriately. And if it's not handled well at that age, then how are we supposed to know what is okay and what isn't okay?
Yeah, so you might actually, as they make those connections, teach them that.
Yeah.
So there's a lot to do in therapy, I think, with people who come specifically with anger issues, and it comes up in the therapeutic process.
Yeah. Yeah.
At the end of the day, though, for people listening, the therapist stroke counselor safety is paramount. So if you really can't get through this, whether helping the person developmentally through this, taking it to supervision, talking about the issues with then you need to, not continue. You need to stick to the boundaries, the contract that you've set up.
Yeah.
That means referring on. It's really important you do that.
Yeah, definitely. Yeah. I don't know any statistics about anger towards clients. It's not something that I looked up before. I'd like to think there isn't many instances of actual physical aggression within the therapy room.
No, I mean, I worked for 30 odd years. And the other thing is, of course, in many cases their anger might be valid. That's the other things. But you need to start tracing back to the context of all this.
Yeah.
So if whether you work relationally or not, might work relationally and say, well, what I do is that I feed back to the person in the relationship in the room. If they're starting to get to angry at unacceptable levels, that I'm feeling scared. And are you aware of this? And these are the issues that you come at in the first place. And that can get perhaps to the here and now issues about failures in relationships and what they do in acting out in other circumstances. Or you can go developmentally, and as they start putting these two connections together and they start healing at the feelings which are under the surface, then the anger dissipates in the present, or you can teach them triggers. But if none of those processes work and you feel you can't go any further, then you need to end it.
Yeah. Yeah, for both parties, because if what you're doing isn't helping any, then it's obviously outside of your skill set, and it's only it's ethical really to refer on. Yeah, emotions are very complex anyway, at the best of time.
That's right. And I always feel like with people who feel trapped and find it very hard to express any other types of emotions, so relationships break down, for example, I think it is important to come to therapy and explore them, but there needs to be a well worked out contract.
Yeah.
And not just to, especially with these clients, not just to go willy-nilly into it. Have a contract worked out and what's it all about, and that'll give you the space to do the developmental work, to trace it back, look at the connections past and present, look at the triggers before you go any further. You've got an actual contract in place.
Yeah, and it's important to discuss that contract as well, and why it's there, the purpose of it.
Yeah, and I absolutely. And you said something very important right at the beginning, and that was about working at home.
Yeah.
Now, if you don't want to see people with anger issues at home, don't.
Yeah.
That's not to people who work in offices where there's people around.
Yeah. And
the other thing, which is, again, I don't know if you hear, but you perhaps can give me some information about this. But if I was a supervisor and somebody worked at home and they were talking about working with some of the anger issues, I'd talk about, well, have you, if you don't know this person, for example, and you haven't worked out contracts, or even if you have you got, have you got it worked out so people know that you're in the room working, that you've got maybe even a button that you could press, and all these sorts of things. So the safeguarding and safety issues for yourself are taken into consideration.
Yeah. I was going to mention that about having a panic button, do you know what I mean, and things like that. But in the early days, when I was, newly qualified and working from home, I think I was much more nervous about it than, potentially what I am now. Apart from I'm only working online now, so that's not a problem. But yeah, I think as time goes on, you get more of a sense of the person when you meet them. Yeah. Yeah, like that pressure cooker. You know, sometimes I suppose it is anxiety when people are twitching and things like that, but you can usually tell when somebody's got that pressure cooker thing where they are starting to get quite angry with you.
Yeah, and I think it's very good practice to tell peers where you are.
Yeah.
To, you know, if you live alone, particularly, I think it is good practice if you can have somebody
Yeah.
who's got a panic button or some ways to talk to your supervisor about this.
Yeah.
Not to just work alone in your house with people with anger issues. Without these considerations being talked about with your supervisor. You're right. I don't know the statistics either. They're probably very rare, and they're really important to talk about with your supervisor.
Yeah, and I think you've raised a really valid point there, that as psychotherapists, it's okay for us to pick and choose who we want to work with. Absolutely. It's okay for us to work with certain people and not with other people. And that's not to say that anybody can't get angry at any point, you know, so we can never be 100% sure, but it's okay to choose not to work with males that have got anger issues if you're a female working on their own at home.
Absolutely. And of course, when you're working with clients, you know, as they're working developmentally, then those anger issues might come up, you know, as you go down the onion, and they're angry because of very valid reasons.
Yeah.
You can help them, you know, express their anger in a safe way,
yeah.
in a safe setting.
Yeah.
That's a different process because
yes.
the angers come up in the therapy development. You've got a relationship and everything else. But if a stranger walks in and says they want to work on therapy issues, I think you need to really think about it in terms of what we've just been talking about.
Yeah. And again, you know, what you said then about, you know, the relationship, I think that's really important, you know, because it's a fine line in allowing a client to express the emotions freely in the room and know what isn't acceptable in the room as well. And I think that, again, is through the relationship that you build with your clients.
And the contract.
Yes. Yeah.
See, I really liked what you had in your contract at the beginning. I don't know whether you actually give them the contract on a piece of paper or something.
Yeah, I sign it and they sign it. It's kind of done deal.
But then you don't, you know, damage furniture, property. You don't, all the things you just talked about.
Yeah.
You've got a contractual process to be able to stop the process in a way. But I do think it's important to talk about these things with your supervisor.
Definitely, yeah.
Especially if you're feeling comfortable or intuitively feel comfortable in any way at all.
Yeah. Yeah. And trust your instincts. If you feel uneasy with somebody, then it's okay to not see them. It's, you know, it's a prerogative that we have. Yeah. Thank you for that, Bob. That was really interesting.
Good place to stop.
It is a good place to stop. Emotions and anger and things like that are perfectly human. You know, we can all do it at certain times. We've all experienced it. Yeah. So what we're going to be doing next time is silence. I was so scared of silence when I first started, Bob.
The use of silence in the therapy room.
That was one thing that I really didn't sit well with me in the early days. So that's what we're going to be talking about, the use of silence in therapy.
Yeah.
Okay. Till next time. Thank you.
Okay.
You've been listening to The Therapy Show, Behind Closed Doors podcast. We hope you enjoyed the show. Don't forget to subscribe and leave us a review. We'll be back next week with another episode.